So let's have a minute silent prayer. So once again, good morning, good afternoon, good evening, wherever you are from, from different parts, different countries, around 16 countries, we are here together with the same smile, EduSkills smile. Okay, keep smiling and take the hard copy if you have. Mavis Brampton will begin with that. Okay, right? Yes. Let me share my screen. Any point of time, if there is some internet issue, if I am not audible, you'll have to send me a message or let me know, okay? Yeah, all technical things. Right. Dr. Salapa, we can start, right?
Yes, please, Father. You can.
Yeah. Okay. Yes, writing skills. Is the screen visible at YouTube?
Yes, visible, Father.
Yeah, you can interact, okay? If you have no background distractions, you can interact, no issues. Okay, and interact. You can stop me anytime because you need to understand. That's the primary motto of the session. Yes. Okay, writing, we'll be beginning with one case note, that is Mavis Brampton. So contents, we'll begin with case notes, hard copy, you have it. We'll go into key issues, skimming 6 stations. I'll tell you where you have to start, how you have to go, station by station, okay? Have your pen and paper with you, even if you don't have a hard copy. And we'll be going into 15 items. I'm not showing you everything here. First 6 we'll show you for this segment. Skimming 6 stations of the case note, selection of relevant case note, writing task and discharge plan, purpose paragraph. Then we'll be, for the next session, I'll show you the contents later. Case notes, hard copy. What you have to do as soon as you get a case note? What are you supposed to do? Anyone?
Go to the writing task.
Writing task.
Make sure of the today's date and your role in the case note, and then go to the task.
One second. There is a full screen seen in the YouTube. Anybody just let me know.
For the that is
It's half. It's half.
Half screen, right?
Yeah.
Half.
Let me check.
Zoom also for the half.
Also half, right? One step. Let me check if I can correct it. It will be difficult for you in the phone. For you, it will be challenging to attend, right? It's a long session. Let me stop 1 minute. Let me check if I can correct it. Since it's a long session, it's better to have full screen. Let me check if I can find it. Let me know if we can see the full screen now.
Full screen.
Now okay, Father.
Okay,
Okay, Father.
even in YouTube.
Okay.
Yes, in
Not yet.
YouTube.
Not yet, yeah.
Okay, Father, no, it's okay.
Yes.
Big summer class.
YouTube also fine, right?
Yes.
Yeah, thank you, thank
Not.
you.
Not yet,
No?
this is
Not yet?
Yeah.
Mine is showing full screen.
now it's okay.
Yes,
Now it's okay. Now okay.
Okay, right? Yeah, thank you, thank
Yes.
you.
yes.
Yes, we start with, otherwise those who are using phone will find it hard to read the things. Yes. So keep smiling. So one more time, could you tell me? I could not get it as I was distracted by something here. What you have to do?
We have to go to writing class.
Initially,
We'll read the.
Okay,
We have
go
to
to
read the
writing.
writing task.
You have to
We
read
will
the
read
writing task. Okay, any other option?
First, we'll read the initial line of the letter, and then we'll go to the
Okay.
task.
Okay, there is another option. First initial line. Why do you read the initial line?
Because we
Date of
want to know
letter.
that to who is writing for whom.
Is your position, who you are.
Okay, okay. Then next.
We have to identify letter, which type of letter is first, whether it is a referral letter or transfer letter or discharge letter. According to we have to plan letter further.
Okay. Right. Let's see now. First thing you have to look into the key issue. Then you can do everything else. Okay. Key issue. What is a key issue? That's the best thing to idea. Just the first idea you should get. What am I going to think about? So examiners are testing whether you can understand the primary problem or primary issue, then supporting evidence of that primary issue, then referral objective. I'll tell you why I am telling this. When I come to selection of case notes, I'll tell you the reason for it. Okay. First thing. So what is the issue here in this case note?
Pluracy.
Pluracy. Yeah. So you have to always make this point very clear and write it down. Always you have to read the case note along with the side heading. Maybe the year chronology mentioned. Now it is mentioned diagnosis. So always read the case note and interpret or create a sentence based on the side heading. Okay. You should connect. The sentence should be created in connection with the case note as well as the side heading. You understand what is side heading? Background, nursing note. These are the side headings. Patient, admitted, discharged. All these are side heading. So now we are, after looking into it, we are going into the systematic stations. First we have done, what is the, please mute. There is one instrument. If you are not interacting, please mute. It is just touching there. No, that's not a big thing. Just mute. Yeah. Now, 6 skimming stations we will look into. Once you have seen the, what you can do is, if you know something about pluracy, what do you know about pluracy? You know, first method of reading. Foreseeing. First step is foreseeing in the first method of reading. FIRST. Foreseeing, investigating, reading, speaking out, and writing, teleprinting. Now, what do you know about pluracy? Whenever you see the issue, immediately you have to foresee what is the issue. That helps you analytical thinking. Anything you know about pluracy in general?
The plural lining is detached from the lungs.
Okay.
Yes.
Anything else? Any symptoms? Any problems
Yes.
or any?
Inflammation of the lining of the pleura. The patient will have chest pain,
Sharpness.
critic
Okay.
type chest pain,
Okay.
sharp, yeah. Maybe
Okay.
some shortness of breathing,
Okay.
maybe fever,
Some
signs of
pressure.
Okay. Good. Whenever you look into an issue, a problem, just foresee the things, whatever you can, whether it is relevant or irrelevant, no issue. Okay. Then first station, where is the first station? This patient has been in your care and is now going home from the Northern Community Hospital, Moreland Island. Now, first station, just to know who are you? Who are you? Then you know whether you know the patient or you don't know the patient. Known and unknown is not a big material at all. That's being discussed everywhere. I'll show you why it is not a big deal now. First, you should know who you are. Maybe you are Saleen, but you are not Saleen as per this. According to the case notes, they give you a designation. First, you should understand who you are. Then go think about others. Are you a doctor? Are you a nurse? Whatever you are. What is your designation? From which hospital are you writing? Okay. You will be employed in a hospital till the end of this exam. Okay. Bonus employment. Second station, the name of the patient. Station 2, name of the patient. If you can ask me now, what is wrong if I go to the writing task and come here? Nothing wrong. You can take any approach, but this is the easiest and fastest possible psychoscientifically assessed way of doing things. Okay, that's why you can use any approach, but this one approach which is easy. Station 2 tells you who is the patient. Who is the patient? Then station 3 already you have seen what is the issue, diagnosis. Okay. Even without that going into the issue, you can go this way also. Here you can foresee as well, no issues. You can foresee here in the third stage also. Is that clear? Write on your hard copy if you have it and follow this method if you love it, yeah, and that will help you. Now, next station, where is the station? Writing task, station 4. Immediately go to station 4. Station 4 tells you type of letter. What type of letter you have to write? Referral, discharge, transfer. Okay, here it is, referral. And to whom are you writing to? Whom are you writing to? There is a difference, right? When you write some, now you may not write so much. Like in our young days, youth days, we used to write letters in inland letters, in postcards. You know, you don't write exactly as you write to your parents. You don't write to your principal or someone else, your superiors. So there is a difference. So whom are you writing to? You should know. Okay. Next. The writing task also tells you, station 4 tells you, why are you writing? Why are you writing? The purpose and request. The first para and the last para depends on the writing task and the discharge plan. Whatever the information given just above the writing task. Okay. So station 4. Additionally, they tell you how long should be your letter. 180. If there are beginners, 180 means always you can be this side or that side, 10%, no issue. It can be 200 words, no issue, but then you should never add anything irrelevant. It can be 170 words, you can definitely get perfect marks, but you should not have left any relevant material. But approximately, it says approximately 180 to 200 means it can be 200, it can be 210 or 190 or 170, no issue. How should you write? Means only the first 25 lines will be considered. Don't write 3 words in a line and go. So write it neatly. Only 25 lines will be considered. More than 25 lines, if you write, that will not be considered at all. Whatever comes after 25 lines. That's also important. Now, this is station 4. We'll be going into detail. You can, any point you can stop me, okay? Okay. I'll never get irritated. You can stop me and ask me. Maybe when you are asking, there are 10 more people who want to ask the same question, but they are having the inhibition. They can't open up their mouth for many reasons. They will also benefit. Okay, station 5. Whatever comes above the writing task. That is, here it is discharge plan. Okay, just the side heading above the writing task. What is it? Station 5. Why are you writing continued? The purpose of your writing is continued. You get more clarity in this particular point. Purpose and request para continued. First para and the last para will be considered from here. You will get your first purpose paragraph and request paragraph, last paragraph from these places, 2 paragraphs here, or the 2 portion of the station 4 and station 5. Okay, that's why I say sometimes you see, next time when I explain, I tell you it's in the station 4. If you have not attended this segment, this portion, first part of this session, when I tell you in the afternoon or next session, the station 4, they will think of railway station 4, right? So that's why we delay sometimes for people to join. Okay, is that clear? If it is clear, you can keep on telling me in the message here. I am just looking at it in between to get some energy. Okay,
Yes,
you can set a thumbs up and just a thumbs up or a heart or anything. Yes, that tells me you are here with us. Yes. Station, yeah. Station 6. Station 6 here. Where is it? Here in the, that's for Rayline, Mavis, Bantam, the name and the age is given. Now, after that, we are going to the selection of relevant case notes. That is station 7, if you want to consider selection of relevant case notes. How do you distinguish between relevant and irrelevant case notes? You know, ask yourself 2 questions or 3 questions you can ask, as I taught the doctors last time. It can be 3 questions as well. Whatever is easy for you. Is this case note relevant to the current situation? Situation means the current issue pluracy and the purpose of the letter. We have not gone into the purpose of the letter details. We are going into it. Okay. Is this case note relevant to the current situation? Current situation, maybe the person has had some temperature long back, 3 years back, when he was admitted to the hospital once. That's not relevant today. It's perfectly all right. So outdated information is all relevant. And whatever is not connected with this particular issue, maybe he had 3 kids and 1 child passed away or met with an accident. That's not relevant now. So whatever the social background, usually in the social background, you will find so many relevant things. Okay. Second, will this case note affect how the reader continues care for the patient? The major thing is this. Whenever you write your paragraph or select the case notes or address the people or use the tense, it should be focusing on the person whom you are writing to and what is or he or she is supposed to do. What the health professional who reads the case note is supposed to do. So you have to answer yes or no to these 2 questions, or I have taught 3 questions when I taught doctors. You can ask the 3 questions as well, no problem. If answer to both questions no, sorry. One sec. Just let me switch off my fan. Yes. So if answer to both question is no, the case note is not relevant, never included. Including one case note will have adverse effect on your score. You will be penalized. And if answer to either question is yes, relevant. Either question is yes, relevant. If one question says yes, you can add it. Okay. When I gave you 3 questions to ask, I also mentioned the semi-relevant case notes, which is not required as of now. Maybe in another stage we can discuss about it. Okay. Now selection of case notes. Tell me what is important. So, but then we will just, for you to understand, we will just read that. What is that? Task, right? Yeah. What is the task?
Refer yeah.
Write a referral letter. 2,
Yeah.
address is there. Okay. Address is there. I'll tell you, address nothing to do. Just copy and paste, put in different lines. The comma differentiates each line, but don't put any comma or full stop. No full stop, no comma in the address. Just copy and paste and make lines. With each comma, 1 line. Okay, then remove the commas or full stops. That's all. Requesting monitor again.
Ongoing care.
Ongoing care. Monitoring and ongoing care. Immediately your question. What is the next? Immediately as you read monitoring, what is your question? What question should come to your mind?
What to monitor?
Yeah, what to monitor? What are you asking to monitor? And ongoing care. What care? Ongoing care. You will have answer then. We arrange for Mrs. Martin, community nurse. You are writing to a community nurse to make sure Mr. Band continues the cessation of smoking. Cessation of smoking with the help of Nicotine and Zyban. Zyban tablets to cease as soon as side effects occur. See what all things to be done are here. Zyban tablets to cease as soon as side effects occur. Both Zyban and nicotine to cease as soon as craving for cigarettes has stopped. Okay.
Yes.
This is writing task. Yes, please.
Father, in the
Yeah.
WhatsApp community, the people are asking for the Zoom link that we share. The
Please.
one
Yeah,
is
you can
like they
share.
are
You can.
showing. Or the one we are asking for, like invalid ID, something like that they are mentioning. But the same
Zoom?
link I used to enter. Yeah, the Zoom link. There's no other
No,
Zoom
maybe.
ID, right?
No. There's maybe a technical issue with the system. Sorry.
Father, there is one number is missing, Father. Those who are you sending last one. There is 3 is missing. Last number 3 is missing. So maybe it was in.
Is it?
Okay. Anita Taj is here. You could just check it
No,
and
I
post it.
think she also, yeah, she also messaged me, her some technical issue or something like that shows the WhatsApp community.
Well, is that message? I passed it. No, it should be. One second. I'm just checking. Okay. Thank you for the information. WhatsApp Zoom link is perfect. Okay.
No, Father,
Anita,
there's the last 993 is missing, I think. That's why.
3 is missing, Father,
Yeah.
there.
3 is missing means not our Zoom link, because our Zoom link always ends with my phone number. I'm just posting it in the main platform. You can just take it and post it there. The real link. Yeah. I have posted the notice at the same time. I'm sending separately the link as well below it. Always EduSkills Zoom link will end with my personal phone number. That is 944-844-1393. Okay. Anita Taj, if you are there, you can just post it in all the groups.
Yeah,
Sorry,
I will
sorry for
message
that.
her. She can't join. She said this one some invalid. Maybe the phone number is not completed while we copy.
9 digit was there only.
Yeah.
944-844. No, what I see in the community groups, it is correct. Yeah, now you posted maybe a different one. Yeah, cool, no problem. Please admit them. Now this is problem, like if people don't get together, now when they come, they will not understand. Okay. Posted, right? Yeah, I thought I just posted this. Right. Cool. Okay. Shall I continue?
Please, Father.
Yes, Father. Okay. Now we send.
Yeah.
Thank you, Father.
Now, writing to our writing task we have seen. Where to go to case note, right? Yeah. Now tell me what are relevant here.
Name and date of birth, definitely.
Okay, name and okay. I hope you can see the screen, right? If I reduce.
Need to maximize for that.
Small.
It's small, too small.
It's not full screen, no, Father.
No, full screen. If you put, I can't highlight. That's why. For the time being, I have put it down. You can look into the case note. I will make it full screen after highlighting this. Is that cool?
Yes.
I don't know whether I can make
Father.
it bigger. Let me check if I can make it bigger. One sec. View. Yes, I can zoom a little bit. Now it is 128. 54. Let me check. Is it better?
Yes.
Okay. Or I make a little more bigger. It will be too big, I believe. 250. Yes. Okay. Is that cool?
Yes, sir.
Yeah.
Can read, right?
Yes,
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 Yes, Father.
Yeah. Now,
Yes, yes, read.
yeah.
Diagnosis.
Next,
Date of admission
diagnosis, date of admission.
and date of discharge also.
Yes, okay. Yes. Then, diagnosis, definitely. Then background. Coming to background, what is important? Pleurisy is the issue. You have to see the medication, monitor the ongoing medication, and after support care. Mr. Brampton has been widowed 25 years. Does it
Not
affect the?
No.
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 Yes.
No need.
Not required. Not required. Yes. And yeah. And has been an active member of the community all our life.
No,
No
not
need,
required.
Father.
No,
No need.
doesn't affect in any way. Is the current president of Probas or Pabbas or Zumas
Not
or whatever? Does it
No.
affect?
not required.
No,
Not
Not
Even if
necessary.
he is the president or secretary or member, nothing doesn't change anything.
Not
She
necessary.
with her husband ran the Sydney. Oh, so sorry, it's not he, it's she. Okay, sorry. Yes, she with her husband ran the Sydney Road News Agency until his death, at which time she retired. Does it affect?
No, dear.
No,
Father.
no.
No need.
Whether she went to her walk with husband or boyfriend, it doesn't affect us all. Attends the local community center 3 times a week to play bingo. Whether she plays bingo or cricket or football, does it
No need.
affect?
Not required.
No
No
need.
need.
No
So selecting case note is so easy. So interesting. Yes. Has been a smoker all her life since 18 years of age.
It's required.
Yes.
Relevant.
It's required.
Yeah. With this one sentence, I will show you the beauty of all the case note selection, constructing sentence, and tenses and grammar. A beautiful sentence. Has been a smoker all her life. Yes. Nursing notes. On Jan 11, overweight. BMI 29 had X-ray. IV amoxicillin with supplementary oxygen. I'm reading right? A medical prescription or case notes. You can correct me if I did it wrong. I'm not familiar with the medical expressions. Yes. Anything is required here?
Yes,
Yes.
Father.
Is the overweight
Overweight to BMI.
BMI
X-ray.
is considered to be
X-ray.
IV
semi-relevant or relevant?
Chest
supplementary
X-ray.
oxygen.
Relevant, Father.
Is it relevant?
Yes.
CP.
No.
Wait,
No,
one minute.
for
X-ray,
I'll
no.
make, we'll put in semi-relevant probably. I'll make all these relevant green, okay? Yeah, we'll put in relevant, okay. Even if our BMI is 28 or 26, does it affect? I don't know. Let's see.
Father.
Let's see in the whole screen how it comes. Then X-ray.
Yes.
Pleurisy is relevant.
Needed.
IV amoxicillin.
Relevant.
IV amoxicillin.
Yeah, supplementary oxygen.
Oxygen required, yes. Essential, yeah. Advice to give up smoking.
Yes.
Yes, Father.
Yeah, that's very important, right? Because cessation of smoking is our target, our purpose. Okay? We request. Yeah, BP 70, pulse 92, slightly raised temperature, now 390. That is on 10th January, okay?
Yeah.
10th
I will
January
give-
2011. Diet advised about nicotine patches should have been down, I believe. Yes. Yeah. Do you require anything here?
Low dietary diet
Yes.
for the overweight.
BP.
Already treated this one.
Low dairy diet.
170, 90 BP.
90
Yeah.
Is
BP and
required?
temperature.
For overweight PMI, we can advise.
I believe.
No, it's not.
BP
Overweight is not considered very relevant. So don't connect with the overweight. You have to connect with the person, community nurse who is going to monitor cessation of smoking and medication compliance and community care. You want me to highlight this?
No,
Yes,
actually,
it's semi-relevant or relevant because temperature is going to high.
Yes, temperature.
This is the norm.
Breathlessness.
It's above the normal range further, so it's
Breathless.
Normal range, eh?
Breathless.
Breathless
Breathless
is
is required.
yes.
Okay. And also always think whether it is outdated. Okay. Breathless, you want to put me? Yes, breathless. Okay.
No,
And
the last condition.
advice nicotine patches.
there is some copying mistake on 12th January 2001 on low diary diet. Advised about nicotine patches.
Yes, relevant.
Yes.
Because it is there in the
Productive
purpose,
cup.
the writing task, it is there. Whenever whatever is mentioned in the writing task is always relevant. Okay.
Yes.
Whatever mentioned in the writing task, don't think of anything. It is definitely relevant. Write it down and circle it and underline it. If nicotine patches, we are asking them to monitor medication compliance. Those things are very, very relevant. Then productive cough.
Hello,
Other
Father.
things?
That temperature of 39 degree is not relevant.
Which one?
The temperature. 39
Temperature?
degree.
Outdated.
Yes.
390?
It's in
Where is it?
The
I didn't get
temperature-
you. Sorry.
The temperature
In the
39
line.
39.
after the BP.
This is not 39, it's 390. Okay, that is would have been 39 degree. Yeah. Is it
It's not
relevant?
relevant. It's not relevant.
It's related to pleurisy science, nothing else.
Signs of inflammation.
You want me to highlight this?
yes. Further,
We'll come
all
back to
these
it.
are
If there is
all
doubt,
these are
yeah, please.
above the normal range further.
All
So
these.
it's
But
further.
let's go. Maybe when I taught, if you attended my previous session, doctor's session, I gave them a backward movement. Okay,
Yeah.
backward from
yes,
last. Now, when you tell me that is the problem here, now you don't know whether it is outdated. Do you understand? Those who attended my session previously, now you don't know whether these values are outdated. If the next
because
date,
they
in the
have
next
asked-
visit, everything is normal, this becomes outdated, right?
Yes,
Yeah.
further.
Okay.
So if you have not seen, you can watch my previous sessions for the doctors. I have given a reverse view, starting from last date. I'm teaching you both today. I'm teaching you both today. Don't worry. Okay. Now, from whatever, that's what I want to give you the clarity. Now you see, if this values, high values here, if in the next visit everything is cool, does it become relevant?
No.
No,
further.
it becomes
No further.
outdated. It becomes outdated. Let's see.
Outdated.
Now, next line. It need not be perfectly fine, okay? Okay, please. If you are speaking there, please mute, okay? Yeah, those are interacting here, put it on. Yeah. Now, next one. We'll come back if there is doubt. Productive cough, sport and culture.
Relevant.
Productive cups.
Productive cups. Sputum culture.
It's
Relevant.
relevant.
Productive cough.
Relevant.
About medical
Relevant.
compliances.
Everything?
It is relevant.
Everything?
Relevant.
Relevant.
Leaves the
Everything is
medication.
relevant.
Okay.
Medication not relevant.
Medication, not relevant?
No,
It's relevant. Relevant.
Apart from silicose.
Let's see. We'll come back. Medication, somebody is saying not relevant. We'll put it in yellow.
Relevant medication.
Huh?
Need to continue here.
Need to continue. Okay. Let's clarify it when we do the analysis of the writing plan. And 13 Jan 2021. This was 12 Jan 2021. There was some copying issues. Okay. This would have been here, right? Yes.
Yes.
Yeah, this way. Yes. Okay. Yes. Well, yes. This is how it works. Yes. Now, deep breathing exercises started.
Relevant.
Relevant. Because pleurisy, yeah. He's keeping to non-smoking regime.
Yes.
Relevant.
Yeah. Using nicotine patches and Saiban.
Relevant.
Relevant. Repeated.
Relevant?
Yes, relevant.
Yes,
Because
that's one.
mentioned in writing task.
Is it repeated?
It's
You
If
repeated.
it is repeated also, that becomes irrelevant. Advised
Okay.
about nicotine patches. Using nicotine,
Yeah,
it is
got it.
relevant because the mg, the values are given here, right?
Yeah.
Nicotine patches and
Yeah.
Saiban. Here it is only nicotine patches. Earlier advised
Yes.
to give up
Nicotine.
smoking and about nicotine patches.
Nicotine
So
patches.
using,
Yes.
now it was advised, now he is using. So it's like this can be,
Yeah, this is do
yeah,
not
this
repeat.
can be, yeah, this, now this
Remove.
what I said, if you come from backside, no, from reverse position, you know, these are outdated. Now when you have to go up
Outdated.
and come back again, now this became outdated because the other value is mentioned here later with Saiban. That's how trick you. No, these are simply very sweet to see how they trick. Okay, so try both the methods, reverse method, whichever is easy for you, you can try. Okay, then to be discharged. Is it relevant?
Relevant.
No,
Already.
it was there, right? If you have kept
Yeah,
here
but
January 12th, already it is there.
Yes.
Repeated, no? Repeated. Already to be
repeated.
discharged is there. So whatever is repeated, always irrelevant. Okay. Outdated, repeated, not connected with the issue, main issue. See, that is done. This is all we have.
Because already we have taken the information. So this again.
Yeah, this is all we have. How simple it is. Now I'll tell you how to analyze the writing task. This is the most important aspect. Okay. Keep smiling. And if you have some snacks or juice, keep enjoying it. Okay. Writing task, discharge panel analysis. This is the prime thing that you have to be perfect. Okay. How sweet it is, I'll show you how beautiful it is. Okay. Now station 4. Type of letter, all these things we have seen already. Okay. And now OET writing task. This is the most important principle in OET competency. Include only the information that helps the community nurse. Only information that helps the community nurse, not your doctor, not someone else. What helps the community nurse? You are writing to the community nurse. Provide safe and effective ongoing care after discharge. Community nurse is going to give safe and effective ongoing care after discharge. Writing task, monitoring, and continued support. Those are the two things why we ask questions. Monitoring what? Continued support. What type of continued support? That should come to your brain. Monitoring for 1. Smoking cessation. Cessation. 2. Medication compliance. They said you should ask them to monitor. What should I ask them to monitor? One is smoking cessation. Second one is medication compliance. Then you look at the, then you have to take that writing task, write it down on it. If you are a beginner, definitely write it in your long book. Then identify all these things, circle it, and do the analysis and diagnosis of that particular paragraph. There is one instrument where a child is disturbing. Please mute. If you are not interacting, please mute. Yes. Third one is continued support. What continued support required? Community assistance. Now we will answer what smoking cessation, then medication compliance, then community, what type of community assistance. Again, the writing task explains these things. So if possible, write it down, okay? You can take a screenshot at the same time. If you can write down, that will be great, because you have a big page where you have space in all the sides, okay? Because we are going to build up again this one. Already we had this monitoring and continuous support. Now monitoring has 2 aspects. Continuous support we have developed into another aspect. Now again, we'll be developing these 3 sub-aspects into more detailed aspects. Okay. Now purpose of writing letter Y. Monitoring what? Smoking cessation, medication compliance, ongoing care. How? How should I give ongoing care? Community assistance. Yeah. Now here, see, medication compliance. For what? For smoking cessation. For smoking cessation. Medication for what? Main purpose is smoking cessation. So that's why I put in brackets. You have to read that way. Medication compliance means not all the medications mentioned. Whatever is relevant only for smoking cessation program. Yes. Then second one, medication compliance, side effects. Cease Saiban. If there is side effects, stop Saiban. Cease Saiban after 2 months. Even if there is no side effects, cease Saiban after 2 months. Okay. Then fourth one, no more craving for cigars, stop Saiban and nicotine. If the craving for cigars stops, both Saiban and nicotine must be stopped. So when I say that I craving for cigars, I remember in one of our medical colleges, my batchmate was the director there in the medical college, you know, and he went to visit the psychiatry department. And one guy came and asked this priest, the director, could you give me one BD? BD, you know, right?
Yes,
The smoking, small, Indians, I don't know. Whether others, Salafa, do you understand what is BD?
No.
It's a roll, a sort of a local, very cheap rate roll for smoking. Maybe cigar is the deluxe. Cigar is, yeah, tobacco rolls. That's very cheap and poor people use it. It's poor people cigar. It's very low graded. You get it for maybe you get 50 BDs for the cost of one cigar. So poor people use it. So he asked the priest, the director, for a cigar. Then the ring man, you know, they have a leader. This psychiatry also, they have leaders, right? The leader came and slapped him and asked him, are you asking for a cigar from a priest?
No, what is
then
called?
He was
What is,
feeling, yeah.
the name of that material?
BD, B-E-E-D-I, BD.
BD.
Yeah, BD. Local cigars. Very cheap rate cigars.
BD.
Yeah, BD. If you search in the Google, you'll find the packets and all those things. And that are rolled by women at home in the villages, no? Manually rolled. And, you know, this man slapped the leader of the psychiatry, that gang, slapped him and said, are you asking BD from a priest? Then he was shouting at that guy, you know, mad guy. Why are you doing this? You should be behaving well. You should not behave like mad people. All those things, advice he was giving. And then he asked, Father, one cigar. Excuse me, Father? Give me one cigar. Yes. So that's how. Yes. Cool. Now you got, see, medication compliance we said here. B here, medication compliance. But from B, we have developed 4 points again.
Yes.
Medication compliance means what? Nicotine patches and Saiban.
Yes.
Yeah, side effect. If there is side effect, you have to stop. Saiban.
Yeah.
Even if there is no side effect, after 2 months, you should stop.
2 months.
Saiban. No more craving for cigars. Just stop anytime. Even tomorrow or day after tomorrow, Saiban and nicotine patches. Clear instructions. This is from this particular paragraph. Okay, this discharge plan. Now, community assistance. What is the community assistance?
Meals.
Nutritious meals and housekeeping. If you want, there are more details here. Meals on wheels and council home help. Okay.
Shopping. Yeah.
Community assistance. So, how beautiful you see this can be analyzed. Then you have each thing to develop into one sentence, or 2 aspects into one compound sentence, or a complex sentence. This is how, especially if you're a beginner, you have to learn. Write these things down. Writing letter is the last stage of your competency. Don't try to write as soon as you start your training. Write letters. You cannot. That will give you a bad feeling for your mind, saying that I can't, I don't know anything about writing. And there are so many messages coming to me. I'm finding writing very difficult. But writing is the most easiest thing if you follow the instructions, I tell you. I can challenge you. And I want people to get 450 in writing. Okay? So beautiful, because it's a small letter. There is nothing else. Small letter, which we used to practice from 5th standard. Writing, not medical letters, but writing letters. Yeah. Even from primary, lower primary, we had to write that leave note, where we had a format and all those things. Yeah. Yeah. And these days, I don't know whether they teach. So third one is shopping assistance, community assistance. Nutrition meals, housekeeping, shopping. How beautiful. This schema, this picture. Okay. Now people will ask me, Father, we don't have time to do all these things in the examination hall. You are not going to do anything of this at the examination hall. Once you have this competency, as soon as you read, all things will analytically flash in your brain. Okay, so in the exam, you are not going to do all these things, but you will do it very fast in your brain. Okay, this is to develop your analytical thinking, professional thinking. Okay, purpose of OET letter, why? It answers why. That is clear, no? Previous thing?
Yes.
Any clarifications? Nothing.
No.
You can stop me anytime. Now, purpose of writing letter. Okay. What is the purpose? Why? Why are you writing the letter? First one says monitor. What should I monitor? Your kids will ask, no, if they are not very happy. Okay, you have not given them pocket money, sufficient pocket money. Then you ask, see, clean there. What should I clean? Where should I clean? Why should I clean? All those yes. Monitoring what? Smoking cessation, medication compliance for smoking cessation. Medication compliance means what? Smoking cessation, you know. Medication compliance, nicotine patches and Cyban, side effects C7 after 2 months. No more craving for cigarettes. Stop Cyban and nicotine. Ongoing care. How? How should I give ongoing care? Through community assistance. What community assistance? Nutritious meals, housekeeping, shopping. How sweet it is, right?
Yes.
And it should be so cool for you. You are all medical professionals. It should be so cool and so interesting. No? Now let's see just the purpose paragraph. Do you need a break?
No.
No, right? After purpose paragraph, you will. Yeah. Purpose paragraph should answer 4 questions. Always I tell you, it should be ultra deluxe, cozy bus travel. Okay. First question.
Yeah.
Context. Who? First question, who? Second one, what is the context? In which context are you referring this person?
Yes.
Okay. Who is being referred? And in which context he is being referred? Why is he referred? Reason for reference. And your request.
Yes.
Yes. So, you have Mrs. Davis Brampton, who name, discharge after treatment of pleurisy, the context, to arrange ongoing community nursing care, and request monitoring and support after discharge. Beware, at this request, you have to mention exactly what is required. Okay, here I have given monitoring and support after discharge, but you will be expanding that monitoring and after discharge, support after discharge. Okay, this is one of the types. You can write in different ways. Okay, thank you for providing ongoing community nursing care for Mrs. Mavis Brampton, who is being discharged today following treatment of pleurisy. She requires continued support with smoking cessation, medication compliance, and community services to facilitate her recovery. You can write different ways. This is one of the ways. How many sentences are there?
2.
2 sentences.
Yeah, even you can write in 1 sentence. Maximum 3, never exceed 3. Never exceed 3. That will cost you on conciseness principle. So how do you say, thank you for providing ongoing community nursing care for Mrs. Brampton, who is being discharged today following treatment for pleurisy is the context. She requires continued support with smoking cessation, medication compliance, and community services. These 3 aspects. Sorry? Yeah, goal. Exactly. Yeah. When I taught doctors, I have taught it as a goal. Don't get confused, because they are in a different perspective. That's why I said, when I know the audience well, I can adopt myself, how they understand, because they are familiar with that goal. So this is the goal, must be clear. And I tell you, most of the letters doesn't have clarity regarding goal, and you lose marks. Maybe your letter is perfect, but if you don't score well in the purpose paragraph, you won't score well. Out of 3, you have to get at least 2 to have a required score. If you don't get 2 here, nothing doing. Whatever you write, your best letter, all these paragraphs, that will not yield you even 300. 300 marks out of 500. Here you can get 3 out of 3, and that they weigh it too much, the purpose paragraph, because you know the principle behind it is doctors are hectically scheduled and they don't have always time to read all the details. So from the purpose paragraph, they should know immediately what they are supposed to do. Then they will attend to the next serious patient and come back and give the details when they are okay, when they are cool. Do you get me?
Yes.
Yes. Doctors will agree with me, right?
Father?
Sorry?
Excuse me, Father.
Father,
Please.
when we are writing the purpose, we can exceed from 2 lines. I mean, we should write only 2 lines, or maybe we can
No,
write
no,
in
no,
4 lines.
no. Principle is this. You can write maximum 3 sentences. I will put it like this way. Line is not important. One sentence, including these 4 aspects, must be there. Line is 1 or 2 or 3, doesn't matter. Okay? Even 4 lines doesn't matter.
Okay.
The introductory paragraph should have these 4 things. 4 wheels, what I explained now. And you can write in 1 compound complex sentence if you are competent, if need be. Or you can write 1 compound sentence and one simple sentence. Or as it is here, you can write 1 compound sentence and another 2 compound sentences. Or 1 complex and a simple sentence. It's all left to you. Any formation. But these 4 things must be there. These 4 aspects must be there. That's all. And later when I tell you the paragraph structure, I'll tell you wordy sentence, how to avoid wordy sentences, how you should be concise. Yes, please. You wanted to ask me something?
Father.
Please.
Hello, Father.
Yes, please.
Please, I have a question.
You can just call me Saleen, okay? No problem. Yeah.
Okay.
Yeah. It's cool. It's cool. Whatever you want to. No issues.
Yes.
Yeah.
Okay. Please,
Yes.
regarding this sentence, who is being discharged? That word, discharge, is not past tense. Is it okay with being?
Being discharged. Yeah, we are coming to that explanation. Okay. In the next grammar part, we are coming to that. Being discharged. Okay. Being discharged is a process, continuous process. We'll come to that. Okay. Passive voice. We'll explain those with examples.
No,
yeah,
sir.
please.
Please, I want to get it right. This being discharged, discharge is a past tense. Is it okay with
past participle? Discharge, being discharged, it is past participle used in a passive voice. I'll be explaining passive voice to you when I come to the grammar aspect. Soon after purpose paragraph, we are going into basic grammar. Okay. Then we'll go to body paragraphs. Is that cool?
Thank you. Yes.
Okay.
Yes.
Yeah, you can definitely. Yeah, please. Yeah,
when
please.
we are writing today's the date, means to be discharged date is the 15th, and we are mentioning there that being discharged today. So that date, about date, and
today,
that.
In this case note, I don't know where I got it. Maybe somebody sent me. In the top, there is something missing. Assume today's date as this date. So today, definitely, these confusions will not be there in your exam. In the top, it will be mentioned what is the date. Assume, they will write today's date is this. As of now, this date is the discharge date is the date where you are writing. Okay. From the context we understand. But in the examination, no worries. Don't worry at all. Don't discuss at all. They will write on top what is the date of this letter where you are writing. Okay. That is today. As of now, this is the discharge date. Discharge date, you are writing this letter. Okay. Is that clear?
Yes, sir.
What is the discharge date? 15th January 2021. In the examination, when in the examination in the top it will be written, assume today's date as this date, 15th January 2011. Yes, 2011. Okay, yes.
Father.
Please.
It will be there. Today, assume today's date is 15th January 2011. This kind of letters, I mean, it will be in every letter will be like that.
Yeah, on the case notes, it must be mentioned, it will be mentioned. Till now, it was mentioned in every case note you got for the exam.
But this one is not mentioning, that's why I'm confused.
This is maybe I did not notice it. I got it somewhere, maybe copying, we missed it. But it will be mentioned.
Yes.
Definitely, it will be mentioned.
And further, one more. One more I have doubt. This one, thank you for providing ongoing community nursing care. So can I write here? Thank you for accepting.
You can write. You can write.
Can I write?
Yes. Yeah, definitely you can write. Okay. All these options are allowed. That's why I said even in the website, what is given, that is one of the models. Okay. And you can have your own way of writing. There are different ways of expressing. I will give you examples as well. Different. And if you have sent me the letter, if you have it at hand, you can send me now live. If somebody is interested to have corrected after this purpose paragraph, you can send me live in the Telegram. Okay. in my Telegram or a Telegram group or anywhere. If you can put it in the main platform, that will be cool. I can easily see it and pass it. So I not go to every chat, right? Otherwise, each one's chat I have to search. If you can put it in the main platform, if you want to correct any of your letters, even with your names, raising your names, I can correct. Okay. Or if you are shy, if you can't put it there, you can put it in anywhere because there are so many. Whichever you want to correct, I can live correct it here. Okay. Yes. And if I didn't see, you can just tell me. Go to the platform and see what are you doing. Yes. Yes. You can shout at me. No problem. So you see, this is the bus. Okay. This is a wonderful bus we have in Karnataka, Madhushiri now. Okay. That's sleep like a baby. The cozy buses. Please mute when you are talking there. Please mute. Well, also you can tell language. If you understand that language, anybody understands that language, you can say in that language.
Yeah. Not in our group, Father. I don't know the language.
Okay. If anybody knows that language, you can reply in that language, ask the request them to mute. Yeah. Cool.
Muted, Father.
Yeah, thank you. It's okay. Sometimes they are all with their hectic programs and headaches with the kids and duty. I can understand, no problem. Okay. Now you see, this like maybe when you go to other states, European countries, go to America, this is the last thing that you will travel with. Okay. But in Canary, in our place, this is one of the super deluxe bus, the best luxury bus where you can travel. So I want you to travel by this bus, not by auto or cycle or other things. Okay. Wonderful bus. You should have this. Who is the patient? In what context are you referring? What is the reason for referral? And what is your request? All these 4 things are there, right? Definitely. Without any difficulty, you can get a 3 out of 3. So, introduce the patient, context is given, reason is given, request is done. Beautiful. Nothing else you need to do. Any referral letter. See, there is no confusion at all. You write any referral letter, other letters also will be showing exactly like this, what is to be included in the purpose paragraph. Only 3 types of letters, right? Only 3 questions you can say. You have to learn only 3 questions, 3 letters. Only name changes and condition changes and other things, details changes. It is given there in the case note. So why confusion? See, introduce the patient, the name, context, pluracy, reason, referral reason, and request. What you are supposed to do. Okay, ICRR we call it. So that is the super deluxe bus. And I need not explain this. Any one of the 4 aspects is missing, you have a auto journey, right? Okay. Yes. Request goal is missing, last portion, and maximum people miss this goal, last portion. We need management, immediate management of what they don't say. Okay, that must be mentioned. Okay, so if you miss any one aspect, you have auto. Maybe you will score 2 out of 3, the sufficient score, but then we can't predict. Depends. If you miss 2 aspects, you have a very bad cycle to go. That's a long journey. And sometimes one connective word you miss. Instead of saying who, you say which. No? Miss Dikshita admitted in Vellore Medical College with what? With some condition, with cancer, okay, with leukemia, which needs immediate assessment and management. That is this cycle, carrying the cycle. Which means not the person. Now medical college, Vellore Medical College requires immediate assessment and management. So I'll teach you that. One word can change. Okay. So purpose paragraph, little more explain relevant case notes included. What are included? Pluracy, discharged, monitoring, smoking cessation, medication compliance. These can be included. These notes directly reflect the writing task and establish the overall purpose. Okay. These are included in the purpose paragraph, what we wrote now. Typical opening. Thank you for providing ongoing community nursing care, or thank you for accepting. All those things you can use. Focus. The reader wants to know why has this patient been referred. That's the main purpose of your purpose paragraph or introductory paragraph. Okay. Sorry. Yes. Going to seventh one. I think you take 2 minutes break.
Excuse
By the
me, Father.
meantime, you can, please. Others can have a snacks or juice, something that you want to have. Okay.
Father, I
Keep
need.
enjoying. And if you are tired, you can tell me. We'll break and we'll stay back.
2
But then
minutes.
you can. Don't disconnect. Yes, because otherwise there'll be a lot of confusion submitting you and all that. Yeah, please ask me. Ask me. Yes.
Yes, Father, I need please a previous slide.
Yes, Father. Me also. Previous.
This one?
Yes, Father. Yes.
Okay.
Thank you,
Yes,
Father.
Yeah.
Thank you, Father.
Yeah, I can even send you the PPT if you want. Don't worry. Because we are not going to do business with these things. So, yes. Did anybody send anything in the main platform for correction? No. Yes. You can break 2 minutes. So by the meantime, if you want to ask me something, you can. So we are growing from scratch, okay, from scratch, even the beginners or advanced, both the people can benefit. If you're a beginner, don't do anything else, go with these steps. That doesn't mean you have to do at a stretch. Just take the case notes and find out the stations, enjoy, then go back and do your kitchen duty and come back after 3 hours, then do the next step, no problem. But enjoy and do it.
Hello, Father.
Yes,
Hello.
please. Yes,
How are you?
please.
Okay, on the previous this is the introduction. I tried to apply this why the reason and request. I found the reason and the request is the same in the last sentence. Can you?
Right. Do you want me to go back
Yeah, sorry, please. Sorry.
to this one?
Yeah, I found that like the request and the reason is the same thing. I feel it like this. It's okay
Request
or?
and she
Yeah,
requires
I found
continued
that.
support with the smoking cessation, medication, compliance, and community service to facilitate her recovery.
Yeah, is it the reason and the request is the same
Reason is
thing?
no. The order may be changed here. That's what I said. You can put in different ways, but then ongoing community nursing care must be there in the beginning because immediately apparent the purpose. No, we are asking a community nurse for ongoing community nursing care. Here, what you have, the purpose is the person is what is the context? What is the problem? Is given here. She requires continued support with smoking cessation. That's what I said. This will appear in first paragraph and the last paragraph. That's what you're asking. Purpose paragraph and request paragraph. Specifically, you have to request these details in the request paragraph, your final paragraph.
Okay. And the reason that who is being this
being
discharged following the
yes. The reason is person is being discharged now. What is the context? Context is pleurisy. After treatment for pleurisy.
Yeah.
Why he needs? What is the reason? What is the reason he needs now community care? Because he is being discharged.
Yes.
Right. Yes.
Yes.
He is not sent for a referral just for a referral for the time being, and he will not come back to this same clinic. Now we are sending person back. Okay. Referral. Yeah.
Excuse me, Father.
Please.
Thank
you.
Is it okay to write? I am writing to refer Mrs. Marvis Brompton to ongoing community. Yes.
Yeah.
Is it
Ongoing
okay?
community care must be there. Yeah, definitely you can write. That's why I said options are very. Yeah.
Okay.
Thank you. Yeah, you can write. Those thank you doesn't mean thank you. Okay. One sec. Thank you doesn't mean thank you in English in the literal sense. Do you understand what I mean? Let me come back one sec. See, sometimes, for example, in English, I say, Maybe if you go to the airports, if you ask them, is it the place I have to stay or is it the gate I have to be in? They'll say, you are good. You are good. What does it mean? You are right. You are in the right place. So also, for example, somebody asks me, would you like to just, I would like to discuss something with you now. Somebody calls me and asks me, then I'll say, I'm in a meeting. I'm in a meeting. It doesn't mean I'm in a meeting. That is a word used for I'm engaged. I'm not available now. I may be sleeping or I want to take rest. That doesn't mean I'm in a session or something. Okay. So don't go by the word meaning. Is that clear?
Yes, Father.
Yes.
Father, I
Yes.
want. Excuse me,
please.
Father.
Yeah.
If we are writing the request in the purpose, so we will write the request later on also for the last paragraph. So it is okay?
Request, no, you have to mention it here in short. In later paragraph, you will be giving in detail. I'll show you how you will give in detail. Okay, when we explain that, here we have given in general terms. Did you understand?
It is not repetition here.
No repetition. That will tell you how you will write without repetition. Here, you have given it in general terms. Continue to support with smoking cessation. In the request paragraph, you will say details. What I gave the analysis. You understand? The task analysis I gave you with the different points. Those things you will be writing there. Now you see, smoking cessation doesn't mean a medical compliance. Doesn't mean everything, right? It's general term. But in the request paragraph, you will detail it and tell them, what do I mean by medication compliance? What do I mean by community services, meals on wheels, shopping, housekeeping? All those things will be mentioned in the request paragraph. But here, these 4 things are mandatory.
Mandatory. Okay, thank you, Father. Thank you.
Here it is in short, there it is detailed.
Briefly. Okay.
Yeah, here it is in short. Okay.
Thank you, Father.
Okay, you're welcome.
Father, I have sent a letter in the meantime.
Thank you, Father.
Okay. Yes, sorry. Yeah. Till others come back, you can ask me anything. Okay. Yes, I am just collecting the letter.
Father, in this letter.
Pardon?
Yeah. Am I audible,
Yeah.
Father?
Yes, please.
In this letter, in the purpose paragraph, it is nothing anywhere mentioned about the referral of this that we are referring
in this letter.
Yeah,
that's what I said. One way is to say I am writing this letter to refer. But the another way of saying is thank you for providing ongoing community care for Mr. who is being discharged today following treatment for pleurisy. That itself means he is getting discharged today, and I am sending the person to you.
Okay.
The other one is template. You can write the typical, I have somewhere I mentioned it, right? The typical introduction. Where is it? One sec, I'll show you. Am I sharing the screen? Is the screen visible to you?
Yes, Father.
Yeah. Like typical opening can be this way because that jargon means same templates. Thank you for providing ongoing community nursing care. Or you can write, I am writing to refer Mr. Brampton. Somebody asked me now. Okay.
Yes.
For ongoing community care. That must be there. After Mr. Brampton, what is the main purpose should be there. That's what the criteria called. The purpose should be immediately apparent. Immediately apparent means immediately clear. You can write even 10 different types. There are different expressions. So no one can say this is the letter, this is the right way. Do you get me?
Yes. Thank you.
Yeah. That's what sometimes you need some corrections. Only thing if the meaning changes. Otherwise, however you write, it doesn't matter. That's the only way then you can say the perfect way is ISBA. Approved way. Otherwise, anything is okay. Yeah, let's see one somebody had sent me this when I copied monitoring and management in relation to smoking. Paragraphs have to be separated. Yes, this is the letter. What do you say about this introductory paragraph? This one. Give me your suggestions. What you have learned from what you have learned just now.
Saying is like already it has been seen.
Seeing continue.
Seeing Mr. Brampton, Mrs. Brampton, okay. Mrs. Brampton, a 72-year-old. You don't require 72-year-old actually repetition, right? It's already mentioned here. If you want, you can write. There is nothing wrong. That's why I say write and appreciate it. Do you require when it is mentioned here already in the real line? Even if you write, there is nothing wrong. But you should not exceed the number, that's all.
You're repeating again the number.
Yeah, already they have read it here, 72-year-old. But some will put the argument because doctors may not read all those earlier, only purpose paragraph. In that sense, okay. So there is nothing big harm.
Hello,
Who
Father.
has been? Yeah, please.
Okay. Please, I have a question.
Yeah.
For the numbers of lines to be right, so you said 25 lines. Is it after the address that you count that 25 lines?
There is no 5-line rule at all.
25 lines.
So 25 lines, yeah. 25,
yes.
25 lines, this body of the paragraph. Body of the paragraph.
Okay, after the address.
Starting from dear community nurse, till contact me for further feel free to revert for further details. Okay.
Okay.
Yeah, address is not counted there. See here, there is a spelling mistake. I don't know whether these mistakes will be counted. Okay. Please mute. Please mute. See, spelling mistakes of medical conditions, they will penalize you because you are a medical professional. You should know the spelling. Okay, definitely correct the spellings. So, similarly, suffering from pleurisy symptoms and requires monitoring and further management in relation to smoking. Community care is not included, right? Maybe somewhere you can include in one word the community care, community support required. In one phrase you can add here. Now give me your assessment of this introductory paragraph. You can see, right?
Repeat it, right? It should not be repeated in the introduction.
Okay.
The age.
Yes. The age, yeah, that's what we mentioned. We discussed it.
Yeah.
Sometimes there is an argument saying because they may not read here, but usually they will see the full name here in the ray line. So it is a repetition. But you will not be penalized, I believe, but it is not appreciated. Repetition is not appreciated. Yeah. Anything else? Please mute. Those who are not interacting here, please mute. Come on, fast. Are you all there? I can't see you. So unless you speak, I can't see you. Okay.
Oh, we are here, Father.
Let me stop sharing and see whether you are there. Okay. Okay. And yes, somebody is waiting. Yeah. Please. How many of majority are not in YouTube live, right? Please, would you just click on the link? I'll share the link. Okay, one more time. YouTube link. I'm sharing in the Zoom classroom chat room, okay? And those who want to be beginning the training from August batch, this is going to be the best beginning as regards writing, okay? This will give you clearly, even looking at them. And remind me, in the last session, I'll give you the links to join the new batch as well as the writing batch, okay? They are really serious learners. And this is not appreciated. When you give some instructions, basic instructions you have to follow, right? Otherwise, how can we train you? Now I'm asking you to just send a comment in the YouTube comment space. It doesn't cost you anything. If you aren't ready to even do that, how can we support you? Because we need to continue our mission, right? I'm posting repeatedly in the Zoom chat room, the message, and till the end, don't exist from YouTube comment, this one, YouTube live, okay? If you have a second instrument, join from there. In 2 minutes, yeah. When you have reached, send a message in the YouTube comment space so that I know you have reached after your snacks. Being a long session, we need to adjust all these things. When you get exhausted, you just tell me, okay? Because I never get exhausted with such wonderful topics and materials.
Excuse me, Father.
Yeah, please.
While writing the address portion, I have one doubt. Shall we need to add the in front of the Brownswick Family Care Clinic, or just need to write
Nothing.
the name?
That's what I said. Simple principle. Just copy and paste in the address. Nothing to be added. Nothing to be deleted. Just copy and paste means just take what is given in the writing task, and that comma tells you after the comma what comes goes to the next line. So put in different lines, and no comma, no full stop, no addition, no deletion. Exactly copy and paste.
Okay. The numbers
Nothing to be added.
Write on the last line, right? If they give like a code, something 3056, we can write in the last line. Otherwise, we should add with the.
Yeah, comma. No, you don't think of anything. There will be comma dividing each aspect in the writing case note.
Okay.
1 second. I think you came a little late, probably. We are mentioning it. I'll show you. 1 sec. Okay. Yeah, I am sharing it here. See. Writing task is here, right? Can you see my screen?
Yes, we can see, Father.
Yes, Father.
Okay. Copy. I'll copy into a new slide. This is writing task. Okay. Last portion of the case note. Last side heading. What is given here? Address 2. Write 2. This is the address till this number, right?
Yes.
You have to just copy it. In the sense I am mentioning copy means you are right. You just see it, copy it from there here. What you have to do? There is a comma here, right?
Yeah.
The next line.
Okay. Yeah, that goes to the next line. Okay. Then next comma. With that, it goes to the next line. Okay. Nothing worrying. No, don't think of anything. That with that next comma, it goes to the last line. Nothing else to be done. Remove the comma, and comma tells you that the next thing should be in the next line. Nothing else. Don't add anything. Don't delete anything. And ultimately, that is not being assessed. There should be a format that is not going to be assessed for your score. But then format should be respected. That's all.
Yeah, thank you, Father. Thank you. Okay.
Yeah, you are welcome. And you know, the challenge I am facing today, you will be there. Next session, you will not be there. After 3 sessions, you will not be there. You will not know exactly. And the problem is that otherwise, within a couple of sessions, I can make you perfect in writing. There is no confusion at all. These things are very clear. And it's a simple letter, a professional writing, a referral letter, discharge letter. Oh, there is no much difference, basic differences.
I believe I
Yes.
knew our question, Father, because also we have heard if there is, for example, number following the street or city, you should separate it with comma. This is what we have heard before. Yeah,
No,
but now
no.
it's clear. Yeah, no commas at
Yeah.
all.
Yeah.
Yes,
Whatever
yeah.
commas are here, that's all, nothing else. If you do anything else, that's going to be wrong.
Yes, yes.
That's a principle. That's a principle. Okay.
Father?
But then if it is written Victoria, if it is full, VIC
Yes.
full is written Victoria, probably there would have
Yeah.
been a comma. There would have been. If it is there, it will be there in the task. You can understand from there. You will
Yes.
not be penalized for that. Do it exactly, copy and paste, remove the commas, and no full stop. People feel there is a full stop at the end. No. Full stop comes after the sentence. There is no
Yes.
period, comma, full stop put after the address. Not required. Yeah,
Yeah. Now
Father,
this clear.
please. Yes.
the community nurse we need to write in the address, no need, right?
Address no need. That's what I said. Nothing, no additions.
Okay, Father.
You can just take the address from there. Okay? And copy and paste. I am just looking for something. Let me find. If I can find, I will show you clarity for clarity purpose. You are right. You are asking me who has to addressing. That has to be written. Okay, community nurse, it is mentioned there in the task, which I did not tell you. I was clarifying the comma. Community nurse is given in the task, right? Whom are you writing to?
Yes, Father, but it is, I think
No,
later it is
you are asking
community.
me this question. Here you have community nurse. Here I did not mention. I was just showing you. You have to remove the comma and differentiate the lines. But whom are you writing to? It is mentioned there. To, where is
Community.
it? Somewhere it was mentioned, right? Because to. Now, okay, it is, where is the community nurse mentioned? Here somewhere.
Mr. Palankan, later that community.
Fourth line.
Community nurse. Yeah, community nurse. This one, the community nurse. When you, if you are separating it from here, it has to be the community nurse. But I am telling about the address. I'll just come back to. I'll just searching for one. I'll give you clarity. One sec, if I can see get it.
So we no need to add the community nurse in the address, right, Father?
I'm getting back to you. One sec.
Okay.
Give me 1 minute. Sorry for the delay. One second, I'm getting.
Okay, Father.
Yeah, friends, in meanwhile, you can write some comments on the YouTube. What you learn now, you can just comment in the YouTube comment please.
And only 27 people are there in the YouTube. Please join. Please help. We'll give you 2 minutes. By the meantime, I'll get ready this one. I am searching for a link. It will give you clarity with the PPT. Then I'm telling you.
Further, is there any ways to find is it the letter is informal or informal or like professional?
Professional, the only way approved way is ISBA, nothing else. There is no other benchmark where you can refer whether to see whether it is professional or not. And you have to use the professional language. There are 3 types of language: academic, colloquial language, academic language, and professional language. You are supposed to use the professional language, not even academic language. That's what you asked me?
Sentence formation in that point.
Sentence formation, yeah, in the sentence formation. Professional means medical professional terms should be used, professional terms. Not in speaking, colloquial language. In OET, only in OET, not in other things like IELTS and all, you need academic language. Only in OET, you are speaking to a patient, right? So only in speaking, you have to use layman's language. That is colloquial language you can use. But other modules, you have to use professional language, not even academic language. Do you get me?
Yes, sir. Thank you.
Further, I will try to share Zoom link on the YouTube space.
Yeah, you can. Yeah. In the meantime, if you have to ask something, you keep asking me. I'm listening to you and getting. I thought of showing you one thing so that there is clarity, because that being asked repeatedly, the questions, right? So if you see the PPT and listen, you will understand better. Any other concern?
Hello, Dr. Saleen.
Yes, please.
I have a question.
Yeah.
If in the address it's written that I'm sending to emergency registrar and to the emergency department,
Okay.
in the address, shall I put the emergency registrar or just emergency registrar as it's written in the writing task?
Yeah, I'm going to answer it with a PPT with visuals, okay?
Okay, thank you.
Because you will understand better. Because you see, the question has to be depending on which case note, right? What is the targeting task given? What is given in the case note? You cannot bluntly answer the questions because what has to be added, what is given in the case note is important. You can't add anything which is not given in the case note, even in your interpretation or writing sentences or addressing whatever. So I'll come back to you in a minute. That I'm going to answer the same question, right? About the address, right? Yeah, I'm going to answer it now with visuals here, so that it is clear to you. Any other concerns?
Father, in purpose, there is written, she requires continuous support with smoking cessation, comma, medication complaints, comma. The comma is important, Father?
No comma, no. Comma should not be mentioned. Comma should not be given at all, mentioned at all. No comma at all.
The and before the purpose paragraph, Father.
Purpose paragraph. Okay. Where you are mentioning about the comma?
And before and it was mentioned comma. So is that needed, or if we will not mention it?
Okay. Before and there should there be a comma? Okay. Before and you can either mention a comma or you can go without mentioning. Okay, if you are mentioning, you have to mention throughout your letter. Okay. That comma is known as Oxford comma. All can write it down. Okay, Oxford comma. Okay. Before the conjunction, there is a comma. If you are writing an exam under Oxford University, you must include it. But for OET, since it is under Cambridge University, either you can include comma or you can write without comma.
Okay, thank you.
Do you get me?
Yes, Father.
It's your option.
Okay.
Whether you want to put a comma before conjunction.
Yeah, last life Father informed like that, but I have confused.
Yeah, confused. Yeah, the comma. The only principle is this: if you are using comma, you have to use the comma before conjunction throughout your letter. Okay. If you are not using comma, don't use your comma throughout your letter. If you one sentence you use, another sentence you don't use, both will be wrong. Okay. That's the international principle. This comma is known as Oxford comma. But if at all you are writing an exam under Oxford University, definitely you have to use it. Let me stop share and share once again so that I optimize sound. Are you all here?
Yes, Father.
Yes, Father.
Yes, some sound you have to create.
Father.
Yes, sir, we are here.
Yes, Father.
Okay. Now you see, this video I am playing is just 5 minutes video where you have almost everything about this part. Okay, just listen now. Just hardly 5 minutes.
What is to be written? You have to take it from.
Okay, one second. Is it audible?
What is next segment? So next one is. What is next segment? So next one is.
Yes, Father.
Yeah, you have to. There are 5 letters given.
Is it audible?
Yes, Father.
Yes, Father.
Okay.
Yes, Father. Yes, Father.
Sample writing method. Address. Okay. The reference is, you have to see the OET sample writing materials. There are 5 letters given. So address, what is to be written? You have to take it from writing task. But when you take it from the writing task, it is in a single line. So they have put comma after each segment. When you write in address format, remove the commas. After each segment, no full stop, no comma. So be mindful of these 4 things. Exactly copy and paste from writing task, the address given, remove the commas, put in writing address format, and no full stop, no comma. Is that clear? So the first portion of your letter is no confusion. Number 1, address. And this will be written like this. So you can see the address here, comma removed, full stop, no full stop. I have put the name in brackets, don't put in brackets. Only if it is given, you have to write no brackets there, okay? That is to mention, if the name is not given in the writing task, no name, you start with the designation. See the reference. This is one of the letters, official letters, Peter Dumber. See how they have written exactly. The first portion is address. So that is the final reference for you. After address is number 2, the date. Two things. One is right and other one is appreciated. Both should be correct to select the correct format, date format. For example, 19th January 2019 is the correct as well as appreciated one. How do I declare that as the correct? Sample letter. All the sample letters you have this model. This is the sample letter. And it is written as the second segment. First is address, second is date, and the mode of writing, the format of writing the date, spell out the month, then the year. So you know the final format. 2 segments are over. What is next? Salutation, okay. Dear nurse or dear name, do you need a comma after that?
No comma.
No comma.
No.
Because you just refer the model letters and find there is no comma. Okay? So ultimately, that is the final reference for you. Then try ray line or reference. Next one is 4th one, right? 4th one, reference. You have to write the name, then DOB. What is the format to be written? The model letters give this format. Ray, full name, okay? First name and surname, full name. Then DOB. There is no full stop between DOB. And final reference for you. Now what is next? Line you have. Did you understand?
Okay. Okay, Father.
This is the exact
Yes,
copy.
Father.
What you are seeing on the screen is the exact copy and paste of the model letter given by OET in the official site.
Yes.
Thank you, OET, for allowing me to use this for teaching purposes. I am giving all this evidence not to tell you, don't say this format is wrong. That's not wrong. It's right, but not appreciated. That's the difference. What is next segment?
Purpose para.
Purpose para.
Purpose para. Purpose introduction.
Purpose para. And how do you write the purpose para?
4 questions.
What are the 4 questions?
You need assistance.
From whom she or he requires assistance.
This is for the benefit of beginners. Now here, who is
that is being explained to you, right? Now, why I showed you this? Because, are you listening to me?
Yes.
Hello?
Yes, Father.
Yes, Father.
Yeah. Now this is 4 segments of the letter explained in this 5 minutes. But you will see all the 4 segments in detail explained in 5 minutes videos in different videos. So every segment. Now why I showed you this is because you can't say something is wrong or right. Something is wrong or right. Maybe it is right, but not appreciated by OET.
Yes,
Linguistically right. Why should we go for that? Let's go for what is appreciated. For example, Varsha says, okay, it's okay for me, tea or coffee. Both are okay to me, but I like tea in the morning. Then should you give her coffee? No, she takes both.
But which
Both
she
is
likes.
okay. Yeah, but she likes. So also OET appreciates. And what is the evidence? The model letters are the sample letters are given. And I am showing you the evidence. That is the offline session like arranged by our admin Anita Lobo from Anglo. You know, like we had nearly 300 students online attending and the offline students simultaneously. That's why you could see them on the screen also. There were 3 screens. So what I'm saying, see now why I tell you with this clarity, because I don't say something is right or wrong. I can teach you different things in English. Even better English I can teach you. But then what OET appreciates, I must know from the model sample letters. That is the ultimate thing given to you. In the sample letters, if none of the 5 sample letters show something, why should you add it? Those sample letters are assessed by both medical professionals and language professionals. It's already corrected and posted in the website. So make this difference between, otherwise you will say, oh, Saleen was teaching this, or Saleen was teaching this, but someone else was saying that. I don't say something is wrong, but what is appreciated. I don't say, somebody said, as soon as you take the case note, go to the writing task. Nothing wrong. It's your freedom. You can go anywhere. Right? The whole case note is here. You can go anywhere. Whatever is easy for you. But I gave you the stations so that there is no confusion. Not only that, you have a psychoscientific dynamics in understanding and learning and processing the knowledge. So this helps. Okay?
Yes.
Yeah.
Excuse me, Father. Now, I just came across one debate and we didn't get anything in the sample apart from one letter in the new book, the OET trainer. This is regarding when writing the address, I mean the date, if it is a single number, for example, second or third of the month. Do we need to add 0 before the number, or for example, to add the suffix
0.
ST? Yeah.
0. Yeah. It is both like a comma, Oxford comma. Whether you add it or not, you will not be penalized. Now, adding is a safer option legally, even otherwise. It is a safer option because if it is between, somebody can add one number there. That doesn't happen in your OET. That's the purpose of putting that 0 there. Otherwise, for example, I am writing, I have to give you 2 acres of land. Okay. There is some space. I have not put 0 means some space. Varsha will add one there. So I have to give 12 acres of land.
Okay.
Do you understand?
Yes, yes.
See, 0 is put, nobody can add a number there. Yeah. That's why. Otherwise, both are cool. No issue at all. Yeah, if you feel comfortable, you can put the 0 and write. And that is, for me personally, I say put 0 and write if it's a single number. That is cool. For example, in the list I sent you, you will see 001, starting registration number EDU 001.
Yeah. Yes.
Yeah. Because I know it's 100. The capacity is 100. You can go above 100. So it starts with 001. Otherwise, I can just say U1. Doesn't make any difference in the value.
Exactly.
But that's a standard way of doing it. That's all. Professional way of doing it.
Thank you.
Yeah. Welcome. You're welcome. Yes. Thank you, Dr. Salafa is supporting and helping so many people. I sometimes wonder how she finds time for all this, being a doctor. Yeah, that's great. Yeah.
Thank you, Father.
Yeah, you're welcome. And my suggestion is maybe if you can have the interactions maximum in English, that would be great because, we are taught by Cambridge, the British Council, even when a child comes to the LKG, LKG classroom, you should never translate any word in their mother tongue. You have to make them think in English. For example, you teach them what is the meaning of table. This is in mother tongue. They start thinking in mother tongue. Then they translate into English. So fluency issue comes. So what we do in our college, in all our campus, we have teachers for LKG, UKG, first and second standard. Most of our schools have teachers from North India, from Assam, Arunachal Pradesh, all those places, because they don't know the mother tongue, our mother tongue here. They will sit and with jump and dance and express English only through English they can speak to the kids, and they will learn very fast.
Yes.
Yeah. So thinking is, that's why we suggest you to listen to podcasts, and when you cook also listen to something or listen to some videos passively. So that culture thinking develops.
Yes.
That's easy for competency.
Okay, we will follow your advice, Father.
Yeah. No, like always, it's not that earlier I got out of the group, I think, once, because I thought it's not a OET group. Later you again invited me. Yeah, I remember, because I didn't understand anything. I thought I am in a wrong group. Now I understand. Yeah, it's okay.
Exactly.
Yeah, but then people may understand in the beginning. For example, you see, I have YouTube channels in 9 languages. Okay, even in Malayalam I have a good channel, but I don't encourage much. Because people are saying some of them could not understand. There may be some 100 sessions there uploaded. because I don't encourage other languages. Maybe in the initial stage, you can help them to understand some strategies and all that to feel comfortable. But otherwise, English has to be the medium. Yeah. Anything else? Shall we go?
Yes, please.
Yes.
Yes, Father.
Where are we?
Address.
Yes. We are going into beautiful segments.
7.
Case note, simple sentence.
Yes. Share. Seventh step, right?
Yes.
Yeah.
Yes, Father.
7. Can you see?
Yes, Father.
Yes, Father.
If anyone is competent without going into these steps, definitely you can bypass. But then always I suggest have this clarity. Yeah. Case notes into transforming, how to transform case notes into simple sentences. So this is very, very important. Somebody asked me the same thing. For example, you have to always consider, don't take only the word there, consider the side heading as well, okay? When you create a sentence, it should be in connection with the side heading. Case note is pluracy. How can you make a simple sentence?
He is diagnosed with a fever.
Okay. He is diagnosed with pleurisy. Okay. Is he is diagnosed
Mrs.
or was diagnosed?
She was.
She was. Mrs. Bampton, or she was diagnosed, not is, was diagnosed, because already diagnosis is over, right? When you are writing the letter. Yes. So, what is the grammar? Past simple tense. Reason because the symptoms were reported during the previous consultation on 2 August 2019. This is in the past. Now you are writing later. Okay?
Excuse me, Father.
Simple past. Yeah.
Sorry, Father, I have
Please.
confusion about diagnose. If there is a diagnose given there, so it must be mentioned.
Yeah. No. I am telling you, if at all you have to make a, where you mention, purpose in the what context you have to mention, right? Whether this person is having leukemia. Yeah, you have to. That's what I said. In what context you are writing. One aspect is context. Among the 4 things, one is context. Who is the person? In what context are you referring him? Means he was treated for pleurisy and discharged. Right. Then you have to write next one. What reason? Why are you writing? Then what is your request? What should I do? These 4 things are must.
Must be. Okay, thank you, Father.
Must. It's not should, it's must. You know the difference between should and must.
Yes,
should
Father.
means you can, for example, Dr. Salafa suggests me, Father, you have to drink at least 4 liters of water every day. You should. She will not say you must.
Yes.
Okay, you should means please drink. It's a suggestion, recommendation. You can drink or may not drink. It's up to you. But if I say you must follow the traffic rules, there is no option. You must follow, otherwise you will be penalized. Okay.
Okay, thank you so much, Father. Thank you.
Yeah, you are most welcome. You are most welcome.
So
So subject.
in regarding the diagnosis, can we say has been diagnosed? I mean to write it in the present perfect.
Present perfect, because if that has a connection now, if that is a connection now, relation now.
Yeah.
I'm coming to that. Each sentence, each tense I will be explaining now. Next step, okay? Yeah.
Okay.
Now here you have subject, Mrs. Bampton, past verb, was diagnosed, that is auxiliary and main verb, object with pluracy. Okay? That is a simple sentence. Subject, verb, object. SVO order. Only in English, okay? In all other languages, you have subject, object, verb. If anyone is here with a language which corresponds to English syntax, word order, please let me know, okay? Okay? The basic idea you should have, Sneha likes sweets, Sneha subject likes sweets. This is the problem that we have in our English. This is subject, verb, object. But you take any other language, for example, this is Malayalam, you have subject, then object, then verb. Okay, this is Kannada, you have subject, object, verb, SOV, whereas only in English, SVO. And this is Tamil, again, subject, object, verb, and all the Indian languages have subject, object, verb option.
Actually, in language, it is verb, subject, object.
Oh,
in Arabic.
well, that's
Yeah.
great. In Arabic,
Yeah.
I'll be happy
Yes.
if you could send me one sentence.
Yeah.
Yeah, I can. Happy to know that. Verb, object, subject, right?
Yes, verb, subject, object.
Okay.
The
Can you
verb-
just write and send me Sneha likes sweets in your language? Maybe you'll have to put it in English.
Yeah, I will.
Transliteration. I will add it here. And Arabic, right?
Yes.
Yeah, it's good to know. There are different syntax, word orders. But all the Indian languages have subject, object, verb. Only English has subject, verb, object. Even Arabic has verb, object, subject, but not
Verb,
SVO. Subject, object.
VSO, yeah.
VSO. Okay, that's very good.
سميحة تحب الحلويات.
Okay, great. Now you
Samiha
see this. Yeah,
very-
Indians have a problem with fluency because of this. You know, in Malayalam or any other Tamil, Telugu, all the languages, they think in Malayalam or their mother tongue, subject, object, verb, but when they translate, they have to change the positions. So it affects fluency. Yeah, just to have an idea. Now, word order in a sense. She has smoked. Subject, has, then, and common in India, the common mistake, all the students make this mistake, she have smoked. She have smoked. She has smoked. This somebody was asking me, right? Past tense. Why it is past tense? A past participle. Okay? Present perfect tense. Past participle form is used. Okay. So we'll go a bit of grammar. Are you happy with the grammar or angry with the grammar?
Yes, Father.
Yes, Father.
Yeah. This is ultimate solution. This is ultimate solution for your grammar, okay? But in between, before 2 o'clock, you have to remind me and I have to eat something. Otherwise, I won't get my dining hall will be closed. What is time? Okay, I hope I'll be able. Yeah. I need only 5 minutes to gap, yeah. By the meantime, you can discuss because if you close down again, it is a big thing to connect again, all those things, right? Grammar OET, now you see. Has been a smoker all her life since 18 years of age. Current smoking 10 a day. Case note, has been a smoker all her life since 18 years of age. Current smoking 10 a day. Understanding its grammar will help you write accurate referral and discharge letter because patient case notes often describe smoking history. Take this. She has smoked since the age of 18 and currently smokes 10 cigarettes per day. What type of sentence is this?
She has a small
Past part, Alex.
Past
Present
perfect.
perfect.
Past perfect. And present perfect.
Present
See,
perfect.
structure-wise, there are 4 types of sentences. One is simple sentence. Second one is compound sentence. Third one is complex sentence. Fourth one, compound complex sentence. You don't require compound complex sentence at all. Don't worry at all. You need not study for OET. But for life, you can study. Now, simple sentence means one subject, verb, object. Compound sentence means 2 simple sentences combined with a conjunction, coordinating conjunction, we call it. Combined with a conjunction. Complex sentence means 2 concepts, 2 ideas connected with a relative. This one. Sorry, I forget that word.
Dependent.
Subordinate conjunction.
Conjunction.
Coordinate. Not coordinating conjunction.
Conjunction.
Not coordinating.
Dependent, independent.
Subordinating conjunction. Yes, subordinating conjunction. And one sentence will be full sentence, other one will be dependent, means not full sentence. We'll give you examples for that. What type of sentence is this? She has smoked since the age of 18 and currently smokes.
Sentence, Father.
It's a compound sentence because two complete sentences are here. Now somebody was asking that should there be a comma after 18 before and? That was the question earlier somebody asked.
Yeah.
No need to.
Yeah. Yeah. It is optional because that is known as Oxford comma. But then one condition is there. If you are using comma before conjunction, you have to use throughout your letter. If you are not using, don't use at all. If you use in one sentence comma, in another sentence no comma, both will be considered wrong. That's the international principle. Okay. Let's break it into small parts. Sentence part 1, she has smoked. Okay. This sentence into 3 sentences, small sentences. She has smoked. Part 2, since the age of 18. Part 3, currently smokes 10 cigarettes per day. Okay. Now, there are 2 simple sentences here. She has smoked since the age of 18. That is simple sentence. Another sentence, currently smokes 10 cigarettes per day. 2 simple sentences make one compound sentence. What is removed here?
She.
No, actually here, you can write she currently smokes, but it is not here. She currently smokes. Okay. She currently smokes. In the subject must be there in the second line, simple sentence. So subject is removed. That is also again, even if you write the subject, it is not wrong, but the conciseness is a criteria for your OET assessment, writing assessment. If you can write shorter and give the same meaning, you should write shorter, briefer. Okay. Now, see, has been a smoker all her life. Mrs. Brampton has been a lifelong smoker. Can you write that? No, because that's a judgmental expression. You cannot use it. Mrs. Brampton currently smokes 10 cigarettes per day. That is fine. Mrs. Brampton has been smoking since the age of 18. That's also fine. But you cannot use the word smoker. She has smoked since the age of 18 and currently smokes 10 cigarettes per day. This will be in the body paragraph 2. I'll tell you why. Okay. Mrs. Brampton has been a lifelong smoker. Avoid repetition and avoid judgmental language. That is present perfect we are speaking about. Past action with present relevance. Past action with present relevance. You know, it starts in the past, but it continues to the present. If it is simple past, it will start in the past and end in the past. She was admitted that day. It's over. Okay, she has maintained a non-smoking regime. She has maintained a non-smoking regime. Is she smoking now?
No.
No. Was she smoking earlier?
Yes.
Yes. Did she stop smoking in the past?
Yes.
No.
Did she?
No.
Yes, it is yes.
No.
Did she start smoking again?
No.
No. Which means she has started the action, the smoking cessation, non-smoking regime, or she stopped smoking in the past, and even now she is not smoking. Past action with present relevance.
Yes.
Okay, if now she has again relapsed into smoking, started smoking, you cannot use present perfect. You have to use simple past. She had stopped smoking, you can say, but now she smokes. Then you need not say now she smokes, because it's understood if you use she had. Now she has maintained a non-smoking regime, means she stopped smoking, she is not smoking even now. Okay, so present perfect. When do you use symptoms that began in the past and continue? symptoms. You did diagnose some symptoms at the admission. Still, the patient has that symptom even now. So you have to use past perfect tense. Okay. Example: he has lost 2 kg.
Wow, that's I got to
Okay.
wow that. Simple past tense.
Yeah. She has smoked since the age of 18. Tense, present, perfect, simple. Structure is subject plus has, or if it's plural, have, past participle. She has smoked. Now, she has smoked. Subject, verb, past participle is the syntax. Word ordered in a present, perfect, or perfect present simple tense, however we use it. Simple, present, perfect tense. This is the word order. She plus has if they have. Plural means have, singular means has. Please mute.
I bet 90% of people have no idea this even exists.
Please mute. Yeah. Subject, verb, past participle. This should be clear in your brain. This is the only format you have. Instead of has, if subject is plural, you will use have. That's all you need to remember. And you need to remember, was it a thing in the past? Action was in the past. Is it continuing now? Then present perfect. Did you understand?
Yes.
You have to write a line like this. I can't draw it here. Write a line in the middle, present, then past before, and the present, future next. Can you write one line? Let me check. I can show you
Yes,
for
sir.
clarity. This, yeah, I'll check if I can draw here. Can you see the screen?
Yes, Father. Yes.
Yes, Father.
Yes.
Yes, sir.
Try to draw it and keep it. Okay, it is required. You must understand this. Okay, I'm trying to put it here in a different color. Okay, now this is past. Okay, this is present. And this is future. Okay, present means, sorry, I missed the part. Am I sharing the screen?
No,
No,
sir.
no, Father.
No, Father.
No,
No,
sir.
sir.
Not yet.
Screen is
No.
Suddenly what happened? Suddenly something happened. Okay. Yeah.
It's visible.
Yeah. This present means now. Okay. Now this is past. I did not think of it, otherwise I'd have created it earlier. But it's good to know. You live will show you how it is. Something happening, you take this. Okay. See now, something happens in the past. This is present, right? This arrow.
Yes.
Okay. And now, how will I show? Okay. Maybe one. Are you all there?
Yes, sir.
Yeah.
Yes,
Now you see.
Yes,
Yes. Now
Yes,
the thing started here. Okay. And sorry, it has a link to the present. See, it started in the past, but it has an influence on the present. Even now it is going on. Mrs. Brampton stopped smoking here. Even now she is not smoking. Even tomorrow she may not be smoking. We do not know. So this is what tense?
Present perfect.
Present perfect.
Perfect.
Yeah. Only this timeline you have to remember and ask when you read a case note. This timings. See? Nothing else you need to remember. This line you have to remember. Influence on the present. Still continuing. An action started in the past, still continuing. Yeah. So if it is done every day, repeated action, what will be the word? What will be the tense? Repeated action every day. It was there, past also it was there. Every day. You are jogging every day in the morning.
Simple.
Simple present. It will be simple. It will be habitual things, will be simple present. I'll explain it. This is clear, no?
Yes, Father.
Action started in anything that started in the past, maybe a symptom. But the patient is still suffering with that symptom. It is present perfect. That's enough, I believe?
Yes, yes.
Yeah. Present perfect. She has smoked since the age of 18. Why is the present perfect used? The present perfect is used when a past event continues to affect the patient at the time of writing. Now, today you are discharging, referring the patient to somewhere else. Even now, the patient is suffering from that symptom or problem. When the event from the past into the present. Event reaches from the past into the present. Yes. See now, the present perfect is used. An action started in the past. She started smoking at age 18. The action continues up to the present. She continues to smoke now. Okay. I'm giving now, not 11 here. She stopped smoking, but she started smoking at the age of 18. She continues to smoke now. The exact duration is important. Therefore, the habit and extends from the past into the present. She is here, Mrs. Marvin, Mr. Marvis, right? Mrs. Marvis Brampton. Mrs. Brampton stopped smoking in the past. She continues to adhere to that smoking cessation. Therefore, the habit extends from the past into the present. The patient began smoking when she was 18 years old and she has continued smoking until now. Why not use the past simple? She smoked since the age of 18. Why is that? Is it right to say she smokes since the age of 18?
Because
No,
since
it is still continuous, so it is wrong.
Now
should be used with the present
Still
perfect.
continuous, so it is wrong.
Yeah, because since, when you use since, requires the present perfect when the action continues into the present. Action continues to the present, to today. Okay?
Yes.
Yeah, in OET letters, the present perfect is frequently used to describe long-term habits, drinking, smoking, all those history, chronic conditions, diabetes, chronic conditions. When you speak of any chronic condition or long-term habits or long-term symptoms, you have to use present perfect. Ongoing treatments. Treatment started in the past, still going on. Relevant medical history. Relevant medical history means happened in the past, right? Relevant means relevant today. These are the only where you have to use present perfect. You ask with the case note if you have a doubt, is it a long-term symptom? Is it a chronic condition that I am writing about? Is it a treatment that's going on even now? Is the history present even today? Clear?
Yes, sir.
Yeah, then we should not have any doubt regarding this one. She has suffered from asthma since childhood. You can't say She
Okay.
suffered from asthma since childhood. Yes, please.
Yeah, if a person is he's an alcoholic, so
Okay.
it's a long habit. So I
Yeah.
have to use a simple or the present perfect.
Present perfect.
Present perfect one.
Yeah.
But it's his habit, right? Like regularly he will do the things. Like he regularly will consume alcohol.
No, if it is repeated actions, present can be used. Repeated actions. This is not repeated actions. This is a condition, right? It's a non-repetition. It's going on.
Okay.
Yeah. When I come to simple also, I will make it clear with the examples. Okay. What is the difference between present perfect and present perfect? Means it's a process, a condition, a process that started in the past and it's influencing the present. Whereas simple present is just happening in the present. There was no past. Maybe that happened in the past, but it is repeatedly happening. Okay. For example, you are jogging every day for your exercise. You jog yesterday you did, today you are doing it again. There is no connection to yesterday's and today's. Even if you are not doing did not jog yesterday, you would have jogged today. No issue, right? The other one, there is a continuity. Maybe you did not jog for 10 days. Again, you started jogging because you are sick. Okay? She has suffered from asthma. I will come to that simple sentence we are going to explain. He has experienced recurrent migraines for 10 years. He has experienced recurrent migraines for 10 years. A duration is mentioned. So it's present perfect. Durations always go with present perfect. Okay? Is that clear?
Yes,
Yes,
clear.
Yeah. The patient has been diabetic since 2015. Compound sentence, already we said. Yes, present continuous. Next one, very rarely we use it. Where do you use it? Any idea? Only one place we use it in OET letter.
Purpose paragraph.
Yeah, purpose paragraph. The only place you use present continuous. That's why that grammar is very clear regarding OET. Only in the purpose of the letter you can use present continuous. Example, I am referring him for urgent assessment. This is not the purpose paragraph, okay? I just wrote a sentence. I am referring him for urgent assessment. I am referring, ing form, gerund. This is called present continuous, or usually we say present progressive. Clear, no? I am referring him for all those things. Only in the purpose paragraph. So it's very clear. Even present perfect, very clear where you have to use. Don't forget it.
Hello, Father. What about
yes.
Please. I am writing?
I am writing. Yeah, I am writing.
Yes.
It's present perfect continuous. Yeah. I am writing. I am referring. I am transferring. I am sending. Anything is, yeah. Words can change, but tense will not change. Yeah. ING form we call it. Gerund we call it. Present perfect continuous. Action started in the past and continuing. Action started in the past and continuing. What is the difference between present simple perfect and present perfect continuous? Even in the simple, yeah.
Yeah.
Simple. No. Present perfect and present perfect continuous. Present perfect we said action started in the past. And it has a influence on the present. But here it is saying action started in the past and it is continuing.
Yes.
Any idea what is the difference? She has been smoking since she was 18.
Recurrent actions.
Yeah, she has been smoking. She was smoking, not like recurrent. She is smoking. She will be smoking. The idea is that she is an addict. Okay? She has been smoking means she was smoking. For example, if you ask some people, they say, where are you from? Where are you from? Can somebody answer me?
I'm been from. I'm been from.
Hyderabad.
I am been. I am been.
No. Where are you from is a simple question you have to say, I am from.
I'm from.
But usually you say, I am coming. People say, I am coming from, right? There are people who say, I am coming from Meghalaya. I am coming from Kottayam. I am coming from Kottayam means I have not yet reached. I have not yet reached. For example, you came to my house. my residence. I am asking you, where are you from? If you tell me I am coming from Kottayam, Kottayam is your place, or I am coming from Delhi, you have not reached. I am coming from.
Okay.
If you tell me I am coming from Delhi, you have not reached. For example, sorry, there is some instrument disturbing. Please mute. Now you see, I am coming from. For example, you are coming from Delhi. We met you at Bangalore. You are coming to my residence. Somebody meets you at Bangalore airport, and if they ask where are you from, you can say I am coming from Delhi and going to Kannur. Going to Kannur. Coming on in the process of journey, I have not reached.
Yes,
So where are you from? I am from Delhi. You can't say I am coming from Delhi. Coming means it is continuous process. You have not reached. So also here you can say, like here, she has been smoking since she was 18 means, it means she was smoking, she is smoking, she will be smoking. She will be smoking. There is a continuity to the future also. To say that she is a chronic smoker. I'll come to that with the, okay. When I come to the understanding of all the tenses together, where do you use present simple?
For chronic conditions or repeated habits.
Yeah, current symptoms. Usually in OET, current symptoms, current examination findings, current facts, current needs of the patient, identity, habits. Usually these four, current symptoms, current examination findings, current facts, current needs are used in your this one. Even identity you can say, habits you can say. Okay, these are the only places where you can use present simple sentence tense and use maximum this tense in your, for example, his abdomen is tender. See, whatever I give you in white color, these are all examples from medicine case notes. Okay, whenever I give you, very often I give you in every screen, you will have this white background. That is for doctors. Okay, case notes from the doctors. This is from the green for nurses and other professions. Okay, Mr. Brampton is 72 years old.
Fact.
Fact. It cannot change. Okay. Currently smokes 10 cigarettes a day. Brampton, Mrs. Brampton currently smokes 10 cigarettes per day. Present simple. Subject plus verb. Syntax, she has smoked. Subject, verb. Now, present simple use, the present perfect is used, present simple is used. No, there is a mistake, okay? It's not present perfect.
Sorry, can we just back to the last one? Okay.
This is one check. Here there is a mistake. Present simple is used, current habits, daily routines, regular activities, facts, smoking 10 cigarettes a day in her current habit, right? It's her current habit. So simple present is used. At present, she smokes approximately 10 cigarettes every day. It's as Dr. Salam said, recurrent activity. It's not a process. It's a recurrent activity, daily happening, repeatedly happening. But it's a fact. Regular activity. You brush your teeth every day. So it's a simple sentence. Current habits, what you are doing regularly, repeatedly. But whereas you are a diabetic, is it a repeated thing?
It's a fact.
No,
it's a fact, but your diabetes. When you speak about your diabetes, it's a process, right? Maybe you became diabetic 10 years ago. It started in the past, but it is influence on the present. It will continue. So it's a process, not a repeated activity, regular activity. It's not a repeated action. It's a action that extends.
Okay.
See the difference?
Just a chronic condition, yes.
Yeah. Means it is a process that continues. Okay. Now in the OET, where you can use present simple, current lifestyle habits, current medications, current symptoms. When you speak about the present symptoms, you can use present simple. When you speak about the ongoing medication, as of now, what is the medication? You can use the present simple. Current lifestyle habits, smoking, anything. Okay. You can use low diet, low diary diet. All those things can be present simple. She drinks alcohol occasionally. A factual statement, present. He exercises twice weekly. A factual statement. The patient takes metformin daily. The patient takes metformin. What is the difference between why she drinks? Can you say she drink alcohol? He exercise.
S
The
without
patient take.
No,
Says a
S for the singular we use S.
singular, we use
Yes.
S.
Yeah, third person singular.
Singular.
Yeah.
Just singular. Third person singular present tense, not otherwise.
yes.
You know what is the person, right?
Yes, Father.
Do you know what is first person, second person, and third person?
Yes.
Yes.
Yes, Father. I, we, you, they.
Okay.
He,
So
she, it is first singular and the rest is I, we, you, they are plural.
You,
Or
he,
third
or she.
person.
Yeah.
show you one sec. Let me just show you, because if you don't have that clarity, you will not understand this one. Okay, let me do this.
Father, it's a time 1:53.
Yes, Father.
Okay. After 2 minutes, you will give me a break for 5 minutes, right?
Okay, Father.
What will you do that time?
Lunch
The thing is,
time.
if I disconnect again, it's a big headache to start, admit, and get the things go running. Who will manage the show? Yes, 5 minutes will be cool for me. Tell me how you will manage.
I will.
I think Dr. Salafa can discuss. Did you have your lunch? I don't know what is your time, Dr. Salafa.
No, it's morning, 11:23 now.
11. Oh, 11, right? Okay. So not a time for your lunch.
No, not yet.
Can you lead the discussion, and admins will support you
Yes, sure.
for 5 minutes. Whatever you need to bring to my notice when I come here, you can tell me.
Okay.
Just I am showing this first person, second person, third person. That clarity must be there. Yeah. Now, first person. Okay. Yes. Can see the screen, right?
Yes, we can
Yes,
see.
Father.
Yes. Singular, plural.
Yeah.
Nothing is required. This is not required. This is first person, second person, and third person. What is the first person singular?
I.
I. First person plural?
We.
Yes, we. Second person singular?
You.
Yes. Second person plural?
You. You also.
Yeah. Same, you. Singular and plural. Third person singular?
He, she, it.
Yeah. He or she
Or
or it. And plural?
They.
They. Yes. Yeah. See now the beauty. Where you use S with the word is only here, okay? Only with singular in the present tense. In the present tense. Okay? Only in the present tense. Third person singular in the present tense. Verb takes S. That's a common mistake and it's a classical mistake. You'll be penalized. In the letters, I find it often. That's why I showed you this. Okay? Make it clear. The verb takes S. The verb takes S. S or ES. Okay. Depends. S
or yes.
Or ES sometimes. But let's see if you remember, that's enough. ES. With
TH,
subject being subject in the third person singular
Present tense.
present tense. All these three conditions should be present tense. Okay? All these three sentence conditions should be present. That's a common mistake and it will be definitely penalized because this is a classical mistake. Okay? So beware of it. Yes? And CSE, okay. Yeah. Right, thank you. Did you get it?
Yeah.
Yes,
Yeah.
Father.
That's why we have here, she drinks. You can't say she drink. He exercises. Okay. The patient takes. Okay. And she experiences, not she experience. Because the patient is third person singular. He. She is third person singular. He is third person singular. And all these are in present tense. Otherwise, it will become she drank alcohol yesterday. Then no S. She exercised yesterday. The patient took metformin yesterday. Okay? Clear, right?
Yes.
Yes. Present simple. Mrs. Brampton, in today's case note, Mrs. Brampton is 72 years old. Mrs. Brampton requires Meals on Wheels. Mrs. Brampton requires Council Home Help. Okay? Why are both tenses used together? You know that? Two tenses can be used in one sentence. She has smoked. Past tense. Since the age of 18.
Present perfect.
Present perfect. Shows the smoking history from the past until now. Currently smokes 10 cigarettes per day. Present simple. Shows present smoking habit. Together they provide a complete clinical picture. So we say she has smoked since the age of 18 and currently smokes 10 cigarettes per day. Means past, present perfect and simple present is used in one sentence. First portion, present perfect, shows the duration of smoking habit, present perfect, and current smoking level is presented in the present simple. That's why I say the beautiful sentence for showing the clinical picture about the duration and the present situation. Okay?
Yes.
Grammar pattern, yeah, present perfect plus since. Whenever there is since, you must use present perfect. Grammar patterns. See, she has smoked since. If there is since, it must be she has smoked. You can't say she smoked since. She is smoked, you cannot say. So you have to say she has, because since is there, it's always, remember, present perfect. Duration always present perfect. Okay? She has smoked since the age of 18. Started at 18 and continues now. She has had diabetes since 2010. Diagnosed in 2010 and still has it. She has worked as a nurse since graduation. Began after graduation and still works. Present perfect plus 4. You know, since and 4, two expressions. She has smoked 4. Duration. She has had asthma 4. Okay? 10 years. Sorry, there is a repetition. She has lived alone for 5 years. 4. Simply remember 4 and since. Duration goes with present Present?
Perfect.
Come on. Perfect. Are you
Perfect.
going to sleep? Huh?
No.
See, yeah, key
No.
OET rule is this top tip. Use the present perfect to describe a patient's medical history or long-term habits that continue up to the present. All the medical history and long-term habits, symptoms, anything, treatment, anything till which continues up to the present. Use the present simple to describe the patient's current condition, lifestyle, symptoms, or habits. That's why the sentence, she has smoked since the age of 18 and currently smokes 10 cigarettes per day, is an excellent example of accurate and professional OET sentence in letter writing. That's what when I pardon? Yeah. Thank you for reminding me. Yeah. I think we'll skip here a little. Where is it? In 77th slide, and I can give a little work before I go. Okay. Can you see the screen?
Yes, we can see.
Yes, Father.
Can you individually you write one sentence, simple sentence for this case note? This is from the same case note, Miss Brampton, and mention what is the tense used. Okay.
Okay. Yes.
Create a sentence, then mention what tense is it. Did you understand?
Yes.
This is exactly the case note in the Mavis Bhashan thing. What I have typed here is case note. Now here you have to write simple sentence. Then if time remains, Dr. Salafa and admins will manage, right?
Yeah, sure, Father.
Okay, thank you. Thank you, Ranjini, for reminding me. Thank you. I'll be back in 3 or 5 minutes.
Okay.
Okay, Father.
Thanks, Father. 2 o'clock.
Please, what time are we ending the class?
finished? If you finished, let us discuss the sentence. Or are you still writing?
Finish, ma'am.
Yes.
Still writing.
2 minutes. 2 minutes.
Still
2
okay.
minutes, ma'am, please.
Okay. If you have another device, write in the YouTube comment space also, instead of writing in a paper.
Discharged. Repeated. Admitted 10 January 2000. Admitted twice then.
What about the first one? 72 years old.
Mrs. Brandon is 72 years old.
Marvis Brampton, 73-year-old.
Yes, and this is
Mr. Brasa
what
is 72 years old.
Yeah, what type of tense?
Present.
Simple
It's
present.
past and it's
This is
present.
present simple because this is fact, right? This is her
Yes.
age. Fact about Mrs. Brampton. So she is 72 years old. What about the second one?
The present tense.
He was
She
admitted
was
on
admitted on 10th January 2011.
Yes, and this is what type of tense?
It's
passive tense. Passive.
It is simple past, yeah, because admission, is a process that happened and finished in the past in a specific point of time.
Yes.
So she was admitted on 10th of January 2011. And then what about the discharge? How did you wrote this one?
He's
Discharged.
discharged on 15 January.
She's been discharged. She's been discharged on
She was
15th
discharged
January.
on 15th January.
She is being discharged. And what is the type here? She is being
Present continue.
Yeah, and in a passive form, right? She is being discharged.
Passive, yes.
Yeah. Can we write it in another way, another tense, rather than this one? Suppose you are writing the letter today and the discharge will be tomorrow. How are you going?
She will be discharged on 15th January.
Exactly.
She's going to be discharged.
Yeah, this is the future tense, right?
Sometimes we use the present.
Future. She's going to be discharged.
She is to be discharged.
Yeah, or we can say she is due to discharge on 15th of January, right? Okay, and how did you write the diagnosis?
She was diagnosed
He was
with
diagnosed with
Yeah.
Was diagnosed.
She was diagnosed with pleurisy, and this is simple past, right?
Yes,
And
simple past.
admission already we said about that. She was admitted on 10th. And what about her smoking history?
She has been smoking.
Smoking.
Exactly. Yeah.
She has been smoking.
Since she
Father
was
said we
Past,
should
present,
wait.
she
continuous.
has been smoking since 18 of
Yeah,
age
exactly. We should never write she
and
has been,
currently
right? Because this is judgmental language. A smoker, we should not write it. So as you said, she has been smoking since the age of 18 or since she was 18, right?
Okay.
Yeah. And the last one, currently smoking 10 a day.
and
Yes.
She smokes
and
10 cigarettes
currently
a day.
smoking.
Yeah. Currently, she smokes 10
Smokes.
cigarettes daily or per day, right? Currently, she smokes 10 cigarettes daily or per day. Mhm.
I have question in the diagnosis. We can say he has been diagnosed with pleurisy.
Yeah, actually, Father said if the diagnosis is relevant now, you can write in such tense. But this already happened. For example, if you are referring the patient for further assessment, for a specialist assessment, you can write she has been diagnosed with, for example, pleurisy. But here now she is already recovering. She recovered from her diagnosis. So it's better not to write she has been diagnosed because pleurisy already treated. But if you were referring to a specialist, for example, for further assessment or treatment, you can write she has been diagnosed with pleurisy because the condition is still relevant and she needs further assessment. But in our case, no, because you are referring for continuity of care. She is already treated and recovered.
I would say, Sulafa, if this is like a timeline, if the timeline like admission, discharge like today, and the diagnosis before that, that is why I'm using the past simple.
Yeah,
You get
yes,
my
you are
point?
right.
Yes,
Yeah,
like a timeline, yeah.
exactly. But her question was, is it possible to write in the present
Yes,
perfect?
I understand your explanation, but I mean, if you put it like a timeline, that today is discharge, this is a present, and the diagnosis before that.
Yeah.
Yeah.
You mean we can write in that tense?
No, I mean it is past because here is the past because if you put like a timeline, is that as the Father Saleen the put like timeline present, and then past, past, present perfect, and then future. The timeline today it is discharge.
It's not future.
Yes, yeah, not future. I mean
Yeah.
the timeline today, the point today, it is the discharge, and the and diagnosis before. That is why
Yes.
I'm using the past simple.
I got your point. Yeah.
Can you repeat one more time, Mom? This smoking, he has been a smoker.
Yeah.
Right.
Yes, we can write she has been smoking since the age of 18, or she has been smoking since she was 18 years.
Ma'am, I can write like this. She has been smoking since 18 years of age.
Yeah, you can write since 18 years of age. Yes. Yes, the point is just to avoid the smoke, the adjective, because it is judgmental. And one point, when you write 10, it's better to write it in, I mean, not to write in numbers. As we know, from 1 to 10, it's better to be written like a word, صح? This rule. You should transform 10 into TEN. It will be more formal and in your writing. It's better to avoid the digits from 1 to 10.
Ma'am, hello.
Yes.
If there is 13, so we can write in digits 13, or we should write in the word.
If it is more than 10, yeah, you can write in numbers. But 1 to 10, better to write in letters. Yeah.
Okay, thank you.
Welcome. Anyone want to add anything until father came back?
Ma'am, one more thing I want to ask.
Yes.
Currently, she smokes 10 cigarettes a day, or we have to write cigarette only. We don't no need to add yes last.
No need to add what? I didn't go to
Like last one they are saying she is in current, right? So
Yeah.
currently she smokes 10 cigarettes a day, or in cigarettes I need to add S, or without S it will be okay.
Yeah, we need to add S because this is plural. 10 cigarettes
Yes,
daily.
yes. Okay.
Yeah, better to write daily or per day. Avoid a day.
A
Yeah.
day, okay, daily.
Yeah. But you need to add S because 10 cigarettes.
Yes. Okay, thank you.
Please, how do we put the diagnosis? Is it was?
Yeah, was diagnosed because it's already finished. Yeah.
All right, thank you.
Simple past.
All right.
Okay, so Lafa, what about today's visit? Shall we write it as has, for example, has presented, or presented in past simple, or in the present perfect?
Today's visit better to write in simple past or present simple. You can say today Mrs. Brampton, or for example, she presented with. Yeah. Present perfect, as father said, if you want to express, for example, changing condition, long history, for example, of smoking habits. I mean, recurrent habits like smoking. But for today's visit, they said the best is simple past or present simple. And you can also express the changes in condition with present perfect. For example, her condition has improved or has deteriorated.
Okay, so it's wrong to say today she has presented with.
Yeah, because I think presentation itself is a short action. No need to express it in a present perfect. Already she presented and finished. When the recipient receives the letter, this action already has finished, right? So it's better to write she presented with in a simple past.
Okay, thank you.
You're welcome.
Hello.
Now father is back.
Yeah, where have we reached? You got your sentences?
Yeah, we have finished our sentences.
Okay. Maybe one model letter I can show you here, sentences. Can you see?
Yes.
The patient's name is Mavis Brampton. Mamshin Brampton is 72 years old. You can write she is 72 years old also. Mavis Brampton was admitted on 10th January 2011. Hello?
Yes.
There is some distraction. Please mute. Mavis Brampton was diagnosed with pleurisy Mr. Brampton was admitted on 10th January 2011. Mr. Brampton has been smoking since she was 18 years of age. Mr. Brampton smokes 10 cigarettes per day. And what are the tenses?
The first one is present simple. Yeah.
Yeah. Second one is present simple.
Simple past.
Third one is simple past, passive form, admitted.
Charge.
The third one is present simple, simple present, passive form. Is to be discharged. Past, simple past again. Mr. Brampton was diagnosed with pleurisy, passive form, was diagnosed. Why do we use passive forms?
Patient cannot itself admit. Someone should be admitted or diagnosed.
No, the passive form is used when the professional, health professional who does it, the action is important, not the actor, not the person, the health professional. One sec. Mine is showing low power mode. Give me one sec. Right. See, Mr. Bams, am I audible?
Yeah.
Yes.
Yeah. Mrs. Brampton was diagnosed with pleurisy. Diagnosis is important, not the person who diagnosed. Action is important, not the actor.
Okay.
Okay, that's a use of passive voice. That's why in OET letter you can use a lot of passive voices. That's a powerful way of explaining whether he was diagnosed or he was treated or was prescribed by any doctor. Effect is same, right?
Yes.
Imagine a person was operated by Dr. Salafa, Dr. Amin, Dr. Sharat, whoever it is.
Yeah.
What the person want to know, he had a surgery, right?
Yes.
Not who conducted the surgery is not important in the letter.
Focus
Okay.
on action.
So action is important, not the actor. That's the principle. Okay.
Okay.
Yeah, I'll give you an example later when we come to passive. That is there in the grammar part. Mrs. Brampton was admitted on 10th January 2011. Past simple. He was admitted. She was admitted. Past simple. Again passive. Mrs. Brampton has been smoking since she was 18 years of age. Present perfect. Continuous. Already we have seen. Mrs. Brampton smokes 10 cigarettes per day. Present simple. Okay.
Yes.
Yeah. Beautiful. Let me check. All are here. Yeah.
Further, the last.
Hello.
Yeah.
Yeah.
Further. The last
Yes.
slide, just now we have discussed about
Yes.
was being diagnosed. So was being diagnosed with pleurisy, right? That is a passive form or active form?
Was being, you mean?
Yes, was being diagnosed.
Being means not diagnosis is not over.
Okay.
Means being diagnosed means diagnosis is going on.
Okay.
It's a present continuous tense.
Okay. Thank you.
Got it?
Yes. Thank you.
Yeah. And we are going to explain to you other tenses as well if you have the capacity to digest. I don't know. Do you get exhausted? We have skipped and came here because to take a break, small break. And I request if there are newcomers, please join the YouTube live. Yeah. Yes. Are you okay to go with some more grammar and complete it?
Yes, Father.
Yes, please.
You have the stamina?
Yes.
Yes,
Yeah.
Father.
Yes,
please
Father.
go.
Grammar is simple. You don't have much. Okay, very few segments. All the 12 tenses, you have only 4 tenses to be used. Okay. And I am posting the YouTube live link. If you can just Send me a message. Chat rate is just one. I would like to have 30 chat rate so that we can reach more people. That's the support you can give us. Okay, and I appreciate all those who have got the super chats. Thank you so much. And the members. Yeah. All those stars are our official members, okay? Our name is seen with star and the name is always in green. The official members of. Yeah, iPhone has raised the hand. Anything to say? Hello? By mistake,
First
maybe.
time here.
It's okay, it's okay. Yeah, if you are cool, you can on your video, no problem. Yes. Okay. Somebody iPhone raised the hand, I don't know. I can't see the person.
Yeah,
I was
it's my
just
first
saying,
time here.
it's cool, it's cool. Hope you are understanding something, right?
Yeah,
Where are you from?
I'm from Nigeria, but I'm currently in the UK.
Okay. Be cool. Did you attend from the beginning?
No, I started about 20 minutes ago.
Okay. So maybe you'll have a little challenge because on the way, right? But still you can go and watch the video.
All right, thank you
So
very
all
much.
these Lini Varghese, Chandravardhini, all these green ones are members, official members. If you want to be official member of EduSkills, you can click on their name. That will take you there. That green names. Yeah. Thank you so much. And send me some messages. All of you, please join. The link is in the Zoom classroom chat space. The chat room, you can find the link repeatedly posted each and just click on that link and join the YouTube live and send me a message over there. That helps us to, since we are spending so much time and energy and money, it's also expensive, you know, to have long sessions. Yeah, that it reaches to maximum people. There are only 4. There are 55 people here, only 24 in the YouTube live. Please join there. This is a humble request we are making so that we can continue our mission. Yeah. All the members, thank you so much. Lini Varghese is back from the duty. Welcome. Yes. By the way, how is your health, Dr. Salafa? I forgot to ask you.
Yes.
How is your health? School?
Yeah, it's good.
Okay. Right.
Excuse me, Father.
Hmm.
Hello.
Yes, please. Once again, when I asked you to join YouTube, many left the YouTube. Now I want all of you to just click on the link and join the YouTube. Yes. Yeah, tell me.
Father, could you please repeat the previous video?
Sorry?
I couldn't concentrate. The previous video, that grammar.
Okay. Yeah, sure.
Yeah.
Is there video will be there? It's connected live, no? Since many were asking me, they could not adjust their duties and all that. Otherwise, I don't want to connect live because it's a long session. It takes also internet should be very strong. So I arranged some additional support internet system. And otherwise, long sessions, it's very difficult to connect with weak systems. That's why I connected live. Otherwise, we wanted to go only on Zoom. Not only that, there were more than 100 people who registered, 180 plus. Then I thought, not good to deprive some people. But then all did not turn up. Yes. Others here, please click. The link is given.
So do you want us to leave Zoom and then join through YouTube?
No, don't leave Zoom. You just click on it. You will be simultaneously in Zoom as well as in YouTube, both. Or if you have a second phone or instrument, you can connect from there. The link also is in the main platform, main Telegram group. Everywhere in all the platforms. You can find the link. Okay. Right. Did you understand? You did not see the Zoom at all. You can join from the same instrument also. That will be in the background, no problem. If you have two instruments, it will be easier. Okay. Shall we go on?
Yes, please.
Yes.
Yes, sir.
Yeah.
Yes, Father.
Shall we go back to the grammar part?
Yes, Father.
Yeah, much
Even,
very much better.
yeah, please.
Yeah.
You want to tell me? You wanted to say something? Somebody want? Yeah. This is done, right? Since and for? Yes. And if you find it very hard, let me know, okay? So present simple, all these things we have said. Okay, present perfect continuous. That was done, right? Present perfect describes an action that started in the past and is still continuing. The example was somebody asked me just now. Describe, present perfect continuous, describes an action that started in the past and is still continuing. It emphasizes the duration of the activity. Example, Mrs. Brampton has been smoking. That's what the exam somebody asked me about. Has been smoking since she was 18 years old of age. That's not much used. Past simple, completed, hospital events. Where do you use past simple? Use past simple for completed hospital events. For example, previous consultations, previous treatments, previous prescriptions, previous discussions, previous investigations, previous symptoms, previous admission. Admission definitely is previous. Okay. I prescribed intravenous amoxicillin. Now there is a question of first person. Only doctors sometimes allowed, but not very much powerful when you use in first person. But doctors can use, there is an exemption for them, but others, all other professionals will have to use the passive form. Okay, she received intravenous amoxicillin, you can write. The nurses write. Okay, she received intravenous amoxicillin. So where do you use past simple? Just see whether it is a previous treatment, previous prescription, previous discussion, previous investigation, previous symptoms, which is not relevant now. All those things you can mention in. She received intravenous amoxicillin. Is she receiving now?
No.
No. She received
Not at all.
Yeah. Clear? That's simple. Examples, Mrs. Brampton received intravenous amoxicillin. Mrs. Brampton had a chest x-ray. Yes?
Excuse me, sir. We go
Please.
back to the other slide.
Yes.
Here, as you mentioned, she received intravenous amoxicillin. Instead of that, we can write she was prescribed intravenous amoxicillin.
Yeah, you can write she was prescribed. Where you want to give emphasis, that depends where you want to stress. She was prescribed. Okay? In a way, she was prescribed means it's not perfectly 100% she received. You can be prescribed. I was prescribed antibiotics.
Yeah, I got
but
your
I felt
point.
not to take it. I felt
Thank
not
you.
to take it because that affects my diabetes.
Thank you, sir. Thank you.
Okay. But then you can write, I prescribe, it's not wrong, but where you give the stress.
Excuse me, Father.
Please. Yeah, please.
You can write amoxicillin was administered or commenced.
Yeah, you can write. Amoxicillin, intravenous amoxicillin was commenced.
Okay.
You can write, yeah. But then, yeah, there are so many ways of writing. I'm showing you one or two ways.
Thank
Okay.
you, Father.
She was, yeah. Mrs. Brampton, this is over. No? Mrs. Brampton had a chest X-ray. Past simple. Mrs. Brampton started deep breathing exercises.
Past simple.
Okay. Passive voice. This is beautiful. The most powerful tool in OET writing. Okay. Okay. Use passive voice when the focus on the patient, the person, or the medical intervention rather than the healthcare professional. That's why you say she was administered. Who administered is not important. Okay, if Dr. Sadar, who attended my previous session, I gave you one workout, I believe, to prepare tea, right?
Yes.
Yeah. When you prepare tea, how do you prepare? If you have to instruct somebody about preparation of tea, I don't know how to prepare tea. If you have to teach me, now come on, all of you together, teach me how to prepare tea. A cup of tea.
Boil water.
Tell me
First
exactly.
boil the water.
Now, first boil the water.
Then we'll put the sugar.
Then I have to put the sugar, right? I have to put the sugar. Okay.
Yes. Then after that, tea leaf.
Tea leaf.
Then
Yeah.
we have to, yes. Then if you want to drink red tea with tea leaf is enough. If you want to take milk tea, then you have to add milk again.
Yeah. Now you have put all these in active voice, but all these processes are always like OET letter should be in passive voice. You cannot say I have to boil the like whether I boil it or Varsha boil it, it will become tea, right? So the water has to be boiled. Sugar is to be added. You can't say you have to add sugar. So the stress is on the action, not the actor. Okay, I'll give you that example. I have the slides for it. The focus is on the patient or the medical intervention rather than the health professional. The focus is on the action rather than the person performing the action. Person performing the action. Where do you use passive voice? Usually for laboratory results, investigations. Example, his bilirubin levels was elevated. Okay. Focus on the patient or intervention. She was admitted. Who admitted her is not important. She was admitted is the fact we want to stress. Admission to the hospital is important. Okay. Example, Mr. Brampton was admitted on 10th January 2011. Mrs. Brampton was diagnosed with pleurisy.
Father, please give me a previous slide before admission. Before.
This one?
Not this one. Yes. Thank you, Father. Thank you.
Yes.
Excuse me, Father. Can you go before this one? Before this slide? This one. Thank you. Thank you.
You're welcome. Those of you need to take your lunch break and all, depending on your time, you can either request us so that we'll have something else discussion here for 5 minutes or 10 minutes. Okay, don't sit hungry. I had to eat because of my tablets. Yes. If you're getting exhausted, let me know, okay? We'll have something simpler. Because grammar, some people don't like grammar. They hate grammar, that's the problem.
It's good to learn grammar.
Father, this is very important to learn.
No, take it. It will take little time to reach. Now you will understand, but only when you practice with another material and all that, you will get the skill. Don't get like, okay, something difficult. It's cool, very cool. Because I told you where you have to, for example, purpose paragraph. I clearly told you what 4 things you can include. You must include. Nothing else need to be included. Then sentence construction happens by practice. Okay. But you should know what is there should be in the purpose paragraph, in the first paragraph, second paragraph. As we are going with the types of letters, clearly I'll tell you what is the flow and what is to be included in the first paragraph. For each, there are only 3 types of letters for any profession. So for each profession, I'll tell you what is to be added, which type of letter, what is to be added in the first paragraph, what is in the next paragraph, and what is in the last paragraph. Okay, that's it. Nothing else. And where you can find it. Can I go forward?
Yes,
Can I
Father.
move the slide?
Yes, Father.
Yes, Father.
Yes. Okay. Yes, somewhere here. Yeah, here, right? Yeah, Mrs. Brampton was
Yes.
advised to stop smoking. Was advised by whom? Not relevant. Was advised to stop smoking. By whom is not relevant at all. Fact is relevant. Mr. Brampton was prescribed pravastatin and how do you say that? Celecoxib. Celecoxib.
Yes,
Pravastatin and celecoxib. Thank you. Yeah. So Mrs. Brampton was prescribed. Okay. If you say Mr. Brampton prescribed, Mrs. Brampton becomes the doctor. That mistake often you make in your letters. You miss was, the whole thing will change. Can I move?
Yes, please.
Yes, Father.
Active voice, focus on the clinician's action or the patient's action. Then action has to be emphasized. Of the doctor or the health professional or the patient, you use active voice, not very important for you, for the OET. She received treatment. Okay. Imperative. What is imperative? How many types of sentences you have in English? Any idea?
Types of sentences?
Yeah.
Simple,
No, that is,
compound.
grammatically you have simple, compound, complex, and compound complex. And you don't require compound complex for OET aspirants. Only simple, compound, and complex is enough. The purpose-based structures, sentence types, based on the purpose. That is structure, grammar structure. Based on the purpose, first one is declaratory. Second one, interrogatory. Third one, imperative. Fourth one, exclamatory. Fifth one, optative.
We don't know about this.
That's very important. That basic idea means there are 5 types. Declarative means
Declaration and declarative.
declaration statement, factual statement, either negative or positive. She is great, or she is genius. Affirmative, declarative. She is not genius. Negative. Next one is interrogative sentence. Interrogative means asking question. Purpose is to ask questions. Interrogative. You heard of? You want the spellings?
Interrogative.
Yes, Father.
Interrogative. INTER. OGATIV. Interrogative sentence. Where are you from? What's your name? And you require these things for your speaking. Okay, very, very important for your speaking. And many people struggle because they do not know how to ask questions. And I have one whole video about this. One session on this, how to ask questions in your speaking. If you ask the wrong questions, you will be penalized. There's a word structure for the questions. Question word, subject, no, question word, verb, subject, rest of the question, and question mark. Okay, imperative. So you have declarative, interrogative, imperative, and exclamatory. 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 Exclaim how great it is, how wonderful, how nice the day is, how wonderful is the session. Exclamation is you are surprised. Then last one is optative. OPTATIV. It is pronounced as optative. Optative means wish, desire, blessing, all those. May God bless you. May you live longer. Have a great day. Wish, desire, blessings.
Do we use this one in all the things in the writing?
No, you don't use. You only imperative. You use declarative. You use positive and negative. You use declarative statements, right? Interrogative questions, you have to ask questions in the speaking subtest.
Yes.
And imperative, you are going to use again. I'm going to tell you this on the screen. Imperative. Okay. Imperative in the OET.
Division according to what, Father? You said?
Division according to the purpose. Yeah. In English, sentences are four types based on the structure. 5 types based on the purpose. What is the purpose? To ask question and get answer, or to show your surprise, or to convey your wish, blessing. And so structure-wise, 4 types.
4.
Purpose-based, 5 types. And based on the style, there are 7 types that you don't require for your OET writing. So we won't go to that. So here you have 3 exclamatory and optative you don't use in your OET, but other 3 types you use. Declaratory, both the types like positive and negative you have to use. Interrogatory, you have to ask questions in the speaking, and imperative also you have to write in your this one. Imperative means instructions, recommendations, or requests. Imperative sentence. What will be used for recommendations? Anyone?
It would be grateful if you could.
Yeah. What is the verb used? Special verb?
Highly appreciated.
Yeah. Modal verbs. Exactly.
Could.
Modal verbs.
Could.
Yeah. Yeah. When you give instructions to the next person, health professional, or recommendations or making requests. In the last paragraph, you have to use imperative sentences. For example, please monitor her medication compliance. Please monitor. When you use please, that becomes imperative. And please monitor. Modal verbs used for imperative, recommendation, clinical requirements. Example, he requires an endoscopy. He requires an endoscopy. What is the modal verb here?
Requires.
Requires is the synonym of must. Requires means must. So that's the model. Clinical requirements, recommendations, modal verbs. Modal verbs to express your needs, need expressions. Should, may, would. These are the 3 modal verbs usually used in OET writing. But in reading, you have 5 modal verbs. Use to communicate professionally, clearly, and politely. Modal verbs are used to communicate professionally, clearly, and politely. For example, colloquial language, you need not use all the modal verbs. Okay? Use for recommendations, clinical requirements, requests, and advice. He requires an endoscopy. Saiban should be discontinued. You have in the last paragraph, right? Saiban should be discontinued.
Discontinued.
Yeah, that is imperative sentence. Then infinitive, you need not know. That's not very important for you. Infinitive means, infinitive form of the verb means 2 plus base form of the verb. For example, in the purpose you write, to express a purpose or advice or intention. She was advised to stop smoking. To stop smoking. Stop is the base form. Verb form 1. So infinitive, if at all you need to understand what is the structure, that's not very important for you to understand. You know, she was advised to. She advised stop smoking, you can't say. You have to say, she was advised to stop smoking. Gerund ing forms, you know, right? After verbs such as start, continue, avoid, enjoy, recommend, consider. After these verbs, you must use the ing form. Otherwise, it will be wrong. Whenever you use these words, next form will be ing form. She started using nicotine patches. He started using. Okay? You can't say she started to use nicotine patches. It should be ing form. It must be ing form. Got it? Normally, in the OET, you have these verbs and following the ing form. We call it gerund. Ing form of the verb is known as, the name is gerund. Gerund. Using is gerund. Singing is gerund. Sleeping is gerund. You need not remember those words, okay? But just understand the concept. Now, when you go for self-assessment, all these questions you have to see. You will check your letter with all these criteria. Have I used these words? If I used after that word, what is the form I used? Power failed, hope things will be cool. And prepositions. Show time, place, reason or topic on 10th January with pleurisy, about nicotine patches, or side effects. Okay. So these are the commonly use it on. Okay. With the condition you always use the preposition. Any condition with, she was diagnosed with pleurisy. Any condition you have the preposition with. About, she was advised about nicotine patches. You have to observe her for side effects, 4 side effects. There are very few usages, very simple usages. Time clauses indicate when an action ends or begins. Until her cigarette cravings are controlled. You have to continue Zyban and nicotine patches until her cigarette cravings are controlled. Not very important, just to give you an idea. Punctuation. Where do you put full stop? To end complete statements. End of every complete statement. Comma. Before coordinating conjunctions, joining 2 independent clauses. That's what somebody asked me. Should you put comma before and? So you can put. You need not put. Both are optional. So one occasion is that after introductory dependent clauses, always make sure you put this comma. This will be penalized. After introductory phrases or dependent clauses, you must. For example, you're writing a complex sentence, dependent clause plus comma plus independent clause. But if you are starting with independent clause, please don't put comma. Okay? All subject complements should be separated with comma. All the subject complements. After introductory phrases, in the morning, comma, in the afternoon, comma, after the surgery, comma. Those are known as introductory phrases. Means that is not the part of next sentence, right? So they have to go get a support. All the introductory phrases. When it comes to the paragraph, I will show you. To set off example phrases such as dry mouth and insomnia when appropriate. Before such as, you have to start with a comma. Are simple things you know already. This we have done. Do you want more exercise on this? Sentence formation?
We have done it.
This one? No, that is different. I have more like, this is previous one. This is what you have done? No. This one you did, right? No.
The first one only. Yeah.
First one you did it.
Yes.
We have all the question note. This is the second step. Then this is the third step. This is the fourth step. These are the class notes from Mavis Banton, all these. Otherwise, you can do it at home. I can send you the screenshots. What do you say?
Yes, we can do it
Yes,
at home.
please.
Yeah. These are all case notes from this one. So only after writing them into simple sentences, you'll be able to go into compound sentences. Let's check. We'll go to the. Shall we go to the types of letters then?
Can I ask you something further?
Please.
Or request if there is possibility.
Please.
Could you just revision for us how to write inappropriately a simple sentences and a compound sentence? I know it is like obviously, I'm not sure 100%, but if you could help us in this type.
Yeah, simple sentence you have understood now. Did you join just now?
No, I'm with you.
Okay. Maybe let me take. Now we are going into those steps. For example, now we have done simple sentences. You did an activity when I went for lunch, right?
Yes.
Yeah, and I explained what are the components of simple sentence: subject, verb, object, in connection with even in comparison with other languages.
Yes.
You understood that as well, right?
Yes.
So now, what is a compound sentence?
It's
Connecting,
connecting two simple sentences with and or but or.
Yeah, one coordinating conjunction. Just simply saying two sentences with a coordinating conjunction.
Mm-hmm.
Okay, and probably let me take one check. Do you check?
Thank you for
remember we have left at a passive voice. Okay, just remember. Is it needed for others as well?
Sorry.
Others also need this same thing, or I'll
I have
keep
a
it for the
question.
end. Yes, please.
My question is that for the comma, you said that when you are making complex sentences and there's conjunction between them, if you do not start with comma, you should just maintain that that pattern. So my question is that what about if you have two independent clause? Is it okay to still add comma since you do not start with comma pattern?
If you have two independent clauses, after one independent clause, you have conjunction, right?
Yeah. Yes.
Same question. You are asking the same question. I'm coming to you. Somebody asked me the same question. You are asking in another way. I'll just show you something with examples. You will not understand if I just tell you. I'll give you with examples. Give me 1 minute. By the meantime, if you have something, you can speak or discuss. Or you have your snacks. Hello.
Yes,
Yes,
Father.
we can hear you.
Yes,
Yes, we can hear you.
Yeah, there, Father.
And beginners, remind me before you go, we will put you in a separate group. We are starting in August, where we'll have a separate YouTube channel for you, where we'll upload exactly step by step and we'll give you tasks step by step. If I forget, just remind me. There is one instrument having some disturbance. In the meantime, just post me some messages if you love the thing just in the YouTube comment space. Chat has gone to 1. If the chat rate is high, we will reach out to more people. That's the support you can give us. Simply post some messages. And like others' messages as well. And if you have not liked the video, just like. It helps to reach more people. I'll just show you the timeline before that, since I saw it and I was searching for your answer. Just listen to this, okay? Timeline is given in the use of tense. Let me share.
Look at some other aspects as well. So use of tense, using present tense, I do.
Can you hear?
Yes,
Is it audible?
Father.
Yes,
So
Father.
he do, he does, he makes,
Yes,
he comes.
Father, yes.
Third person simple, we'll be dealing with it. Do, make, come, that is present simple. Past simple is did, made, came, he did, he made, he came. Using the present perfect, he has done, he has made, he has come, we have done, we have made, we have come, all those things. And using the present continuous or work, or I usually use as present progressive. He is doing, she is doing, making, and she is coming, all those things. So we'll be going into detail of these things. Okay. So use present simple tense, and using the present simple is do, make, come, examples. So use of present simple tense, why? To report unchanging facts in your case note. Why do you need to use the present simple tense? Or present, a simple present tense, whatever you want to say. To report unchanging facts. Information is true in the present and is not subject to change anytime soon. It's not going to change in the near future or immediately. So the purpose of using simple present is to report the unchanging facts that is given in your case note. And where do you use present simple sentence? At the beginning of the letter. Okay, when you report the patient's name, age, and status. This particular part, in the beginning of the letter, you have to use the present simple tense. And next, for example, the patient is 29 years old. She is divorced and has 2 dependent children. This is simple present tense. The patient is allergic to penicillin. This is also simple present tense. So also, this is used to provide the patient's unchanging status and profile. Whatever is unchanging in the present condition of the patient, you use simple present tense to provide patient's unchanging status and profile. You use simple present. And use of simple present tense when something happens on a regular basis, frequently, or happens now, and happens now. Something happens frequently or on a regular basis, and it is happening now. So for example, Mr. James, the construction sentence should be, Mr. James experiences chest tightness. It is not Mr. James experiences chest tightness. That is a common mistake you make, and it's one of the major, we can call mother mistakes in OET. Subject to verb agreement. When the subject, Mr. James, is third person singular, in the present tense, the word should carry with it S or ES. Okay, that will be explaining. Mr. James experiences chest tightness, which means Mr. James experiences chest tightness on a regular basis. Happens frequently, and now he is still experiencing chest tightness. So that's why we use simple present tense. And use of, for instance, simple sentence versus case notes. For details such as lifestyle choices, the present tense is appropriate. Where do you use in the case note? The present simple tense. Lifestyle choices. When you speak about lifestyle choices, you have to use the present simple tense. For example, despite previous advice, Mr. James is still smoking 20 cigarettes a day. So, despite previous advice, Mr. James is still smoking 20 cigarettes a day. Still, even now, he was smoking, he is.
What type of sentence is this?
Complex.
This is complex sentence. Complex sentence construction is dependent clause. Despite previous advice, If dependent clause is written first, you must put a comma here. Otherwise, it will be penalized. Mr. James is still smoking 20 cigarettes a day. You can write the other way about Mr. James is still smoking 20 cigarettes a day in spite of the previous advice. Then you need not have the comma.
Smoking. So we are giving him the details, his lifestyle stage detail, his habits. Okay. There you have to use present tense. Again, to describe the patient's current social background, B I have put capital because
in this one you have seen why B is put background. B capitalized. Any idea why I have written B capital?
Use it as a name.
No. Background comes under ISBAR. 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 The background. If there is background, now you see it becomes so easy. Where you have to use present simple sentence, the background side heading is there, right? Whatever you speak about that background, for example, we have seen, but most of the background was irrelevant for us. But if it is relevant, you have seen the background side heading in our Marvis Brampton, right? That is in the beginning itself. You have background, right? So here, everything has to be written in present simple tense. So you know the construction, how you have to write those things. So ISBAR B is put capital because background comes under that column, third stage. I, introduction, situation, background, then assessment and request.
I am also assuming that you have in place. The background B is given capital because I want to highlight that we presume ISBAR. So to describe the patient's current social background, you have to use simple present tense. Now, if you know ISBAR, you can clearly make down between background. You have to use simple present tense. What tense has to be used? So tense is the crux of communication, I tell you. Tense decides in the impact, the meaning, and what the reader understands about your patient. For example, Mr. James smokes 20 cigarettes and drinks 2 bottles of wine daily. This is a background given, social background. So this is simple present tense. You have to construct sentences from case notes in simple present tense. There is no confusion. It's exactly clear, crystal clear. Use the simple present tense. Okay, Miss Jessica is overweight and has a BMI of 27.8. Mr. John lives in Lake Park with his 70-year-old wife, Mary. So these all are simple present tense. So when you speak about an ISBAR background, social background, you have to use simple present tense. That's why I said you don't require a personal trainer, or once you complete this course, maybe 2 more sessions on writing, you don't require anybody to correct your letter at all. You can make out, because I'm teaching you every sentence structure and where it has to be played, which tends to be used in particular aspect in ISBAR, in particular constructing sentences for particular case notes. Everything will be crystal clear. So write down the things, practice it, and you should be a teacher for yourself. You should be able to assess your own letter. That's the best part of it. That's called experiential learning. Again, I'm going extensively on use of present simple tense. It's also used to describe anything that occurred during hospitalization that is still continuing. Simple present tense is used to describe anything that occurred during hospitalization that is still continuing. When you're writing the letter, still it is continuing. The condition is continuing. Mr. James needs assistance with dressing, toileting, and transferring. See, I have put still within brackets. Mr. James still needs assistance with dressing, toileting, and transferring. So still is optional. Whether you need to write there, you don't write there, it doesn't make any difference in the meaning. So even by writing, you will be penalized. Even if you don't write, still you will not be losing anything. So it's up to you. If you want to fill in the words, definitely you can use. But if you need to write more, you can avoid. Mr. James needs assistance with dressing, toileting, and transferring. Okay, so something that is happened during hospitalization, still it is continuing. So the reader will understand what is assistance to be given to the patient or client you are referring to. Okay, yes. Miss Jessica consumes a low-calorie diet in order to maintain her weight. So she is consuming low-calorie weight. She was consuming, she is consuming, she will be consuming. She has to be provided with that. Hope that is clear to you. Yes, present simple. See, repeated action. Yesterday it happened, now it's happening, tomorrow it will happen. Okay, I eat lunch every day. So present simple timeline is this. This is present, this is past, this is future. It was there, it is there, it will be there. Repeated action or habits, we say. Okay, Mr. James experiences chastisement. That he was experiencing, he is experiencing, he will be experiencing. So this particular small sentence tells the reader he has to take care of his chastisement. He'll have to consider continuing care or whatever the management of his chastisement. So the very sentence, the tense tells what is to be done and what is expected of the reader. Okay, now simple present sentence syntax. Past, now, future. I'll be just explaining all the details in simple present tense, in contrast to which you'll be able to understand the other forms as I am teaching. I may not be explaining every detail over there because it takes a lot of time. And for example, he likes ice cream. Okay, let's see the syntax. He likes ice cream. That is simple present tense, which means he likes you. He liked it in the past. He likes it now. He likes it even in the near future. So he likes ice cream. It's called a subject, verb, object. If you remember the basic sentence structure I taught you, subject, he likes, verb, and ice cream is object. But in all the Indian languages, it is not SVO order, subject, verb, object. It is always subject, object, verb. So it will be transferred. For example, Malayalam, Avanu Madhura Palaharam Ishtama. Avan is subject, Madhura Palaharam is object, Ishtamana is verb. So in Malayalam, SVO is transferred into SOV, the syntax. And in Kannada, Avanige, Sihitindi, Ishta. Avanige, Avanu, subject, Sihitindi, object, Ishta is like verb. So again, SOV order in Kannada. Or else if you go to Tulu, Ayag, Chipetindi, Ishta. Ayag, subject, Chipetindi, object, and Ishta is verb. So you take any language, Tamil, Telugu, Hindi, whatever the Indian languages, the sentence structure is different. That's the main difficulty or challenge that we face in fluency, because we think in our mother tongue, we call it L1 influence, mother tongue influence. We think in Malayalam or Kannada or Tulu or Tamil or Telugu. Then in the process, when you have to speak out, you have to change the structure of the sentence. SOV has to be changed into SVO. He likes ice cream. Otherwise, for example, if you ask some small kids who are just learning English, ask them, Avane Madhura Palaharam Ishtamana. If you ask them to translate it into Avane he Ishtamana. Avane Madhura Palaharam. No, sweets. He sweets likes. So in the same order, they will repeat. He sweets likes. Subject, object, verb. But in English, it has to be changed over, and it has to be subject, verb, object. He likes ice cream. So basic syntax, you should be very thorough with. So he is subject, likes verb, ice cream object. Third person singular. He is third person singular. First person is I. First person singular, I, plural, we. Second person singular, you, plural, you. Third person singular, he, she, it. And plural is we, they, other things. So this is third person singular. That's why we have S with the verb. Like it like becomes likes. So the timeline, as I said, the present tense expresses a habit or often repeated action. Adverse verbs of frequency such as often, seldom, sometimes, never, etc. is used with this tense. Let's see. He goes to work every day. See here, go, ES is added. Goes to work every day. They always eat lunch together. They eat lunch together. There is no S with the E, T, because it's third person, plural. It's not singular. So what happens? Coming to this area, third person, singular, and verb, ES is added. Third person, plural, S is not added to the verb. Yes. And adverbs of frequency. What is adverbs of frequency? there is a scale being used here. Just understand what is scale, you know. Always I have been explaining. Always, that's why I said these are things are 7 Sapta Sutras, 7 principles are required in all the 4 sub-tests. Even in writing, when you use, you have to be able to, you must be able to use the scale. Adverbs of frequencies, always, often, then coming down sometimes, seldom, and at last, never. So you see the scale coming. Always means not often, often means not sometimes, sometimes it not, seldom, seldom means not never. So the scale from the top to bottom, it becomes just contrast, the opposite. So this is the whole process. And simple present tense, as I said, verb will simple present tense, third person singular will go with it with the verb s or es will be added depending on the verb format. Mr. James experiences chest tightness. She goes. Go becomes goes to work every day. Yes. Now coming to present progressive. I hope present tense is very simple. It's very easy, and it's called simple present, and it's very simple. So use of present progressive. Using
Hello,
the present
Father.
continuous
Yes.
or progressive, whatever call it.
Please, I have a question.
Yeah, please.
Please, can you go back to the during hospitalization, that slide?
Here?
No, sir. See, go back, please.
Earlier?
Hospitalization. Yes,
one?
please. Here,
Yeah.
yes.
Yeah, yeah.
You said we should use present simple tense.
Okay.
So during hospitalization is like these are the care that you've given to the patient.
Okay.
So can I call me like during hospitalization, Mr. James still needs assistance with dressings, toileting, and transport because I'm reporting.
Okay, but if you start during hospitalization, if you start during hospitalization, comma,
yes,
you have to
comma.
use past tense. Then you have to use past tense.
Oh yes, that's what I'm trying to understand.
Yeah, yeah. But then there are different ways of presenting. That's what I said. Now, otherwise, you can use the simple present tense using that already he is, the tense itself tells them without telling them he requires further, continuing the same. The tense itself will tell them he still needs to continue that particular treatment or medicine. You get the difference. But if you say during hospitalization, you are speaking from a later point of view.
Yes.
Timeline.
Like
you are
reporting.
saying during hospitalization he was responding well.
Yes.
Okay. That during hospitalization, if you start with that, it becomes past tense. Yeah. You have to use past tense. Yeah. Clear?
Yes.
Yeah. That is a sentence construction. Yeah. That's why I said sometimes you can use in the same sentence I have showed you, present perfect and simple present in the same sentence. One clause is present perfect, one clause is simple sentence. Okay, to avoid this confusion, why this is present, and I showed you, some sentence about she was smoking, something like that, since the age of 18, and she is currently smoking 10 cigarettes a day, which means first one is present perfect, next one is simple present. In the same sentence, two clauses are two tenses.
Okay.
Is that okay? Yeah, you have to immediately ask. Otherwise, you would have been thinking about that doubt now till now. That time will be wasted for you, right? So immediately you can stop me and ask so that you clarify it. Maybe we will go a little faster because these are simple things. Let me check. For instance, as I explained. One sec, I'll get back to you. You can ask me in 1 minute anything. I'm getting back to you. Somebody else's question was there, right? About the one sec. I'm just trying to answer them. But in the meantime, anything you want to ask so that we have a relaxation? The previous 2 questions I have to answer, right? Hello. Hello.
Yes, Father.
Yes,
You
Father.
are here. No
Yes, Father.
response.
Yes, Father.
I thought
Yes,
all of
Father.
us slept. I thought all have slept.
No, listening to you.
No.
Listening to
Yeah,
you, Father.
but we have been taught by British Council that there is something called a TTT crime. You know, in teaching there is a criminal offense called a TTT crime. It is known as. Have you heard of it?
No.
TTT means teacher talking time crime. The teacher should not speak
Oh, we can
always. The
hear
students
first
should
time.
interact. Students should interact. Teachers must not be talking continuously.
Oh.
Then they are known as criminals. So you want me to be a criminal?
No, Father.
Then you have to interact. As per our rules,
No,
when I
actually,
teach
Father, listening to you.
yeah, no, when we teach language segments, it is strictly taught to us. If there are 60 minutes, you can use only 15 minutes, including your greetings. Did you understand?
Yeah.
Yes, Father.
Yes. Now I am a criminal from morning. Damn criminal. Yeah.
No, Father.
We are
But I
learning
mean,
so many things.
this is not learning. This is enjoyment. I feel such nice things in life.
Interaction.
You should.
Yeah.
I just take some PPTs for them. Those who asked the question. Interact something. Ask me something in 1 minute. Or you yourself describe something. How do you feel? Writing. What did you learn today? Let me see.
Hello, Father. I have a
Yes,
question.
please. Yes, please.
Actually, it is a request.
Yeah, please.
Can you anytime explain a letter as a pharmacist? A pharmacist who is writing a letter.
Yeah, I'll be able to, but the problem is the platform, no? You understand? The platform, like we will not have even 2 people to have listen to the sessions. I'll
Yes,
try,
sir.
but then there will not be people. Pharmacists are very, very few.
Yes, sir. Only few.
Yeah, but then
Only
there is no
few.
difference. Maybe
That's
I'll try
why
to.
even
Yeah,
even in other
Yeah.
platforms also, it's like mostly we can see nurses and doctors not related to pharmacy.
Yeah.
Pharmacy are
So
just few only.
okay, I'll try to maybe take a sentence just to show you what are the differences, or maybe there is not many differences. Okay,
Yes, sir.
we'll try. Let's see. Maybe you can make a group of pharmacists and see how many are there. Okay, there is no big difference.
Yes, sir.
Okay, as regards competency, everything is same. Yeah, simple. Somebody was asking, pharmacist, you remind me, okay, later?
Okay, sir. Actually,
Okay.
there is difference that there is 3 persons involved. One the
Yeah.
patient, second one is the doctor, and
Okay.
third one which is you are going to any care, any home care, or sometimes it give you 4% to involved in this letter.
I didn't get you, sorry.
I think there is sometimes they involve 4%. One you have to
Okay.
write to doctor.
Okay.
Second one the
Okay.
pharmacist, patient, and home
Yeah.
care.
Okay, understood, yes. That's okay. That doesn't
Yes,
mean
sir.
much difference, only a slight difference. Let's see
Yes, sir.
how it goes. We'll work out on it. Okay.
Okay, sir. Thank you.
Now somebody was asking 2 questions. 2 people asked me about simple, compound, and complex, right? Hello, are you there?
Yes.
Those who
Yes, I'm
those who
here.
ask those questions, are you here?
Yes, I'm here.
Yes. Just see
concern they
this
have
this
expressed
on
their
the screen. Can you hear?
concern
Yes.
regarding sentence structure. Those who are not muted, please mute.
Yes, Father.
So simple
Yeah.
sentence and
Can
compound
you
sentence.
a little
There are
bit
three types of
loud,
sentences, four types you can say. One is
Louder?
please?
Maybe you can increase your loud in your headphones.
Yeah, I do it 100.
Yeah, in your own
Thank you
instrument you
for
can
that.
increase.
Yeah.
Yeah.
simple sentence. One is compound sentence. Other one is complex sentence. Even you can construct compound complex sentences. But usually you don't need to. If you are not competent enough, better not to try for compound complex sentences. So now, if you can express your competency in simple sentence and compound sentence and complex sentences, definitely you will be able to do it. As you have a piece of paper, could you write one simple sentence fast? Let's have 3 minutes interaction. And either you can, if you are comfortable, you can put it in the chat box, or you can write on a paper and take a, if you are comfortable, don't get disconnected. If you are comfortable handling your phone, using your phone, take an image and send it to my WhatsApp soon. Okay, good. Now give me one compound sentence. That's fine. All of you have done well. Okay, I like to, yes. Now compound sentence, yes, she smokes and drinks alcohol every day. I'm writing a letter with the help of his notes. No. Compound sentence, no, none of these are compound sentences. Sita and Dina playing cricket, no. She smokes as well, drinks alcohol, okay. The patient is complaining of chest pain, so the treatment was initiated to control her pain. Fine. Anybody can try one complex sentence? Complex sentence. I'm late to office because I missed bus. I like, okay, complex. However, she required assistance. Complex sentence. She has had hypertension since 2004 now. She has been initiated with physiotherapy, which is to be continued. She is suffering with diabetes and hypertension. She had been feeling unwell before admitted to hospital. Okay, fine. Okay, good. We'll get into it. It's a simple thing. Very easily, I'll teach you how to construct the sentences. So here you see she is a regular smoker. Is a simple sentence. Simple sentence means it has a subject and a verb. Means it can stand by itself. It's a complete sentence by itself. She is a regular smoker. You know, she is the subject, is the verb, a regular smoke, the object. Okay, she drinks moderately on weekends. That's also a sentence. Now, how to make it a compound sentence? Using these two sentences. She is a regular smoker, added or plus she drinks moderately on weekends. You can combine both of these and write she is a regular smoker and drinks moderately on weekends. The repeated she is removed from here and a conjunction is added here. Okay, I'll come back to it later again. See, now you have case note like this. Okay, weight 86 kg, height 157 cm. Peterson concerned about weight gain of 8 kg over last 12 months. How can you convert this into a sentence? Okay, now she has gained 8 kilo over the past 12 months and currently weighs 86 kg. See, she has gained 8 kg over the last is synonym used is past 12 months. And mind all those golden principles, 7 sutras, Sapta Sutras, 7 principles, it has to be applied in all the modules. So when you try with your case notes, if you can find a better word, a synonym, definitely you can use it. That shows your competency in language instead of repeating the same thing in the case note. However, if there is a technical word which is given with clarity, definitely you can repeat it. Yeah. So this is how you summarize this case note. Okay, this was the question by many people. And I'll be giving you many examples of summarizing. So this is the third one I'm giving. Yes. All these things, you know, post-operative, as I said, if you have to use some synonymous language, post-operative recovering from after, there are discussions recovering from a condition and recovering after a surgery. But then even if you write recovering after recovering from a surgery, that will not be penalized. So what I want to tell you here is there are different approaches. The problem is a lot of confusion being created because each institute sticks on to a particular expression. And they will say this is wrong or that is wrong. But both are accepted by OET. But then, the competency will be shown when you use the proper thing over there. Other one doesn't make you bad, or your score will not be penalized, even if you say recovering from a surgery. But then normally recovering after a surgery, not from. There is a technical hinge over there, or a technical skill that you are using. Even if you write recovering from a surgery, you will not be penalized. But what I'm telling, the better options or better competency you can prove. So don't say this is the thing that father has taught, the other one is wrong. It's not other one is wrong. The better options we are teaching you. Okay, you have the freedom to use any formation of the sentences or any vocabulary that you are comfortable with. And that's what the competency means. It's not that copy somebody else's sentence or expressions or vocabulary. Okay, further care, follow-up care, same palliative care, spice care, all these are synonyms. You can use what I said. You have to use the Sapta Sutras in all the modules. So I am giving you some examples. Was diagnosed usually for short-term diseases, has been diagnosed long-term diseases, and continuity of care can be used as ongoing care. And this question mark here, it says is suspected to have some condition or disease. All those things, those are the basic things. Okay. Again, we are jumping into sentence structure that I gave you the need for using your Sapta Sutra. One of them is synonym or synonymous language or paraphrasing. So simple sentence, she has gained 8 kg over the past 12 months. Okay, that's what we formed the sentence here. Please mute. She currently weighs 86 kg. So this is we have converted into a compound sentence. That's what I explained. She has gained 8 kg over the past 12 months and currently weighs. So what I told you is later or past or different expressions you can use, synonyms and synonymous. So paragraph structure. Now, we wrote many sentences, but that doesn't make paragraph. Having those sentences, you will not be reaching or addressing the assessment criteria that is cohesiveness, means the linking or the logical sequencing of the paragraph. Write the sentences together with the help of transitions to make a cohesive paragraph. So the skill of using transitions will show the competency. Now you see here the patient's medical history.
This was one question which you asked in the very morning. Hope the person is here about using transitions, sequential signals or words.
Is unremarkable. That was a separate sentence when we framed from the case notes, comma, but she has gained 8 kg over the last 12 months. See, we combine those two sentences into one using a conjunction, a contrast expression, but. Apart from that, see transition, apart from that, she is a regular smoker. If you don't want bracket, you can ignore it, or you can write it, they will not be penalized, but without brackets also, she is a regular smoker, gives the meaning, but regular smoker means it can be 30 cigars per day, to 20 or to 10 cigars per day, different things are there, and drinks moderately on weekends, So there is another conjunction being used. 2 conjunctions and 1 transition expression. So this is the competency being expected from you when you summarize. Actually, we had this particular, the patient's medical history is unremarkable as one single sentence when we summarize the case notes. And she has gained 8 kg over the last 12 months was another sentence. But then we combined both of those sentences and made it to one sentence using a conjunction. Apart from that, now the transition expression being used, she is a regular smoker and drinks moderately on weekends. Hope you have understood. That's very clear. So you have a contrast here. Again, Sapta Sutras, conjunction is here. Okay, transition is here. Those 3 aspects. If at all you don't get the slides, I can run over after the sessions once again to take the screenshots if you need. Okay, don't worry. Perfect. Now sentence structure. Present perfect progressive, or what you call present perfect continuous. Okay, If I'm using progressive, I am accustomed to that expression. Understand it as continuous. What do you say? Present perfect continuous. It's not present perfect progressive. You know, have or has plus been plus ing form of the verb. The gerund ing form of the verb is the structure of present perfect continuous or present perfect progressive. Examples: has been getting, has been taking, has been trying. All these are the has plus been plus ing form of the verb. Getting, taking, trying, seeking, all those things. Okay, present perfect progressive. Just see how it goes. Yes. When to use present perfect progressive? When to use present perfect progressive? That's has been or have been. Repeated action that started in the past and continues to the present. Repeated action that started in the past and present continues to the present. If it goes even further, expected to go even further, it's a routine action, habitual action, you'll be using simple present, not present perfect continuous. If it is a habitual, any habitual actions, like smoking, drinking, or habits, then you'll be using simple present. Okay? Repeated action that started in the past and continues to the present. It started last year, and it still the present action is being continued, or it is still existing. So that you use present perfect progressive. See, Mr. James has been taking painkillers to manage the pain. So he has been taking painkillers means he was taking and he is taking even now. Action that started in the past and continues to the present. He has been taking painkillers maybe since so many years. Even today he is taking painkillers. Hope that is clear to you. Starts in the past and continues even to the present. And they have been trying to conceive for the past 12 months. They have been trying. Means they were trying in the past. Even today, they continue to try to conceive. So action in the past, continue to the present. There you use has been or have been. Okay, has been singular and have been on the present. Dependent clause, you have list ideas or items, list of ideas and or items. So these are the. Now next question was common ways to use commas. So I'm going to tell you about the compound and complex sentences in this context, because commas can be used in different ways. One in compound sentences, other way in complex sentences, in introductory phrases and the transitional phrases. Okay, and also when you list ideas or items, list of ideas and or items. So these are the occasions in OET where you use comma. Compound sentence, complex sentences, introductory phrases, transitional phrases, and also list of ideas or items. So complex sentences. Complex sentence means one independent clause and one dependent clause. Dependent clause cannot stand by itself. The word itself says it depends on another portion of the sentence. But in compound sentence, we saw both the parts of the sentence are independent clauses connected with a conjunction. So definitely both can stand by themselves as sentence. Independent clause contains a verb and is a sentence by itself. I told you in the simple sentence, it contains a verb and stands by itself. First, which clause first? If the independent clause comes first, don't use comma. I'll show you examples. Okay, which clause first? You can write in two ways. That's your competency. Even the complex sentence structure can be different ways. I'm going to give you two ways. There are many ways you can express yourself. Don't say this is the only way. This our mentor has taught this. This should be the way. No, there are many ways. For your competency, as I assessed most of you, that's why we have selected participants today. We have taken this particular customization of the class. So if the independent clause comes first, don't use comma. If the dependent clause comes first, use comma. If the dependent clause, which depends on the later part of the sentence, you have to use a comma after dependent clause. I'll be giving examples for that. We'll look into the illustrations. Okay. Now complex sentences. which clause first? Treatment will begin after a full diagnosis is made. Independent clause is treatment will begin. So treatment is a subject, will begin is a verb. It's a complete sentence, subject plus verb. And dependent clause is after a full diagnosis is made. After a full diagnosis is made is known as the dependent clause, which depends on this full sentence to exist. Otherwise, it will not make sense. If the independent clause comes first, do not use comma. Okay. If the independent clause comes first, do not use comma. If the dependent clause comes first, use comma. Let's see how. See, if the independent clause comes first, don't use comma. Treatment will begin after a full diagnosis is made. There is no pause in between. If there is a comma, you know there is a pause. Treatment will begin after a full diagnosis is made. So treatment will begin is the independent clause or the sentence by itself. After a full diagnosis is dependent clause. So when you start a complex sentence, this is known as a complex sentence. If you begin with the independent clause, don't use comma after the independent clause. Between the clauses, there is no comma. Independent clause, treatment will begin. Subject verb is a complete sentence. And dependent clause, after a full diagnosis is made. Yes. If the dependent clause comes first, use comma. Let's see how that same sentence can be changed. See, previously we started treatment will begin after a full diagnosis, but now the independent clause comes in the beginning of the sentence. After a full diagnosis is made, treatment will begin. So when you write in your OET letter, try to interchange these structures so that will show your competency in using the language. But then when you put dependent clause in the beginning of the sentence, make sure after the dependent clause, there is a comma here. Use comma. Otherwise, you will be penalized. Dependent clause, after a full diagnosis is made, then you have the comma. Then independent clause, treatment will begin, subject verb. It's a, as I told you, it's a complete sentence by itself. Now, if the dependent clause comes first, don't use comma again. The patient's symptoms aggravated is the independent clause. So no comma after that due to non-compliance with medication. So we don't pause after they are aggravated. The patient's symptoms aggravated due to non-compliance with medication. Independent clause, the patient's symptoms aggravated. Dependent clause, due to non-compliance with medication. This due to non-compliance with medication cannot stand by itself. It doesn't have meaning by itself without this independent clause. If the dependent clause comes first, remember to use comma. Otherwise, it doesn't give meaning. Due to non-compliance with medication, the patient's symptoms aggravated. So, comma after the dependent clause. So, you are using here. Earlier, you used due to non-compliance with medication, the dependent clause at the end of the sentence. Now, you start with the dependent clause and put a comma, then write the independent clause. The patient's symptoms aggravated. Again, do not hesitate to contact me if you require further information. Perfectly all right. But then here, subject you is understood. You don't use here. Independent clause is do not hesitate to contact me, which means you do not hesitate to contact me. You is silent. You need not mention over there. So dependent clause is due to non-compliance. Sorry, that's an independent clause. Sorry, there's a mistake here. Let me check how it is. That was my mistake. Yes. Now, if you require further information, this is the one. Okay, do not hesitate to contact me if you require further information. You do not hesitate to contact me is the independent clause, but we are shifting it here. If you require further information, this should be capital. Do not hesitate to contact me. Do not hesitate to contact me. Then you have to use comma. If you don't use comma, you will be penalized. Okay, that's a grammatical error. This should be capital, I should be capital. If you require further information, do not hesitate to contact me, or do not hesitate to contact me if you require further information. Any one format you can use. Need not worry. You can fix one and use. Those are the templates which can be used. Not the doesn't belong to the body of the sentence. So compound sentence, as I told you once again, I'm telling you, independent clause plus independent clause means a compound sentence. Two independent clauses joined with a comma and a conjunction. Okay, we do not have the patient's records is one independent sentence. The procedure was performed at a different facility, another independent sentence. A comma after the first independent sentence and a conjunction, you know, fanboys, conjunctions, FANBOYS. 7 conjunctions, because the procedure was performed at a different facility. This is a compound sentence. Now the procedure was performed at a different facility. See, I'm taking the later portion of the sentence in the beginning, comma, so we do not have the patient's records, because becomes so. The procedure was performed at a different facility, comma, so we do not have the patient's records. So joined with a comma and a conjunction. Whenever the order of sentences, use comma and conjunction. Whatever the order of sentences. Okay, here it doesn't matter whatever the order of sentence. Earlier you said when you have a different order, like when you use dependent clause in the beginning, you have to use comma, even you have in the complex sentence. And when you are using the independent clause at the initial stage of the sentence, you need not use the comma. Here, be cautious, whatever the order of the sentence, whichever the independent, because both are independent clauses. So you have to use comma and a conjunction and connect it and make a compound sentence. Hope that is clear. Simple sentence, once again, I'm clarifying it, subject, verb, object, SVO order. If you have attended my previous sessions, in the basic sessions, I told you subject, verb, order. And the basic problem with Indian states is all our languages have SOV order, subject, object, verb, order. That's the difficulty with the fluency or challenge with the fluency. We have to translate within our mind and change the structure of the sentence as we translate before we speak out in English. Subject, verb, object, but in your Malayalam or Kannada or Telugu or Tamil, whatever, you have subject, object, verb. I have taught you that. You can go to my previous videos. See, Mr. James was sent to the specialist. Mr. James' subject was sent, verb, to the specialist. The cause of her headaches was unknown. Okay, those are the simple sentence. Compound and independent clause plus independent clause. Okay, here subject, verb, object, or subject and verb is a sentence by itself. Compound sentence, independent clause plus another independent clause added, combined or connected with a comma and a conjunction. Two independent clauses joined with a comma and a conjunction. So the example is, Mr. James was sent to the specialist, comma, because the cause of her headaches was unknown. So these two sentences are combined here and written into one compound sentence. What happens if you write all the simple sentences? They are known as run-on sentences. Run-on sentences, you will not be able to get a good grade or score. That's not actually competency of language. But you can definitely use some simple sentences, some compound sentences, some complex sentences. As of now, I am not going to deal with compound complex sentences. Okay, that is it. Now, if you want to visit any of the slides, let me know. You can just mention which aspect.
Did I answer that question? Somebody was asking about simple, compound, and complex.
Yeah, thank you, Father.
Is it clear? You have any doubts, any discussion you require on it?
Yeah, it's clear, so clear. Thank you so much.
All these things are there. Actually, we have, I think I might have taken so many sessions on this repeatedly. So we have in the YouTube channel, we will set it right for the next batch. We'll have it in the systematic order. Are you here? Hello. How is your stamina level? Yeah, how is your stamina level? Yeah.
Good.
Yes. Simple, is that clear for the person who asked the simple, compound, and complex sentences?
Yes, doctor. Yes, sure. Thank you.
The proportion can be somewhere like 30, 40, 30, and 20. Complex sentences, you require maximum 3 or 4. Compound sentences, you require a little more. And simple sentences, even more. So it's not a big headache. And we will gradually be telling you exactly which paragraph where you can use. As I already said in the introductory paragraph, you can use the present progressive, tense also. Yeah.
Thank you.
Do you need a break or shall we continue?
No, continue. Continue, if you can.
Okay. Now, others are like those who are there with me from the morning. Some have joined now. They will be full of energy. Yeah,
No,
some have
I'm
come
with you from the
after.
morning, but I'm with you from the morning, but I want to continue.
Okay, okay.
Thank you so much. Really lovely session.
Yes,
Hello,
thank
doctor.
you. Yes, please. Tell me. Hello? Somebody wanted to say something?
Sorry, I was talking to someone.
Oh, cool. Thank you. It's okay. Yes.
Father, I have a question. Yeah, is it okay if I follow the same paragraph structure in my writing? For example, start with a topic sentence and then making supporting and developing sentences. Is it required in writing?
In writing, actually, it doesn't be said supporting sentence, but like it is same, but then, you have to say some condition, something happened. Then you have to give evidence.
Yeah.
Then you have to give what are the evidences, like, no? Maybe,
yeah, I mean, okay,
yeah.
so the same paragraph structure, right?
Yeah, graphic structure, one example I can give you 1 minute. You mean how to use the paragraph structure in OET writing?
Exactly, yes.
That's your question. Okay, I'll get back to you. Yeah, discuss something for 1 second, 1 minute.
Okay.
Yeah.
Hello, Father.
Yeah, please.
I have a question.
Yes,
My
tell me.
question is that if you want to make a compact sentence without adding a conjunction or a fine boy, can you just separate it with a comma?
No, it cannot be. It can be a list. It cannot, and it is known as run-on sentence. That will be wrong.
Okay.
You cannot have a compound sentence without conjunction, but you can have a compound sentence without comma, Oxford comma. But you can never have a compound sentence without a conjunction. Compound sentence means two independent clauses or two simple sentences connected by a conjunction. Did you get it?
Yes, Father.
Yes. Yeah.
Yes.
Yeah. Yeah. Any other question? I'm reaching Dr. Salafat's doubt. Yes. If you have not liked the video, could you just like it? Click the like button and some messages. Chat rate is 0. Only Lini Varghese is supporting us with I love OET EduSkills. Every message you type supports this mission. Okay, you know this is the only platform which provides free training. Okay. Hello?
Yes, Father, we're here.
Yeah. Okay. Sometimes I feel you have abandoned me.
Hello, Father.
Yes.
Hello, Father. Abandon. I still want to get an idea clearly. For instance, now, if you continue a statement and you said, in addition, you now said comma, and then continue another sentence. That sentence, is it a compact sentence?
No. Compound sentence means it has to connect with a subordinating clause. Okay, I'll give you more explanations if you require once we come answer Dr. Salafat's query. Now, this is for your paragraph. Even I am taking it because someone else also asked me in the morning, the beginning, how to construct a paragraph. Okay?
Yes.
Just I'll give you a small example here, because when you see the PPT, you will understand instead of just blankly, roughly explaining you.
Yes.
Just let's play this. Yeah.
Dunbar has continued to consume excessive amounts of alcohol, fatty food, salt, and
sorry. Audible and visible, right? Hello?
Still,
you think of type 2 diabetes? Just say now. This is, I think, Peter Dunbar. This is a paragraph I have taken from Peter Dunbar. I'm just clearly telling you what is the structure of a paragraph. Imagine, visualize a patient, and what will you ask him if a patient comes to you in the hospital with type 2 diabetes?
How long have you been
taking
medication?
Are you taking any medication? Dietary habit and exercise.
So you will ask about the reasons. Did you eat so many chocolates? Complications? Are there some complications? They will speak about what the medication you are taking, the treatment, the management, exercise, everything. So just have an idea, just rough idea, visualize the things. Now could you just read this?
Since October 2018, Mr. Dunbar has shown signs of diabetic neuropathy and consequently mobilizes with a walking stick. His type 2 diabetes is controlled by metformin and through his diet. However, he remains resistant to any form of treatment and has not been compliant with his medication regimen, reporting poor memory as the primary cause of his neglect. On occasion, he also double doses. Contrary to advice, Mr. Dunbar has continued.
Did you say contrary to advice? This is known as the introductory clause. You have a comma after contrary to advice.
To consume excessive amounts of alcohol, fatty food, salt, and sugar since the death of his wife last year, contributing to his current condition. While his daughter will now be cooking for him, she will require some guidance related to his needs.
Okay, thank you, thank you. What is the main complication, main condition, main concept here in the topic sentence?
Diabetic
neuropathy.
Diabetic? Yeah, diabetic neuropathy. Yeah. Consequently, mobilizes with the walking stick. His type 2 diabetes is controlled by, what is this? Metformin and diet. Metformin and diet is the management or medication, right? Treatment. So this is the assessment, right? Diabetic neuropathy. That is what you call diagnosis or the result of your investigations. The medication being carried out was metformin and diet. Okay.
Right.
Then, yeah. But the thing is, however, there is a contrast word. Contrast word changes the scenario. So contrast word says something is going to happen. What comes after contrast word is important. He remains resistant to any form of treatment and has not been compliant with his medication regimen, reporting poor memory as the primary cause of his neglect. You see how beautifully the treatment has not been compliant with medication. They say medication regimen, then they are explaining it, reporting poor memory as the primary cause of his neglect. On occasion, he also double doses. Forgets double doses. Contrary to advice, Mr. Dunbar has continued to consume excessive amounts, that is diet, alcohol, fatty food, salt, and see, explaining this particular diet. Mr. Dunbar, okay. Then while now there is a structure. The whole thing, there is a structure that's being highlighted here, double doses, excess. The thing is this, the whole following part is explaining what? Medication and diet, right? Medicine and diet. How is not conforming to it. I'll go faster. Paragraph structure, diagnosis is diabetic neuropathy. Treatment is metformin and diet.
Hello? In the back section, in the back slide. This is not a repetition when we write in the first as a main sentences. Yes.
Which one?
Here, when we just say that we talked in the beginning about the diet and then we explain about the diet. This is not type of the repetition.
No, not at all.
No.
Here you see now that you'll understand in the next slide. Here you see, here metformin is medication, right?
Yes.
diet is lifestyle.
Yes.
Now, metformin is medication regimen, double dosing, all this explained about medication. Then about diet, what is that? Excessive amounts of alcohol, fatty food, salt, and sugar. This is not repetition. That has to be explained, no? Just by saying metformin, this is not at all repetition.
Okay.
This is what is given in the case note exactly. Now, when we said, like, however, he remains resistant to any form of treatment, we have to establish it. So we are saying he is not compliant with this medication. Then give us proof. What is the proof? He double doses.
Okay.
Okay? Primary
Yeah.
cause of neglect is memory, poor memory. He forgets. I did not highlight that. He forgets and he double doses. About diet, he consumes excessive amounts of alcohol and fatty food. Did you understand? That is not known as a repetition. What you understand the repetition is repeating the same information. This information is not repeated.
Yeah. Okay.
We are summarizing. We are not repeating, we are summarizing.
Okay.
Okay.
I get it.
Okay.
Thank you so
You will
much.
you will understand better as you go on. Okay, next
Yeah,
slide.
thank you.
Medication and diet, right? Not compliant with diet. Okay. One second. Diet. Paragraph structure. Diagnosis is diabetic neuropathy. Treatment is metformin and diet. Okay. Assessment is resistant to treatment. The patient is resistant to treatment. Evidence is, that is developing sentence. Evidence number 1, not compliant with medication, double doses. Okay. Evidence number 2, developing sentence 2, not compliant with diet, consumes excessive amounts of alcohol, fatty food, salt, and sugar. Evidence is given. Developing sentence. And management, now and next. Now what will happen? Daughter will be cooking for him. Next, what is to be done? Daughter needs guidance. See how beautifully the paragraph is structured. This is a particular paragraph based on. Did you understand the paragraph structure?
Yes.
This is really summary of the case note, exact summary of the case note. But there is a flow. First, you have mentioned what is the main issue in this paragraph. What are we going to say about diabetic neuropathy? Then treatment, metformin and diet. But then he was not. Assessment is that he was resistant to treatment. Evidence there, I missed one here. There should have been 2. One is he says, I forget to take medication, poor memory. Second one is double dosing. Then evidence about diet, not compliant with the diet, not compliant with the diet, consume excessive amounts of alcohol, fatty foods, salt, and sugar. See, diagnosis, treatment, assessment, management, now and next. Daughter will be cooking for him. Daughter needs guidance. This is the last but one paragraph. Last but one paragraph. One paragraph, one case note, one paragraph from that particular letter of Mr. Dunbar. Okay, that's how you can adapt your thing to mainly to your writing as well. See, diabetic neuropathy, metformin and diet, resistant to treatment. To evidence are given. Daughter will be cooking for him. Daughter needs guidance. How beautiful it is arranged in the. See now.
Yes.
How it develops.
Yeah, it's very nice.
Yeah, this should be there. That will be there. I tell you, if you take instructions within a month, you will write a beautiful letter than this.
Yeah, because you know, Father, we came across this during our discussions.
Okay.
I tried to apply the paragraph structure. There was one comment from our colleague, the same as Khadija said. They said this is repetition, and it's not good to follow the paragraph structure in writing. I told them, Father said, you can follow the paragraph structure even in your speaking.
Oh, definitely you can. You can.
Yeah.
I'll show you in speaking also. I'll show you. Here you see, if you want to go through that, see, diagnosed with the type 2 disease. Where are we? Somewhere here. Hospital treatment, doctor prescribed metformin. That non-compliant. See, now, doctor prescribed metformin. Okay. Now, patient cooking for herself, non-compliant with diet, non-compliant with medication, blames poor memory, patient appears unmotivated, resents having to take medication, always been healthy, takes medication intermittently, encouraged to take regularly, educated regarding need for regular medication and potential advice efforts of closing discussed strategies of memory aids. See, all these things are there. Nothing is a repetition.
Yes.
Yeah, it's not a repetition. You have summarized it. You have to say in a statement, what is the summary you are going to say in this paragraph? I am going to state that he has this issue and is not compliant with the medication and lifestyle regimen, diet. But I have to prove. What is the proof given in the case note? It is not taken from anywhere else. You can't just say.
Father,
Yeah.
so Father, you said for us in the first, the main sentences, we need to cover all the idea, then summarize it in the last of the paragraph.
Yeah.
Now, you need to do it in all case note, yes? Any case note.
All case
Yes.
notes.
So that's what we.
Yeah, that clearly gives the reader an idea. Okay, he's going to say about. Now, for me, as a doctor, I just want to know about his medication compliance. I know exactly reading that one sentence, I know they are going to say it here. Okay?
Yeah.
From the first sentence, I know they are going to speak here. I need not trust in other places. Not only that, do you think anything is repeated there? First sentence is that
No.
you have to say what is the issue, right? What is the issue? Diabetic neuropathy. Okay.
Yes.
Hello. Then you see they
Sure,
are
yeah.
saying we are speaking about the medication regime. Doctor prescribed metformin, all this. Now non-compliant with diet, non-compliant with medication. That's not repetition. That is here. I summarized and beautifully structured a sentence using these informations. They are saying non-compliant with diet, non-compliant with medication. Okay. Blames poor memory. Okay. It appears unmotivated is repetition, not required, because that doesn't go with that. Resents having to take medication means he is not compliant. Again, repetition. Always been held, takes medication intermittently. Medical non-compliance. Encouraged to take regularly. Educated regarding the for regular medication and potential adverse effects of internal. All those. Now, what I'm telling you, you take any of these letters, you can find the sample letters. It has to be that way. You can't put anything and everything everywhere. That's exactly the summarization of this pass. And when you now you have taken only one paragraph, when you understand in the context the whole letter, you understand it's very well. It's exactly 185 or so in 180 words, but summarizing all the case notes. But here in this particular case note, you have almost everything relevant. Most of the case points are relevant. So you have to summarize it. Does it make sense? Mainly to your writing as well. See?
Yes. I think this paragraph is written in the perfect way, but I think for me it is a big challenge to interparagraph organization. I feel it is difficult.
Difficult. Okay.
Yeah,
This is what I'm explaining is the paragraph organization, right?
Yeah.
Yeah, but then we will be analyzing and telling you different case notes. Then you will definitely understand. You'll get the idea. Now you see, you are in the initial stage. You are in the LKG stage of paragraph structure. Okay. See, now paragraph, you can't put anything and everything in a paragraph, right?
Yes.
Yeah. Can you do that?
No.
So it has to have a structure. Now, how to structure it? Can you write the last sentence first here? For example, I'll take to the paragraph. Can you change any of this order of these sentences?
No, we can.
Can you just suggest if possible? Can you put anything? Can you take away anything from this? Any one sentence? Without losing the essential thing?
The meaning.
The essential meaning? Or can you change the order? Can you put this sentence first? Mr. Dunbar has continued to consume.
I think it is difficult. Yeah.
Yeah. So that has to be, and I will show you one more example after this. Shall we go on with this little? Yeah, then I will show you one more example. Evidence I have given. Daughter will be discussed reason 1, reason 2. So doing some examples and illustrations. Now,
Father.
yeah, last the topic sentence, developing supporting sentence. Daughter will be is this a problem is given reasons discussed. Problem is given present condition and medication. Reasons are given, evidence discussed. Reason 1, reason 2. Then the solution. The daughter will be cooking for him, and she needs some guidance. Is the solution. Did you see the topic sentence, developing supporting sentence, developing sentences, giving some examples and illustrations. Now,
Father.
yeah, see here, supporting sentence. See here, and she needs one condition and medication. We have gone across our paragraph structure. Is this a problem is given, reasons discussed, reason 1, reason 2, solution. First problem is given, present condition and medication. Reasons are given, evidence discussed, reason 1, reason 2. Then the solution. The daughter will be cooking for him, and she needs some guidance. Is the solution. Did you see the topic sentence, developing supporting sentence, developing sentences, giving some examples and illustrations. Now,
Father.
Yeah, last slide is.
I understand the problems where I felt it. Really, it is.
Let's see what.
Recently, I started to see your videos. It's very amazing, and I started to practice with the videos, especially the reading. For me, the reading was very difficult. Means 2 times I attended the exam, and 2 times the reading was I scored very less. I mean 280, 290. That was my range. But now I am practicing with under your guidance. I mean, under YouTube videos, it's I understand the problems where I felt it. Really, it is very amazing, and I have to really thank you for the effort you are doing. Especially the Microsoft PowerPoint and all. I know it's a very time-taking procedure to do all these things, but I don't know. I don't have any words to express my towards you.
Okay, you are welcome.
Thank you,
How you,
thank you.
yeah,
Thank
how
you
you
very
can
much.
express, how you can express gratitude is to share these things with your friends, your colleagues, so that many who are struggling.
Actually, I got. First time I'm seeing that one of your student was shared one testimony video, which just came in the Facebook. That's the reason I got to know from you. Actually, I don't know father before that. Then I was I informed to my many of friends, and one of my friend told me that after seeing the video, because she is also preparing for the OET, then after that she told me that after seeing your video, she told me that you were in her church before. It was very happy to hear that that news. When you are in a Mangalore, some areas you worked in, I think you were in the priest in that church, and she was in the member of that church. She was telling me that it was very happy to see that moment like that. So I am also sharing your videos, and I informed my friend.
Yeah, one more paragraph, one more. Let me see, give you a clear idea. Give me one sec. Anything else you want to add before that?
Actually, she expressed our feeling. Yeah.
No, you are just expressing your feeling. Yeah.
Excuse me, Father.
Please, yeah, please.
Hello. Yeah.
Yes, I'm
Father,
listening.
this
Yes.
now, yeah. Now we are doing the paragraph. So that paragraph comes under situation, right?
Yeah, comes under. I didn't get you. So. Okay. Okay.
It comes under situation. Is it so?
Yes. Situation. Yes. Exactly.
It's bar method. So
yes.
I think it comes under under
it comes under situation.
paragraph.
Then you will have background to that situation. Then request.
Father, can we teach us it bar?
Yeah, definitely. We are coming to that. Okay. Just to have the idea, I don't know whether you know this. Just listen to this also, listening practice for you at the same time writing. and you will see the beauty of a paragraph. That idea, if you have in your brain, it's easy to connect the case notes. Shall we go?
Yes, Father.
Okay.
Or failed, hope it will come back.
Excuse me, Father.
Yeah.
Father, in assessment, what we will write in the assessment according to S-bar?
According to ISMAR, what is the present situation, present assessment? How do you assess him? For example, you said as of now, what was that in Mavis Brampton? My assessment is that he is okay with his medical thing. He is no more smoking. He holds on to medications. He is compliant with the medications. Do you get it? That's the assessment. That's my assessment. Then what he requires, then we will go to request. Assessment means, as of now, what is the condition?
So he's ready for discharge or he's fit for discharge now?
Yeah, that's what. But before that, you have to say why. Means now you see about Mavis Brampton, we said he still holds on to smoking cessation.
Yes.
He is also compliant with the medication, Saiban and what is that? Nicotine patches.
Yes.
Okay, then he is ready. All things are going regular, normal. Now he is getting discharged. Now he is coming to under your care. What you have to do? You have to see for the side effects, observe for the side effects. Saiban has to be stopped after 2 weeks. Even nicotine patches and Saiban should be stopped after when the craving is over for the cigars.
Yes, Father, but assessment paragraph will be separate, no?
Yeah, that's what I said. Then the request will come.
Then
what all things you have to do.
After assessment, then request will come. Recommendation.
Yeah, then request will come. What all things you have to do? All those things. Number one, you have to go on with the what you call things. Then medical needs on social support. All those things. As of now, what is there and what you have to do next?
Yeah.
Okay. Present, as of now, he is compliant with medication and smoking cessation for him. No. Yes. The main purpose is smoking cessation. Now, my assessment is this. He is compliant with the medication regime. That is for smoking cessation. Means he takes Saiban and is also using nicotine patches. As of now, this is my assessment. Now, next paragraph, I will request them, please look for, observe for side effects of Saiban. If there is side effects, we have to stop Saiban. Yes. Even if there is no side effects, after 2 weeks, you have to stop Saiban. And nicotine patches and Saiban, both will be stopped when the craving for cigars end, extinct.
Yes.
That's my request.
Yes. Just my question was this about assessment. I mean, we have to write a separate paragraph for assessment and we will write, patient is ready for discharge or he is feeling good or he is fit for discharge, right?
Yeah. But actually, those things are basic, like you can write, otherwise it is understood. Already in the purpose we have said he is discharging. In the context we have said, after complications of pleurisy and treatment, he is being discharged now to your care. So you can mention it, otherwise it is understood.
If we will not write the paragraph for assessment, it is okay, Father.
No. You have to write, no?
We have to write.
You have to write. That assessment tells them what is the present condition of the patient. The background will tell what was the present condition. ISBAR. Okay. Situation will tell you actually what was the situation when he was admitted. Then background will tell you what was the background.
Yes.
Imagine, for example, take it like this. First one, identify the patient. Then situation. Situation is like he is very bad. He needs a lot of blood now. He needs immediate care. He needs immediate surgery. A situation. Just imagine. A situation in a emergency department or in a ICU.
Yes.
Okay. Then that is situation S. Then background. Background is he met with an accident.
That
He
what
met with an
happened?
accident. Now, what happened?
In
Yeah,
the
why
hospital.
what happened before he came to the hospital? Then you are continuing the treatment. Now, before discharging, you have to give an assessment. He's perfectly fine now. But he might need some physiotherapy support because he is not able to walk properly. His mobility issues are there. That is your assessment. Then, if there are medications you have to take in the request, you will have to continue to put up these medications. And you will have to observe his progress as regards his mobility, all those things, whatever is given in the task.
Further management.
Yeah, does it make sense?
Yes, sir. Yes, Father.
Yeah,
Now
it's
I'm
so
clear.
beautiful. Yeah,
Yeah,
it's so beautiful. Visualize it. Just visualize. See,
Father,
our brain understands visualization. You are all daily. You are coming across such situations. Now
Father,
imagine you are yeah, please.
You continue, Father. After that, I will ask.
Yeah. Now imagine there is an accident. Okay. You have to inform somebody about that accident and situation. You are really shocked. You saw a terribly disfigured figure which entered the emergency. This one, what do you call it? The first entry of the hospital, where an accident ambulance comes.
Casualty. Triage, first of all, triage.
Emergency, yeah. Casualty, whatever. Emergency. So now you have to explain to your friend or your brother or somebody, your life partner, about the whole issue. You will say who met with an accident, right? If you know the name, you will say the name, or a young man met with an accident. Okay?
Yes.
Then maybe then you will simply say, you can't even imagine the situation. His eyes were simply bulging out. And he was broken, all his legs, and both his legs and hands were broken into pieces. And all that you say, then you say, the accident, what happened? And people say, he was riding a bike and he collided with a bus, all those accident details, background.
Yes.
Background to the situation.
Yeah. Then after some time, you are treating the patient now for 3 months in your hospital. Then when next time you call your friend or your life partner, you were telling us about an accident case. How is he now? Your assessment. My goodness, I thought he will never survive, but he's able to walk. Though there is some difficulty in walking, he is able to walk. He is able to, that's your assessment, right?
Yes, Father, yes.
Now, when you send him with his family member, his wife has come to discharge him, you will tell her what all things to be needed. See that he doesn't lift so many heavy things. See that he doesn't climb the stairs. And see that he takes this medicine for 2 months. That is the request.
Yeah.
And you will also say, if you have any doubts, please contact me. You can call me or you can visit again.
Yes, Father.
Yeah, revert for any. Simply your situation. There is nothing special in OET. What you are experiencing every day.
Yes.
So try to visualize that.
Okay, thank you, Father.
ISBAR is as simple as that. I stands for identifying the patient and details, the situation, then background to the situation, then your assessment, then your request.
Yes.
Yeah, ISBAR. So super.
Father, please tell me how many paragraphs we can write in background.
Background, 1 paragraph is cool. You don't require more. You summarize in 1 paragraph background.
1 paragraph is enough. And where will become the social background, social history?
Social history, if that depends if it is relevant.
If there is a need.
Yeah, that's what I said. Today's case note, Mavis Brampton, only last 1 sentence was required.
Okay.
So usually social background, most of the things will not be required. Only in exceptional cases you take in vast. So you can include it, the social background, in the history.
Okay. After
you can club it. Yeah, you can club it as we have clubbed in the previous paragraph, medication and lifestyle changes, no? Diet.
Okay. Okay. Thank you so much, Father.
Okay.
Thank you.
You are most welcome. You are most welcome. Let me check if I can play this. Hope you are all here, right?
Yes, Father.
Yes,
we are here.
Yes, Father.
Yes, Father.
Yeah, let me check.
Yes,
something
yes,
wrong.
yes.
I think what happened to the audio? You can't hear, right?
No,
We can
we
hear
can't.
Father. Being
Audible.
It's
Audible.
One sec, one sec.
Please.
Give me 1 minute. Time to breathe in.
I believe I knew her confusion regarding the situation in ISPAR, because whenever we hear about situation, what comes in mind is the situation now. But I believe we can say in the discharge like this one, for example, situation, we write situation on admission and assessment situation now. This will be most clear, I believe. Because whenever they hear about situation, they will think situation of today.
Okay.
But in the discharge, it means situation on admission and then the assessment situation today.
Yes.
Yeah.
Did you please respond to Dr. Salafa? You will understand when the medical people speak, you understand better.
I don't know who asked the question. I couldn't see her name. But I believe this is your confusion, right? My
Hello,
dear.
respond, please respond. That's
She
a good way
doesn't hear.
because medical professionals will be able to understand you better. How do you understand? For example, when we started something like in medical,
Yes, yes,
people are just shouting at me, Father, rollout means confirm. Rollout means confirm. They would not agree at all. No, Father,
Yeah.
all our hospitals we use rollout means confirm. They will say it is confirm. Rollout means there is no problem. You cannot confirm. Right. So it was like every institute was teaching rollout meant confirm. And even in the medical hospitals all over India, they used to say it seems rollout for confirming. So
Yes.
sometimes it happens from the practice,
Yeah,
common
yeah.
usage.
Because if it was, for example, referral for assessment, you will write the situation of today. I mean, yes, the ISBAR will be different. You write situation of today for assessment, but for discharge, it will be the reverse, yeah.
Okay. Why this is very
I think you are right, madam.
Yeah.
Yeah, I also feel that way.
What confused you, right?
Yes, it is confusing.
Yeah. Because I believe there was a case, you remember the patient with pericarditis, I remember. For that one, the situation will be what happened today when the nurse visited her at home and she found her in a case of recurrence of pericarditis. Here in the situation, you will write situation of today, the assessment of your visit. But here, this letter, it is the reverse. The situation will be on admission when she was admitted to hospital, and the assessment will be your assessment today. Now, for example, he is compliant with medication, he started to quit smoking, and so forth. Yeah.
Yes. You know, ma'am, like I'm getting confused. Like the background should come before situation. In some cases, like that, I used to feel, but I don't know. Maybe I'm wrong.
So, this what is
Sometimes
called
I'm feeling that
flexibility.
background should come before the situation. Like that, I used to feel sometimes. In some cases, not all the cases.
usually background following the situation. Regarding your question, I think we can write the background in a same paragraph, but write the background of the situation first, and then if there is relevant background, for example, if the patient has got diabetes, hypertension, you will add this after the background of the situation.
Yeah, that is. Yeah, I'm confused.
Yeah, it needs flexibility,
Yeah.
right? Yeah, you need to understand the details.
Yes, yes. Thank you, thank you.
You're welcome.
Sticker, cause and effect.
Father, you are muted. You are muted.
Oh, I was muted, sorry. Right. Just listen to this. Which one? Sorry. This one. Sorry, one. I went to move it. Hope you have snacks or something with you, right?
Yes, Father.
Okay.
Yes. I'm sharing, yes. Hope it will be fine now. Is it audible?
Yes,
It's a controlling idea.
Yes, sir.
Slides is the
Very
topic. Just try to understand if you can jot down topic sentence. The topic is traveling out.
Moving.
Medication, it results in us actually drying out, and that makes the blood.
Concentrate on that is a controlling idea of the topic sentence. So that's it. Just listen to this, okay? Traveling on long haul flights is the topic. Just try to understand if you can jot down at least some words. What is the topic sentence? If you can underline or write down or type in the chat box, please do that, okay? As you listen to it. It's a small audio.
When we're traveling on long haul flights.
Is it audible?
Can't see the screen, Father.
Yes, audible.
It's just
You can't see
showing
the screen? You
Can't
can't see
see.
the screen?
Can't see.
Can see, but not yet coming. Yeah, it will come, I think.
Okay, okay.
Started screen sharing, but it's not showing.
It will come.
Let me check. Maybe network issue, right?
Maybe.
Are you able to see that traveling on long haul flights?
Yes, Father.
Yes,
You can see that.
Yes.
Yeah. Now I am
Several
playing
things happen.
audio.
First of
Can
all,
you
we're
hear the audio?
stationary. We're not moving our legs, so there's
Yes,
no
Father.
physiological
We can
compression
hear
of
but
the
can't see. Father.
Yeah, nothing to see. This is an audio.
Yes, we can hear.
Yeah, just listen what I have instructions.
Same structure. So let's see. Just listen to this, okay? Traveling on long haul flights is the topic. Just try to understand if you can jot down at least some words. What is the topic sentence? If you can underline or write down or type in the chat box, please do that, okay? As you listen to it. It's a small audio.
When we're travelling on long haul flights, several things happen. First of all, we're stationary. We're not moving our legs, so there's no physiological compression of the calf muscles. Blood tends to sit in the veins and make clot. Number two, the environment is dry. We dehydrate. We may drink some alcohol. We dehydrate even further. Alcohol is a diuretic agent. It results in us actually drying out, and that makes the blood a little bit thicker and stickier. And these factors lead to clotting. Sometimes, perhaps particularly in the economy section of an aeroplane, we may be a little bit cramped and our leg may be slightly compressed on the seat. This could further prevent blood flow back to the heart and trap blood in the leg where clotting may occur.
Okay, could you understand something? Traveling on long haul flights. Try to listen only to the topic sentence, first sentence.
When we're travelling on long haul flights, several things happen. First of all,
what was it?
Several things happen.
Yeah, controlling ideas, several things happen. Means what you have to expect next. First of all, what happens? Secondly, what happens? Thirdly, what happens, right? Several things happen means what happens first, second. Okay, listen there with that idea. When you are traveling on long haul flights, when means happen, what are they? Exactly, several things
happen. First, hydrated.
Did you get controlling idea and how it is being? Let's check with the audio now. Listen with the audio, okay? Try to understand the topic sentence, controlling idea, and how it is being explained again, supporting sentence and developing sentences. Listen, read, and if you can write down some basic points, main points, please write down. Multitasking is very, very important in OET as well as IELTS listening.
When we're travelling on long haul flights, several things happen. First of all, we're stationary. We're not moving our legs, so there's no physiological compression of the calf muscles. Blood tends to sit in the veins and make clot. Number two, the environment is dry. We dehydrate. We may drink some alcohol. We dehydrate even further. Alcohol is a diuretic agent. It results in us actually drying out, and that makes the blood a little bit thicker and stickier. And these factors lead to clotting. Sometimes.
Okay. Now I just want to clarify your repetition concept. You asked me whether it is a repetition. Okay. Now just tell me, when we are traveling on long haul flights, several things happen. This is the topic sentence. What is the controlling idea?
Several things.
Several things happen. So immediately you have to say what happens. Number one, what are the several things happen? First of all, we are stationary.
Yeah.
We are not moving our legs. What is the meaning?
Yes, stationary.
We are stationary.
Not moving.
We are stationary. So there is no physiological compression of the calf muscles. What is the meaning? We are stationary. Blood tends to sit, means stationary. Blood tends to sit in the veins, stationary. A clot, again stationary. Number two, the environment is dry. Dry is the main idea. We dehydrate, means dry. We may drink some alcohol. We dehydrate even further. Dry. Alcohol is a diuretic agent, again dry. And it results in actually drying out, again dry. And that makes the blood a little bit thicker, dry, and stickier, dry. And these factors lead to clotting, again dry.
Yes.
This is not repetition. This is a professional paragraph and audio from Cambridge University.
Yeah.
Okay. Now, this is not repetition. I'll show you the structure.
Perhaps particularly in the economy section of an aeroplane, we may be a little bit cramped and our leg may be.
Okay, now, what is the topic sentence? Then
we are traveling on long haul flights. Several things happen.
Yeah, and what is the controlling idea?
Several things happen.
Several things happen.
Yeah, several things happen. Immediately, from the topic sentence, they are going to speak about multiple things, several things, what happens during long flights. You see, the sequential expression I said, first of all, sequential expression, we are stationary. We are
See, somebody was asking for connective expressions. See here, first of all,
stationary.
First of all, then comma. That is introductory phrase. So, in the initial stage, beginning of the session today, somebody asked me how to connect the sentences. So this is the answer.
Now, this is the topic sentence. First of all, what starts from first of all, next is the supporting sentence. Means several things when you said you have to support yourself. So first of all, we are stationary. Now just try to identify the synonym or synonymous of stationary in the next sentence.
Not moving our legs.
Not moving.
Moving.
Okay, not moving. Yes.
No physiological
No
compression.
physiological
compression. Yes. The next sentence.
Blood
in the next
clot.
sentence.
Blood
Tends to
Sit. Yeah, sit. See how beautiful it is explained. Sit in veins. Then again. Clot. Right. Clot. Yes. See, the stationary is explained in the developing sentence. What is meant by stationary? The same thing happened in our previous, what do you call this one? See here, the addiction to painkillers like opioids has a much less familiar public face. Familiar public face is explained, saying that the range of people affected. Okay, there is no typical age or typical social class and so on. This explained, same thing is explained. Okay, so even again number 2, that is, what is it, number 2? Number 2 is the sequential expression again. Sequential expression. If the previous question, answer should be one of these, first of all, or number 2. The environment is dry. The environment is dry is the controlling idea. Okay, dry. Do you have similar synonyms or synonymous?
Dehydrate.
Dehydrate, yes. Dehydrate. Then
Dehydrate even further.
dehydrate even further. Then
Diuretic
agent.
as in
Drying out.
Drying out. Thicker and stickier. Thicker and stickier.
Clotting.
Clotting. See how beautifully it is arranged. This is how they explain. The same thing is explained in the developing sentence. Number 2, the environment is dry is the supporting sentence. Supporting which? Supporting the topic sentence. They said several things happen. So number 2. Now, first of all, then number 2. Now, the same thing is explained. That's what happens even in here, where we had the same thing. What is, if you don't understand much less familiar developing sentence structure. Okay, so beautifully they do it. And let's check. Okay, now topic sentence. When we are traveling on long haul flights, several things happen. That is a controlling idea. Now, supporting sentence, explanation of topic sentence. First of all, we are stationary. Several things happen, first of all. Then developing sentence illustration, we are not moving our legs. There is no physiological compression of the calf and blood and to sit, all those things. So that is developing sentence means illustration of the topic sentence. See, stationary is repeatedly the synonymous expressions are given with the same color, same taste, and same text and smell. Okay. See, when we are traveling on long haul flights, several things happen. First of all, we are stationary. The first sentence is the topic sentence. When we are traveling on long haul flights, several things happen. Controlling idea, several things happen. The focus of the paragraph. The controlling idea in the topic sentence is the focus of the paragraph. That will be explained in the whole paragraph. And list of some things that happen. Trace points one by one. What are the things? Several things happen. 1, 2, 3. So you have the topic sentence. Then you have the supporting sentence. Then you have the developing sentence. Again, you have one more developing sentence. Then you have the second supporting sentence. Then you have the developing sentence. Again, you have one more developing sentence too. That's the beauty. Okay. Topic is traveling on long haul flights. Focus is several things happen. That is a controlling idea. What are the several things happen? We are stationary. The environment is dry. And conclusion, these factors lead to clotting.
Now you see, once you are competent in this, as you go on reading the case notes, and basically you require the differentiation, I think you have no idea about the major differences between 3 types of letters. Once you understand that, then you understand the flow of the paragraph. What should be in the first paragraph? What should be in the second paragraph? What should be in the third paragraph? As I said with S bar. After that, as you read the topic, the portion of that case note, you will get this schema in your brain. This idea, this structure, this flow. We call it information flow. Every paragraph has it.
These factors, these one,
and
two
this
factors.
is the crux of every benchmark, double benchmark exams. We call it OET, IELTS, TOEFL, CBT. All these are double benchmark exams. This is the crux of every exam. For the IELTS, you require the same thing in your task 2. Definitely, every paragraph has to be written in this way in the essay. Otherwise, you will never get a score.
Lead to clotting, blood clotting.
Well, so
See,
sorry,
topic,
Father.
traveling on long haul
So
flights,
we need to
focus,
follow
controlling
this.
India, several things happen.
Yes.
We are staying.
Sorry?
Sorry to interrupt you. So we need to follow this idea in single paragraph to write the topic, topic sentences, then write the...
Except in introductory paragraph and request paragraph. Except in, this is body paragraph.
Yes.
But the introductory paragraph, already I told you what are the 4 things to be included clearly.
Yes, yes.
Sentences can be formed in any way, including these 4 things, but mindful of the purpose should be immediately apparent. Means the main purpose should be given in the first line itself. First sentence itself, if you are constructing more sentence. That's all. Otherwise, you can construct the sentence in different ways.
Okay.
Okay. This is the idea, means to get the things together in a flow. That is called the cohesion. You go to your assessment criteria, cohesion and coherence is 25 marks for you. Yeah, 25% of the marks. It's very, very important.
That makes more sense. Yes.
Actually, the students are not getting marks in these things. They are practicing and getting maximum in other aspects. If they can become competent here, it becomes very easy, and they will score in these aspects as well. That you see this schema again. 1 more minute, maybe.
Stationary. That same stationary, the word is expressed saying not moving, no physical compression, sit, float. All these words have the same taste, color, and smell of this particular word, stationary. And 2, the environment is dry, dehydrate further, diuretic, and drying out, thicker and stickier, clot. All these have the same meaning. This is synonymous expressions. Okay. So this is
then beautiful conclusion. These factors lead to floating. That is DVT, deep vein thrombosis.
Yeah.
The structure.
Excuse me, sir.
Providing
Yes,
structure,
please.
cohesion and coherence, we call it in IELTS.
I'm still.
Yeah, please speak.
Yeah, I want just to ask about this spelling of stationary. With the ERY, it's mean like the one we are using for the writing purpose. Stationary with ARY, it's we are not moving. So I don't know exactly if we write this.
Sorry. Did I make was there a spelling mistake? I don't know. You are right, but then I didn't observe that. Maybe it's all slip of mind. Sometimes when you work when you are aged. Thank you for the suggestion. Yeah. That is there. Stationary and stationary. This is more here. Stationary means not moving, stable, not the other stationary grocery items.
Yeah. So that's why I'm just
no. Sometimes sometimes it happens. It's a Herculean task to create these PPTs. See, you can create with some apps and all, but that will not be clear. Clear idea will not be given as we want it. Yeah,
so
even to create.
Which one is the stationary?
Yeah, no. This is no. The spelling mistake. Probably I made a mistake. Sorry for it, and thank you for suggestion.
Thank you so much, sir.
Yeah.
Thank you.
Probably, Thank you. And sometimes copying is very difficult from a PDF. When you copy, things move around. Yeah, sometimes it will be some portion will be image, so you can't copy it. And even that to copying those simple sentences, the case note, simple sentence, and the tense, that took so much time. Once we start, we want to finish, right? We have to copy each one. Each line and put into the box. Yes. Cool. Thank you for the suggestion. We'll correct it.
Actually, thank you, Father, because I am so happy. Because I remember I wrote such things. They told me, no, this is repetition. Don't write like this. So very clear. Yeah, I was happy with my paragraph because I followed the paragraph structure.
No, I'll give you one example. There was one particular lady, a doctor. She was so interested in correcting her letters. She was an active member here long back. And she was also simultaneously getting trained from some other institute. So she sent me one letter asking for corrections. Since she was very active, I spent some time and corrected and sent it back with the score.
Yeah.
And then she corrected all my corrections, sent it back again. Then I felt, okay, she is so much interested, so she is so active. When we find them responding well, we feel like doing something. So somehow or other, I corrected it again to upgrade. Again, I sent it to her and repeated 8 times. 9th draft was almost 450 plus. She submitted that letter to the institute.
Yeah.
They corrected it and made it to a B, almost like 290 or 300, because they were taking a format. The particular teacher who corrected was taking a letter. That sentence is not presented here, so they said there is a mistake. You understand? So sometimes it can happen. People will tell you this is not okay.
This is just our discussion in between each other, not the institute.
And people don't understand. For example, like we who are qualified from Cambridge, like we have an authenticity to teach. We are in the teaching faculty. That's why we say we. I don't use I. Usually, none of our teaching fraternity under Cambridge British Council, we don't say I. We say we. You know, we like people. Nobody can engage or employ people like me. They can't pay it in India. Definitely, maybe your countries, I don't know. In India, they cannot employ someone who is competent because they have to pay a huge amount.
Exactly.
Now,
yes.
yeah, when we give it free, people don't value it at all. No, just see. For example, Dr. Salafa will understand the list I have sent you.
Yeah.
As soon as I am working, one message will come. Then I have to add the registration number. Then I have to type the name. Then after some time, one message will come. It took so much time. 118 people. I thought maybe some may not enter. And today, almost 36 entered in time out of 118.
Hard actually, but they missed very big chance actually.
Yeah, but people don't understand. When it's free, people take it for granted. And they don't follow instructions. The problem is this: they need not follow, but we know they will not be competent. They will write again and they will fail.
Exactly.
Otherwise, we don't lose anything if the aspirants don't follow our instructions. I don't lose anything. But if you follow it clearly, if you do the task daily, if you respond well,
Exactly.
And Dr. Salafa, I sent maybe more than 10 messages asking them to confirm in a format, you remember? The country, beginner or advanced, so that I can confirm. Out of 118, I have sent them personally and in groups. Only 14 people did it out of 118. In spite of repeated requests for more than 10 times.
In our group also, I asked them, let us help Father and make our list. Some people, they send the message for me in order to extract their data. I told, this is why sometimes I write in Arabic. Because,
I understand.
So they send me the message to extract their data. I told them, please help us extract your data and let us make the list. So me also, I was struggling too much.
Yeah. And I know only one girl informed me, sorry, I could not adjust my off day, so I am not able to attend. Please give my slot to someone else. The only one girl. When I asked them I sent a notice saying that if you are not available, more than 100 registrants are there, I can allot that register number to someone else. People don't respond. That demotivates us.
Actually, very bad. Yes.
Yeah. Sometimes they don't understand. They will ask, each one will be asking, what is the time? Is it Indian time? Or each message, am I able to respond? I don't know. How can? No human being can.
Easy to ask Google. If you want to translate your local time, just ask Google. But
that's why I thought of having
Actually, this is a big problem with Sulafa. So you open a sensitive question for Sulafa because that's a big argument in our group with Sulafa in this topic.
Because of that, I developed an identity track and I spent the whole day in the ER because I was so stressed, struggling with them.
Yeah, that's why I thought of having a session like this so that everybody gets a chance to ask if they have any difficulties, they can clarify. Instead of me messaging each one, I can answer many here.
Yeah.
And those who watch later also will have that answer.
Yes.
Yeah.
Really appreciate you, Father.
Yeah.
You and
Still
Sulafa.
there. Still we have to go. Yeah. Thank you. And still we have to go with the types of letters and all. I think we'll have it in another session. No, it will be too much for you. You need real brain or solitude to understand those things. Once you understand the difference between, I'll just show you the flow, not to teach you, don't take it to brain. That will clarify most of the things. Am I sharing? Sharing, right?
Yes, sharing.
Yes, Father.
Yes, for sharing.
Yeah, sharing.
Okay, one thing that passive voice will complete 1 minute is enough. COTC antacids ineffective is the case note, that is from doctor's case notes. Over-the-counter antacids were ineffective. Okay, so all these white backgrounds are doctors. Okay, case notes. Over-the-counter, that doesn't make any difference. The simple sentence is over-the-counter. See, OTC antacids ineffective. Over-the-counter antacids were ineffective is the simple sentence. Grammar passive voice is used. Reason, because the focus is on the treatment rather than who used it. Did you get it?
Yes.
Because why passive voice is used, focus is on the treatment, then who was treated. Where is the past form of the verb be, followed by the past participle ineffective, used adjectively. I'll just show you. I will illustrate with that particular tea thing. See, listen to the steps in a simple process. You made the tea, right? This is how you make a cup of tea. It's a conversational style. You fill the kettle with water, you turn on the kettle, you boil the kettle, you pour the hot water into a mug, you add some sugar, then you can drink it. That is conversational style. But real style, you fill the kettle with water. What is the verb? Fill. The subject, you. The object, the kettle. The passive verb is filled. The new sentence will be, the kettle is filled with water. Instead of you fill the kettle is filled with water, because whether you fill it with water or someone else fills it with water, it's cool. It has to be filled with water. So that process is stressed. You turn on the kettle, the verb, turn on the kettle. The kettle is turned on by anyone. It is okay, it will boil, right? You pour the hot water into a mug. The hot water is poured into a mug. Subject is not required. Then you can drink it, then it can be drunk, or then it is ready to be drunk. So that is passive voice. Okay, we'll go back to the types. See, types of letters, I have not put it, three, this referral, discharge, and transfer. Yeah. So in that, distinctions, now I am not teaching you, okay, we'll teach you. What are the distinctions in each letter? Then the golden rule for each letter, and how do they differ in purpose and the reader and main focus. Each letter has a different purpose, different way of putting the purpose, and all the reference letters will have same way. And 90% of the letters that appear for the exams are referral letters. And you will have a different one for discharge and transfer. And main focus also you have to understand. For example, main focus of referral letter is current problem and the reason for referral. Okay, discharge letter, hospital stay is important, treatment received is important, and follow-up is important. And transfer, continuity of ongoing care is important. So those focus, pardon?
Inform letter comes under referral or
I didn't get other.
Inform letters for information, informing something about the patient or some other.
No, there is.
The pharmacist have such type of letter.
Oh, okay, information letter, informing the letter. Okay,
yes.
That is, that's a separate category. But the what we hear say requesting them, no, that's actually you are informing them, because you have no right to request them. That's the only thing you have to understand in that way. See, now for example, the registered nurse can request the community nurse. You have to do all these things. But you are, being a pharmacist, you are informing them what you have to do.
Yes. I saw some of letters in the sample. Those are like
that's only a technical thing. Yeah, what you can do is, if at all you have some connections, you can make a small group. Sometimes when I find time, I will give you the, because you don't have, you need to upgrade only 10%. 90% is same. This technicality you have to understand, where you have to use this inform, that is where instead of request. Okay. So referral letter, yeah, referral letter, you will exactly know. Oh, sorry, it's like view is not complete, right? Too
Yeah.
big.
Yes.
Why is that? Why is that? Why is that? 50, 100, let me check. Is that cool? No.
Not yet.
Something went wrong. Not yet, right?
Yes.
Is that okay?
Now it's okay.
Yeah. Now, referral letter, what these basic things you should know. What is the main purpose? Is treatment completed? Is current problem important? Do we need to include hospital stay? Briefly, all these basic ideas. So I am not teaching you now. Don't take it to your brain. Okay. Purpose. What is there in the referral letter? What should be the purpose? Exact few things are there. Only distinctions and referral letter. Who are the readers? Normally, you know who are the readers, and the situations. What will be the situations? For each letter, you need to know like this. That's all. Only 3 types. In that way, only 3 types of letters you have. Maybe the person changes and the reader changes, but the name will change of the reader, name will change of the patient, and your role will change. But it's the same. Ultimately, the information flow. You should know the information flow of each type. Referral letter, current symptoms. Then recent examination finding, recent investigation, relevant medical history, current medication, specific request. So that flow should be understood. That's all. Okay, paragraph organization, purpose, then corrective symptoms, examination, investigation, relevant history, request. So there's a flow for everything. What has to be in the paragraph, each paragraph. Okay. See, common mistakes in referral letter, where you score less, writing too much of history in the referral letter, they will penalize you. You write too much of your history, missing the referral purpose, and failing to state urgency. If you miss these 3 things, definitely you will not reach 350. Whatever else you do, however you write, if you make these 3 mistakes, you will not reach 300, 350.
Sir,
you will
I have
remain
one
somewhere
doubt.
310, 320. Maybe you have written a very good letter other than these 3 factors. You have written excellent letter. Yes, somebody was asking something. So for each letter, you have to follow this. That will do once. Timeline you have to follow. Okay. See now, referral letter, patients visit GP, problem identified, referral written, specialist receives patient. All those, these are the aspects. Then you will get back to that. Okay. Today, you know, you have no energy, I know. Yes, come on now. Somebody wanted to ask something.
Sir, if we write more than 180 to 200 words, then will it affect our marks?
No, 180 to 200 word, you are allowed. That is the limit told to you
If
in
we,
the
no,
examination.
no, sir, if we write more than 200 words, then will it affect
If you
our
write more than
marks?
200 word, it will not affect maybe 10%. You can write 220 till 20, but it will not affect provided you have not included any irrelevant case notes. Secondly, it is within 25 lines. 2 conditions. Make it clear? You can write any long, but that your letter should remain within 25 lines. After 26th line, they will not read at all. One thing. And that is the count for 200, maximum 200 words. And you should not have included any irrelevant or semi-relevant case notes.
Okay, sir.
Only relevant case notes should be included. If you have packed up with all the irrelevant case notes, that defeats the purpose of this exam.
Okay. Thank you.
Okay. Yeah. So you can go even lower than 180, even if it is 160, if you have included everything in a fine language, summarized, and nothing, no case note is left, which is relevant, and no information is left relevant, then definitely you'll get maximum marks. It doesn't mean you have to write 180 or 200. Approximately. Usually they use the word approximately, means about. Any
Excuse
other
me,
question?
25 lines. In each line, we have like 8 words, like,
Yeah.
right,
Yeah.
Fazal?
Yes.
But it's good to
Yeah, but
estimate
8.
our.
Yeah. Yeah, you can
Yeah.
you can just count 1 or 2 or 3 lines of your writing. Then take the average. Then you know what is your one line. Just count. Don't count one word because there will be long words and small words. At least 3 to 4 lines you count. For example, 4 lines you have 40 words. Divide it by 4. Then you have 10 words in one line. Then you know your 10 lines will count 100 words. 20 lines will be 200 words. 25 lines will be 250 words. Yeah.
Yes.
So you need not write even 25. 25 is not mandatory. Okay, they will read only what is within 25.
Yeah.
So if your one line contains 10 sentences, you can write only 20 lines maximum.
Okay.
Father,
Hello, Father.
Yes, please.
I noticed during the writing test assignment. I usually write the two full page.
I didn't get you. Usually write
the two page that you provide for us. I will write it full.
No, don't write full. Whatever you do, it should not exceed more than 25 lines.
Okay.
And you should include only relevant case notes. For each irrelevant case note you include, you will be penalized, like negative marking.
So, sir, we have to, before going to...
sorry, you said negative marking?
Negative marking is not there, but for each irrelevant case note, if you add in your letter, you will be getting negative marks. It's equivalent to a negative marks. You will go below score. Now you write 5 relevant notes. Case notes are constructed in the beautiful sentence. Then you write 2 irrelevant case notes. For 5 relevant case notes for writing beautiful paragraph, you might have got, imagine, 50 marks. Then when you have written 2 irrelevant case notes, you will lose 20 marks. Just a visualization, okay? It's not typically that way. Because for each mistake, you will be penalized, right?
Hello, sir.
Okay.
Okay. That is the purpose of this exam. You should not include. That's why they give you irrelevant case notes. Purposely, they give you irrelevant case notes to test your ability to understand the relevant case notes regarding one particular issue. Otherwise, they would have given only relevant case notes, right? It would have been easier.
So,
yes.
Father,
Asking it.
Before... Hello?
Yes. Yeah, please.
Before starting later, first of all, we have to read the case note and find relevant data and eliminate the irrelevant data. Then we have to start the letter.
Yes. First 5 minutes, you cannot use your pencil or pen. You can only read the case notes. You cannot touch your pencil or pen. You cannot mark anything. 5 minutes absolutely for reading. Okay?
Okay.
Maybe I think today morning I have posted a video today morning, 8:30 probably. That you can see those details. And during that time, just jump through. As I said, you have to go through all the 7 stations. All the 7 stations, what I explained today. Need not be reading very thoroughly, then later you have time. Then you make a mental picture, or on the back side of the page booklet, you have one empty page, space where you can draw your plan. Then start writing. And I told you to taught you about 2 questions. Ask the 2 questions, then you know it's relevant or irrelevant. Doctors, I have taught 3 questions. You can ask those 3 questions, then you know what is relevant, what is semi-relevant, what is relevant. If all the 3, please.
Yeah, one was asking in the chat about the August group for writing, I think.
Okay.
You have any special...
Okay. One sec. I am creating a group just now and sending you the link here.
Okay.
Only those who have at least 15 minutes a day, please join. And only condition, you have to respond to every task or notice I am giving. I can understand you have a hectic schedule, your health issues, your problems, but at least tell me that, sorry, I couldn't, or do not even say sorry. I wasn't able to do the task today. I'll be doing it tomorrow. At least follow-up should be there, 15 minutes and 1 session in a week. 45 minutes to 1 hour maximum. that much time you should have. Otherwise, please don't join this group. You can go with the general group. You can attend any of the sessions if there are slots. See, now here, like, for example, if I am taking August batch here, you will be admitted here. You can attend this session, but professional admission will be for August batch people. And they will be guided, even personally, as required. We will be looking their progress and customizing the sessions. Do you understand? Yeah. So I'll just create one group and give me one name for the group. Whoever is here, who is, one name for the group.
Special batch, OET special batch.
August
group.
Genius group.
So, yeah.
For beginners.
Genius group.
Special for beginners.
We have so many special batches. I guess.
Yeah, already we
Writing
have.
made easy for writing made easy.
Start.
Writing experiment of EduSkills.
That is too long, right? Title will be very short. Able to read.
Writing starts.
August 2026 group.
August start.
Writing made easy.
Platform free of cost. Free of cost.
August.
Just Fazal, to make it right.
2026 group.
Okay, for such people, for someone like me, is it okay to join that group?
Yeah, anybody who is interested to go with that flow, you can. But it will be little slow because beginner, like we are starting from the beginning, right? But then what we are planning, there is a confusion because very often people keep on asking where to start. I don't know. There are so many videos, how to start. So I have already, my tech team has created a new channel. Where will we go? That channel we will not upload anything, only today's thing. Then even in the application, we will be uploading the task so that if somebody want to learn, those who are in the dot batch, they can use it. And we will be going step by step.
Step by step.
Okay.
Yeah.
Everything step by step. Yeah.
And yes, Father,
we want step by step.
And I need some volunteers to assist me in that group who are learning, learners. Or if somebody wants to, I'll put it Edu August writing.
2026.
You can say step by step.
A new batch, right? Edu August.
Right.
OET.
August.
Edu OET. It's not only writing; it is all, right? You're speaking
all?
about all the modules. Edu August OET. Is that cool?
Okay. Yeah, cool.
Timing will be.
Timing will decide in the group or in the first session. We'll find out because timing is always an issue. We'll find some feasible, but then maybe exceptionally you cannot attend the session. You can watch the video. That's entirely different. But watching the real classroom. Now I showed you one video, real classroom, what was happening in Mangalore. More than 300 people attended online and nearly 60 or so offline, I believe. And there, they really understood so easily. And most of them have passed within no time. So if you, in the real face-to-face classroom, you will, if you gain 90%, just imagine. In the this session, virtual real session, face-to-face, you will get only 70%. And if you watch the videos, maximum you will get 40%, unless you are very competent. So don't depend only on videos, it will not help you. That's why we say you have to attend. Otherwise, now I have more than 1,000 sessions uploaded. I can just post the videos, but people won't get competency. People don't know how to use it. They keep on watching it and they will lose the exam.
Yes, Father.
Yeah. So you need, mentoring is required. Unless you are competent. If you are competent, maybe Dr. Saleen and all are able to manage because they have that idea now. They will be able to. But others, beginners and all, they require.
Father.
Yes. Anybody? Yeah.
Father, thank you so much about your session. It's really helpful.
I am sending. I could not complete as I wished because it was going a little slow because I wanted everybody to understand when it is long session, we need to be interactive. Then it delays a bit. Otherwise, you will be too troublesome. I am just posting it in the chat box. Only those who are not responding, we will remove them. Okay. You can definitely in the general batch and other things, but then in this batch, don't feel bad. That's the basic. Every notice has to be responded within 24 hours. Okay.
Sure.
Yeah.
I have a question, Father.
I am just posting. One sec. I just posting the. One sec. Hey, where is my chat? Yes. Yes.
Yeah.
Why? My chat is not working.
You
Can
mean
I
Zoom?
ask a question, please?
Please. I'll put
Yeah.
it in the YouTube. Okay. I'm just putting there. Hope very few people are there. I'll just put. I am not able to access the Zoom chat room. I don't know why. Oh, I'm not able to access there also. Why is that? Is it some network issue? Posting one sec. Share link. I'm coming to your question. 1 minute.
Yeah, take your time.
I'm coming. 1 sec. OET EduSkills message. I have to copy from here. Yes, saved message. Yeah. Yes. I have posted the group link. Only those who want to know step by step. Patience is the key. I have posted there. Here I am not able to post. I don't know what happened to my chat box.